I've been knowing you for long enough, damn, I need you right now. You can take your time, don't have to rush, this might take us a while, yeah. I left all the doors unlocked and you said you're on your way. When you get here, don't you say a word, got no time to play. I know you think that you know me, but you ain't even seen my dark side. It's just if you hold me, so baby do it right, do me right. We can go over time, we can move back, then rewind. When you put your body on mine and collide, collide. It could be one of those nights, but we don't turn off the lights. Wanna see your body on mine and collide, collide. Baby, it's all yours if you want me, all yours if you want me. Put it down if you want me tonight. Said it's all yours if you want me, all yours if you want me. Put it down if you want me. Let's collide.
Waking up, she on it. Good love in the morning. Get on top, my cojones. I pleasure you for the moment. This don't come with no warranty. You want it but can't afford it. My world is different than yours. Your opinion of me is glory, glorifying in all these formats. Back to Future and DeLorean. You ain't used to feeling this important. Cars imported, girls imported, insubordinate, get deported. Baby, check my inventory. Got a whole lot in store for you. Birkin. Baby, you ain't never too fly for that. I talk a lot of shit, cause I can back it up. She know I'm the shit, so baby, back it up.
We can go over time, we can move back, then rewind. You was out of reach. You was at the farmer's market with your perfect peach. Now I'm in the basement, planning on my day shit. Now you laying face down, got me saying over a beat. I'm so mature, I'm so mature, I'm so mature. I got me in therapist to tell me there's other men I don't want that, not just one show. If I can't have you, no one will. I might kill my ex, not the best idea. His new girlfriend's next out, I can hear. I might kill my ex, I still love him though. Rather be in jail than alone. I did it all for love, I did it all on no drugs. I did all of this sober, I did it all for us. Oh, I did it all for love, I did all of this on no drugs. I did all of this sober, don't you know I did it all for us. I just killed my ex, not the best idea. Killed his girlfriend next out, I can hear. I just killed my ex, I still love him though. Rather be in hell than alone.
Fucking Robitussin. I don't know why this shit got me lazy right now, yeah. Can't do Percocets on my leg. I'm turning one, trying to live it up. Get it right, baby, ooh, yeah. Ride it, ooh, yeah. Bring it over to my place. You be like, baby, who cares? But I know you care. Bring it over to my place. You don't know what you did to me. Your body lightweight speaks to me. I don't know what you did to me. Your body lightweight speaks to me.
Hi everyone! Good afternoon! Ayan. Kamusta kayo guys? Kamusta naman? Ang init no? Grabe, super init. Summer na. Ayan. Sino dito nasa bakasyon na? Charot. Ay, aminin! Ayan. Hello, good afternoon. Ayan. So for today's video, ayan, we will be discussing Recall 6, nursing practice 1 to 3.5. So yung upper half. Ayan. So short introduction lang again, I'm Shannon Felipe, UP graduate of UP College of Nursing and November 2021 board top notcher. All right. So reminder, so if ever mabilis ako or mabagal, paki-type in, okay? Pakisabihan ako so I'm aware and ma-adjust ko yung pacing. Alright? And then if ever na you have questions, ayan, type in nyo lang din. I will be checking the chat box from time to time. Kung marami bang corrections ngayon, less siya as compared to Recalls 4, okay? Pero meron pa rin na iba. Alright, na iba yung sagot sa G-form. Okay, so ayan, anticipated pain. Alright? So, okay. Ready na ba ang lahat? Yan. So, if ever may mga classmates pa kayo na wala dito, ayan, please pakasabihin sila na gora na tayo. Okay? So, Gina, let's go. Let's do this. Okay? Ayan. So, situation, Andrea underwent mastectomy of her right breast. After surgery, she was instructed to have range of motion exercises. Okay. So ano daw yung main purpose ng type of exercise na to, which is yung ROM for Andrea na nagpa-mastectomy? It is to prevent pain ba on the site of operation? No, kasi 'di ba? Kapag merong movement, mas lalo nagkaka-pain pa. So it doesn't prevent pain. How about breathing? Does it improve breathing? Yung ROM exercises? No. Kasi usually, saan nakikita tong improvement of breathing? Sang type of exercise? Usually, sa mga aerobic exercises to. Ano bang mga example, mga aerobic exercises natin? Mga swimming, yan, running, brisk walking, ano pa? Cycling, ayan. So, this is for aerobic exercises, yung pag-improve ng breathing. Okay? Yes, ayan. Okay, how about improvement of general circulation? Ay, pwede naman siya, di ba, for exercise, ano na, range of motion exercises, di ba? Movement of a specific type of joint. Yan. So, nakaka-improve naman siya ng circulation. Yan, pwede siya. So, sige, park natin yan. How about B? Prevent contracture deformity of the muscle of the right arm and chest. So, again, saan yung minastectomy? Right breast. Related dito sa right arm and chest. Ngayon, ano naman tong contracture deformity? So, sinasabi na yung contracture, ayan, so yung mga normally stretchy or elastic tissues ay nare-replace ng inelastic fiber-like tissues. So, ang nangyayari, yan, wait lang, type ko. Okay. So, kapag nare-replace siya, merong nangyayaring stiffness, ayan, and permanent tightening. Dahil may stiffness and permanent tightening, ayan, ang nangyayari, nagkakaroon ng deformity dun sa affected area. So, deformity or shortness of the muscle. Okay, shortening. Shortening. Yan. So, yun yung contracture deformity. Contracture deformity. Okay? Ayan. So, dahil nga nagpa-mastectomy si Andrea, di ba, usually may pain doon. Kaya most probably, hindi niya na yan nagagalaw. Ang nangyayari, ayan, yung normally elastic tissues na re-replace siya ng inelastic fiber-like tissues, leading to stiffness and permanent tightening na through time, nagiging deformity siya, nagkakaroon ng shortening of muscles. Okay? Ayan. So, the answer here is boy. 5, 4, 3, 2, and 1. The isotonic exercise, such as range of motion exercises, are those that are initiated by. So, sino ba dapat itong gumawa ng mga exercises? Ayan. Siyempre, si physician ba? Si nurse ba? Or ang relative? Of course, yung patient, yung nagpa-mastectomy para ma-prevent ang contracture deformity. Okay? So, 2 is apple. 5, 4, 3, 2, and 1. Number 3, Andrea needs some physical activity after operation, mainly to improve healing of which parts of the body. So, ano daw part ang body ang nakaka-improve ng healing kapag nag-physical activity si Andrea? Ayan. Yung integumentary, wala namang kinalaman yun sa physical activity. Ano? Respiratory, again, this is for aerobic exercises, not range of motion exercises na nire-recommend natin kay Andrea. Ano? So, the answer here is skeletal and muscular. Again, to prevent contracture deformity. So, the answer here is cat. 5, 4, 3, 2, and 1. A good example of isotonic exercise for Andrea's arm are the following, except. So, ano daw hindi good example ng isotonic exercise? So, let's define first what are isotonic exercises. Okay? So, sinasabing isotonic exercise kapag nag-involve ng activating muscles while moving joints and applying a constant amount of weight. Okay? So, again, activating muscles while moving the joints and applying a constant amount of weight, such as squats, push-ups, sit-ups, Russian twist, bongga, di ba, Russian twist, triceps, and biceps curl. Okay? So, yun yung example. Pero wala naman yan dito. Okay? So, ano kayang naiiba dito? Kasi except So, combing the hair, brushing the teeth, dressing up. Ayan. Usually, di ba, kapag mga isotonic exercises, such as yung range of motion exercise na banggit kanina, di ba? Yan yung paggamit ng joints. Ayan. Ngayon, ito, pwedeng ma-affect yung arm ni Andrea kung saan malapit yung breast. Okay? Not really dito sa hand niya. Diba? Kasi sa breast, ayan, affected niya dito yung sa shoulders, sa arm area. Not really dito yung affectation ng mastectomy. Okay? Closing and opening the hand. Okay? Wala naman dyan affectation sa hand. So, ang answer dito ay, yung hindi kasama ay dog. Okay? 5, 4, 3, 2, and 1. 5. When doing a range of motion exercise, it is important for the nurse to observe Andrea's. So, emphasis dito sa word na observe, okay? Ano ba dito ang mga ino-observe natin? Temperature, ino-observe ba? No, di ba? Kailangan pa natin gumamit dito ng thermometer. So, X yan. How about blood pressure? Nakukuha ba natin yung BP by just observing? Di ba hindi? So, we use a sphygmomanometer. So, X rin yan. How about RR? Do we just observe? Yes. We observe, di ba? Kapag RR, tinitingnan natin yung chest rising niya. Kung humihinga siya. Ayan. Pero ito kasi, it involves counting and measuring. As compared dito sa color of the skin, syempre makikita mo lang with your observation kung may irritation or pain na, parang redness, di ba, kumbaga. Ayan. So, ang best answer dito ay boy. Okay, so watch out for redness, which indicates irritation and pain in the operational site. Okay, 5 is boy. 5, 4, 3, 2, and 1. Situation. Client Alan, 33, is known for his asthma attacks. His asthma attacks commonly occur at the change of climate in his hometown. He was just wearing a sando, sleeveless shirt, and short pants when he was admitted to the hospital. So dito sa situation natin, establish na yung common cause ng asthma attacks ni Client Alan, and that is because of change of climate or climate change, di ba? Ang tanong, what will be Nurse Chard's priority intervention? So priority meaning pinakauna, di ba? Ayan, tingnan natin. Put him near the electric fan to assist him, in breathing. So directly, makaka-apekto ba ang electric fan sa breathing? No. So, X yan. Put him near the nurse's station so that he could be assessed often. Ang gusto natin si Client Alan kumalma from his asthma attacks. So, dito sa nurse's station, di ba, busy dyan. Hindi siya makakalma dyan. So, X yan. Okay, how about C? Place him in a comfortable environment or ask him what triggered his attack this time. Okay? Dito kasi sa situation natin, ayun nga, established na ang common cause niya, which is change of client. Okay? Mas better if we assume na yun yung dahilan also at this time dun sa asthma attack niya. Okay? So, it's best if we place him in a comfortable environment para mapakalma natin si Client Alan. Okay? Ayan. So, that is the number 1 thing we need to do muna. Okay? And then after that, we can ask him what triggered his attack. Okay? Ayan. So, 6 is cat. 5, 4, 3, 2, and 1. 7. What particular important vital sign should nurse charge monitor and report to the physician? Yan. So dito, A, B, C, and D. Anong mas related sa asthma attack? Of course, it's respiratory rate. Okay, 7 is apple. Yes, because asthma attack is a respiratory problem. Okay, 5, 4, 3, 2, and 1. Next, Client Alan knows that he will be given decongestion through inhalation. What will be the instruction of nurse charge? That he should breathe and that the nozzle, that the nozzle of the nebulizer should be mainly near his, okay, so sa nebulizer, di ba, commonly, what we know kapag nebulizer ay yung merong mask, di ba? Face mask, naka-face mask yung client. Kaya baka ang sagutin nyo dito ay nose and mouth. Pero take note that a nozzle, ayan, nozzle meaning cylindrical or round spout at the end of the pipe. Ganito siya. Okay? Yan yung example ng nebulizer na may nozzle. So, saan mo ilalagay yan? Siyempre, papasok sa mouth. So, the answer here is cat. Mouth only. Yes. Okay? Clear tayo doon? 5, 4, 3, 2, and 1. 9. Respiratory function is altered in clients with asthmatic attack. Which of the following is the cause of this alteration that nurse charge should understand in order for him to make a good nursing care plan? Okay. Ano daw yung cause ng alteration in respiratory function in clients with asthmatic attack? Okay, tingnan natin dito. Ayan, yung narrowing of the upper air passages. Ayan. So usually, di ba, kapag asthma attack, we know na nagkakaroon ng swelling, thus nagkakaroon ng narrowing of the air passages. Pero tingnan natin dito, upper air passages, yan. Okay, sa upper air passages lang ba nagkakaroon ng narrowing sa asthma attack? No. Okay, kasi usually, sa asthma attack, nagkakaroon ng narrowing ng which tube. Okay? Usually sa lower air passages yan. Wait lang. Ayan. Wait lang. So according to Mayo Clinic, itong sabi niya. Okay? The muscles around the airways contract. Yan. And the airways produce extra mucus causing the breathing bronchial tubes to narrow. Bronchial tube saan to? This is in the lower airway. Yan. Ay, wait lang. Ayan. So, kapag upper airway, it includes the nose, mouth, sinuses, pharynx, yan, upper section of the throat, and the larynx, okay, or yung voice box. Kapag lower airway naman, it usually includes the trachea, the windpipe, yan, yung bronchial tubes, and the lungs. So, mali yung apple. Okay? So, X na yan. How about B? Increased airway resistance. Nagkakaroon ba ng increased airway resistance? Ayan. Sa client na may asthmatic attack? Actually, yes. Bakit? Bakit? Kasi yung airway resistance, ayan, may mga different factors yan na nagko-contribute sa airway resistance. And one of that is the narrowing of the airway. Of course, kapag mas maliit yung airway mo, mas mataas yung airway resistance. Okay? Ayan. So, the answer here is boy. Okay? The answer is boy. This is due to the constriction of the airway. How about itong C, inadequate surfactant reaction? This is usually found in what? In the Yan. This usually happens in atelectasis kapag kasi yung surfactant, para saan ba tong surfactant na to? Okay? Yung surfactant, this is used to reduce the surface tension of the alveoli. Kapag masyado mataas yung surface tension ng alveoli, it will lead to lung collapse, which is the atelectasis. Okay? Again, kapag mataas ang surface tension of the alveoli, nag-lead siya sa lung collapse or atelectasis. Okay? Yan. Paradoxical movements of the chest. Ibig sabihin ng paradoxical, opposite movement of the chest. Ano bang normal movement ng chest? Diba? Kapag nag-i-inhale, ay nag-move out yung chest wall. Pero dito, ang nangyayari sa kanya, baliktad. Yung chest wall, nag-move in siya when taking a breath and moves out when exhaling. Baliktad siya. Opposite of the normal. So this is common in COPD or flail chest. Flail chest. Ayan. Kapag sinabing flail chest, merong traumatic injury to the thorax or dun sa rib area. Okay? Ayan. So hindi siya asthmatic attack. Alright? So X tong cat and dog. The answer is boy. 5. Yes, flail chest. 4, 3, 2, and 1. An important health teaching that Nurse Chard must give. An important health teaching that Nurse Chard must give before client Alan's discharge is. So, dapat regarding sa asthmatic attack. And, yun yung common cause niya. So, to avoid sando and shorts if the weather is cold. Napapansin nyo, this is about the attire of the client. How about boy? To use attire he is presently wearing only during summertime. Also, again, about the attire. Okay? So, paano tayo makapili dyan? Usually, kapag may mga similar answers sa board exam, ayan, dahil we just need to choose one. Most probably, wala dun yung sagot. Pero check nyo pa rin, okay? In this case, since similar lang sila, yan, X yan. C. To watch out for climate change and unnecessary exposure to elements of the environment that trigger his asthma attacks. Ayan, kasi nga, established cause ay climate change. Okay, so tama to. How about D? To be careful always because constant asthma attack can trigger complication and death. So ano sa tingin nyo ang mas okay, C or D? Yung specific sa client and individualized sa client o yung general lang na general answer lang? Syempre, dun tayo sa specific sa client natin. Okay? So the answer is cat. 5, 4, 3, 2, and 1. Very good. Situation: Nurse BJ is assigned in the OPD. He admits Sunshine, 25, who is complaining of moderate to severe abdominal pain over the right iliac region for last 2 days. This is accompanied by frequent urination. So, merong frequent urination and abdominal pain. Okay? Ang tanong dito, the first step that Nurse BJ should do is to, so sa nursing process, the first step, di ba, is assessment. Okay? So, tingnan natin dito, ano bang assessment? Ay patay, lahat sila assessment. So, anong pipiliin natin? Okay. So, dito, this is NHH, di ba? Interviewing. Etong A to C, mapapansin natin, these are all part of the physical assessment. So, anong mas una, physical assessment or NHH? According to Cozier, mas nauna dapat ang NHH, which is yung interviewing Sunshine. Okay? And then we can get the vital signs and then do the percussion and palpation. Okay, 11 is dog. 5, 4, 3. Nursing health history is NHH. Okay, sorry. Nursing health history. 5, 4, 3, 2, and 1. You're welcome. Ayan. So, number 12, an important added data Nurse BJ should have if he is thinking of a urinary problem is, okay, kanina again, di ba merong frequency in urinations client. So, additional data daw ang kailangan natin. Important added data. So, dito, may frequency in urination. So, since nabanggit na to, tsaka emphasis lang dito sa burning sensation and pain yan, di ba? Ito rin may pain. When the pain appears whether at the start or end of urination. Presence of pain on urination. So ito, similar lahat sila lahat dahil may pain. And also nabanggit na tong frequency of urination. Diba? Is that added data? Nabanggit na nga siya. Okay, so, X tong boy. Ang mas importante, more than the pain ay yung presence of blood in the urine or yung hematuria. Okay, so the answer here is apple. 5, 4, 3, 2, and 1. Excuse me. Yan. 13. An important added data that Nurse BJ, yun ulit, should ask Sunshine, should we consider the presence of gynecological problem is? So, tingnan muna natin dito kung ano yung mga gynecological related sa gynecology. Okay, occupation, hindi yan related. Age and civil status, hindi ganun ka-related, di ba? Lalo na yung civil status. Date of last menstrual period or date of menarche. Ayan. Ano bang tinitingnan natin sa date of menarche? Okay, meaning, yung first time niyang magkaroon ng mens, yung date daw nun. This just signifies kung kailan siya nag-start na maging fertile. Okay? Yung date of last menstrual period, ayan, ito naman, this signifies kung yung This actually measures or computes for the estimated date of delivery and estimated date of confinement. So, ano mas importante? Ito kasi sinasabi lang na fertile siya. Siyempre, kung may menstrual period na siya, this also indicates na fertile na siya. Pero may added component siya na may computation na ng EDC or estimated date of confinement or EDD, estimated date of delivery. So, ang best answer dito ay boy. Okay? 5, 4, 3, 2, and 1. 14. An important added data that Nurse BJ should ask Sunshine, should we consider the existence of a surgical problem is, ayan, so surgical problem, di ba kapag may surgery, ayan, merong incision. Okay, kapag may incision, anong usual na risk doon? Risk for infection. So, ano yung usually na symptoms ng infection natin? Yes, correct. Ayan, A, so fever. Okay, tama, very good. Ayan, so hindi vomiting constipation. Pain pwede, pero most common kasi diba fever. Ayan, so 14 is apple. 5, 4, 3, 2, and 1. 15. There are 2 important lab exams that could validate Nurse BJ's presumptions on the case, which are, okay, so tingnan natin. So kanina wala naman tayong nabanggit na abdominal, di ba, na problem. So X na tong stool examination. Okay, meron lang siyang abdominal pain, pero nung in-assess natin, wala namang sinabing abdominal na problema. Okay? Balikan natin kanina. Dito, merong surgical, merong gynae, and merong urinary. Wala tayong in-assess na abdominal or GI, gastrointestinal. Okay? Ayan. And dito, so urinalysis and CBC na lang yung natira, and urinalysis and vaginal examination. So since hindi tayo sure na gynecological problem siya, okay, mas maganda kung yung general yung gagamitin nating lab exam, which is CBC, okay, and urinalysis, okay? So the answer here is boy. 5, 4, 3, 2, and 1. Situation, Nurse Leah has just passed the NLE. She needs to refresh herself regarding the law that governs the practice of nursing in the Philippines. By virtue of Section 16, ayan, of the Philippine Nursing Law. Lahat ba nakabasa na ng Philippine Nursing Law natin, yung most recent? Pakibasa ha. And the first step she needs to do after passing the nursing licensure exam is to, of course, alam niyo na yan, A, take the oath of profession before the PR bond. Okay? After that, we can apply for the certificate of registration, get official copy of board rating, and apply for PRCID. Okay? Excited na ba ang lahat? Yes, excited na rin ako para sa inyong lahat. Okay? Mapapasal nyo rin yung board exam. Pero syempre, dapat mag-aral na mabuti. Okay? Ayan. 5, 4, 3, 2, and 1. 17. Which government body has the power to revoke or suspend Leia's certificate of registration or professional license should she commit unprofessional and unethical conduct in the future. So, sino ba ang merong kakayahan ng may kapangyarihan? Ibigay ang kapangyarihan sa PR Bon. Ayan. Although may PRC dito, syempre mas specific tayo dun sa Board of Nursing. Okay? Kasi si Leia, nurse siya. Okay? Ayan. 17 is Apple. 5, 4, 3, 2, and 1. 18. What Nursing Republic Act should Nurse Leia refer to? So, iisa lang yan. Ayan. Yung Philippine Nursing Act of 2002 natin, which is 9173. Okay? Etong 7164, ayan yung dating Philippine Nursing Act of 1991. Okay? Yan. Etong 9173, this is the more responsive nursing profession. The act that is more responsive. Okay. Lagay ko na nga lang dito. Wait lang. Ito yung description ng RA 9173. The act that is more responsive nursing profession repealing for the purpose Republic Act number 7164. Ayan, otherwise known as the Philippine Nursing Act of 1991 and for other purposes. Okay, repealing daw yung RA 7164. And that is RA 9173. Okay? 5, 4, 3, 2, and 1. 19, since she needs to work in a hospital to get hospital experience, which part of the nursing law should Leia focus for her safe practice? Ayan, as a novice nurse. Okay, ano ba dapat? Na section. Syempre yung scope of nursing practice. Okay? Although meron tayong nursing education and walang nursing research sa RA 9173, pati nursing personal system. Walang section about that. Meron namang nursing education, pero syempre, safe practice, doon tayo sa scope of nursing practice. Okay? Na section. So, 19 is Apple. 5, 4, 3, 2, and 1. Ako, hindi ko naman kinabisado kung ano section to, ganyan-ganyan. Hindi ko kinabisado yon. Grabe na yun, guys. Inintindi ko lang. Okay? And, ayun, ang siguro makinabisado ko lang, ano ba yung mga requirements para makapag-take ka ng board exam, ganun. Tapos, paano mo masabi na, parang anong requirements para maging board member ka ng Board of Nursing, mga ganun. Kasi nandun yun lahat sa RA 9173, okay? Yun lang siguro yung mga kinabisado ko, pero not really the sections. Ayan. Okay, you're welcome. Okay. So again, 19 is Apple. 5, 4, 3, 2, and 1. 20. When Leia eventually gets employed in the hospital, she will initially be required to utilize which of the following in rendering care to her clients. Ayan. So according to in Section 28, Scope of Nursing. Wait lang. It shall be the duty of the nurse to provide nursing care through the utilization of the nursing process. So the answer here is dog. 5, 4, 3, 2, and 1. Yes. Situation. Excuse me. Quality documentation and reporting are necessary to enhance efficient and individualization patient care. Excuse me. Nurse Gigi is assigned to Maria, who is diagnosed with diabetes. So 21, Nurse Gigi is aware that a record should contain descriptive, objective observations about what the nurse sees, hears, feels, and smells. Again, the following describes what a record ought to be. Okay. So ano ba dito? Papansin natin dito na eto mga gawa to ng nurse, diba? From the nurse tong A, B, and C. Ito, from the patient mismo. Okay, yung I wish to end my life. Eksaktong sinabi siya ng pasyente. Yung A, Maria is uncooperative as manifested by her refusal to take a bath. Ito, may halo na ng interpretation to ng nurse. Okay, so lagi natin, may interpretation ng nurse. Uncooperative daw siya based sa manifestation ng client na nag-refuse daw siya to take a bath. Interpretation. Okay, how about B? Maria appears depressed. Ito, depende na to sa nurse, di ba? Appears. Pwedeng totoo, pwedeng hindi. So, this is an opinion of a nurse. Ayan. Base sa nurse, mukha siyang depressed, di ba? Ganon. Maria is anxious, again, as manifested by her tossing in bed and disarrayed beddings. This is, may interpretation na to. Na, anxious daw ang pasyente. So, interpretation. How about yung dog? May kasamang opinion or interpretation? Wala. Kasi sinabi lang dito, again, patient states, I wish to end my life. Kung ano lang yung mismong sinabi ng pasyente, yun yung sinabi niya sa chart. Okay? Yung sinabi niya sa record. So, the best answer here is dog. Okay? 5, 4, 3, 2, and 1. 22. When documenting the intake output of Maria, Nurse Gigi should remember that she must use precise measurements to ensure accuracy. Which of the following reflects accuracy? Okay. 1. Maria drank an adequate amount of fluid during the shift. Gaano ka-adequate ang adequate, di ba? So, para maging accurate, dapat merong ml, volume mismo ng fluid dito. So, dito, accurate. Okay? How about 4? Maria's wound is large and gaping. Diba? Gano'n ka-large ang large, ma'am? Diba? So, X yan. So, dito naman sa 3, Maria's wound is 3 cm in length. Ito, eksakto, alam natin kung gano'n kahaba ang wound ni Maria, which is 3 cm. So, this is correct. How about this? Maria's intake during the shift is 360 ml. And alam natin kung gano'n karami yung intake niya. Okay, so the answer is 2 and 3. Boy. 5, 4, 3, 2, and 1. Ay, thank you naman. Ayan, thank you. 5, 4, 3, 2, and 1. 23. Another guideline for good documentation and reporting that Nurse Gigi recalls is about completion. Okay, tingnan natin. When Nurse Gigi administers medications, the following should be included except. So, ano daw hindi kasama dito? When documenting and during administration of medication. Okay? So, tingnan natin. Nursing measure taken for negative response. So, dito sa D, sinasabi dito na ano daw yung ginawa ng nurse? Ayan, kapag nagkaroon ng negative response. Should we document that? Yes. So, positive to. Patient's response, ayan, can be good or bad. Should we document that as well? Kapag nag-administer tayo ng medication? Yes. Dapat kasama yan, okay? Kasi patient-centered yung care natin, okay? How about A and B? So, dito ang pinagkaiba lang nila. Itong A, may any siya. Any, di ba? Any preliminary observations ba kung ano lang na kahit hindi related sa pag-administer ng medicines ay isasama natin sa documentation? No. So, this is yung negative. The answer is apple. Okay? 23 is apple. 5, 4, 3, 2, and 1. 24. Nurse Gigi is making a discharge plan. The items she needs to document, ayan, and report should include except. Okay. Ano daw hindi kasama sa discharge plan? Sa pag-document and report ng discharge plan. Okay? Hindi kasama. A. Needs for referrals. Kailangan ba yun ng pasyente yung referrals mo? Ayan, sa discharge plan. Yes, para, syempre, alam niya kung saan siya pupunta pagkalabas ng ospital. Kung ano yung mga resources na i-access niya in the community. Syempre, kasama yan. Nurses' observations. This is also included. Bakit? Para malaman mo kung ano yung current state ng pasyente during the discharge. Ayan. And, ano yung mga indications or yung mga indications na bakit kailangan niya pang gawin to sa labas. Okay? Yan. So, you will know what more she will need outside. How about C? Client's involvement in the care plan. Kailangan mo pa ba yan i-document and i-report? We know that this is important, yes. Pero i-document mo ba yan and report? Dapat given na to in any type of plan. Kahit nursing care plan, di ba? Hindi mo na yan dinidocument doon. So, this is negative. Patient's goals and outcomes, yan, kasama yan. Kasi in every plan, dapat meron tayong goal and outcome, di ba? Bakit pa tayo nagplano kung walang patutunguhan yon? So, this is positive. The answer is cat. 5, 4, 3, 2, and 1. Yes, pakitama na lang po. 25. Nurses are ethically obligated to information about client's illness and treatment confidential. Ayan. So, obligado daw tayo na i-treat ng confidential yung mga information ng client. The person who has legitimate access to the patient's record is the. So, kapag sinabing legitimate access, this is according to the law and the rules. Okay? Kapag legitimate access. And, according to the rule, ayan, ang may-ari talaga ng patient's record ay ang, sino bang gumawa ng record? Yung doktor. Galing sa hospital. Okay? So, yung hospital talaga ang may legitimate access to the chart. Okay? Kasi ang gumawa nun yung employee niya. Ngayon, since yung record or yung chart about the patient siya, pwedeng tingnan nyo ng pasyente with the attending doctor. Okay? So, ang pinakamalapit dito, walang hospital. So, ang answer dito ay cat, attending doctor. Okay? Kasi siya rin yung gumawa ng record na yun. 25 is cat. 5, 4, 3, 2, and 1. Situation. Alex, 15, has been complaining of sleep disturbance for the past 3 weeks. He related that he feels weak and has no vigor or strength in doing his schoolwork. He is brought to Hospital B for specialization. 26. As his attending nurse, what will be the best question to ask in order to find out Alex's cause of sleep disturbance? Okay, best question daw to ask. Tingnan natin. A. Could you tell me what you feel about schoolwork? Ito, ano to? Answerable by yes or no. So, ano siya? Close-ended or open-ended question? This is a close-ended question. Kasi answerable lang siya ng yes or no. Okay? So, kapag close-ended, ano bang mas maganda? Close-ended or open-ended? Siyempre, open-ended question. Bakit? Kasi doon, makakapag-expound yung pasyente kung ano talaga yung pinaka-concern niya. Eh kapag close-ended lang, yes or no, yung sasagot niya, di ba? Hindi mo talaga makukuha kung ano yung pinaka-concern niya doon. So, X to. This is not the best question to ask. Okay? Dahil close-ended siya. How about boy? Is there something or anyone who is bothering you in school? Again, answerable by yes or no to. This is close-ended. So, X din yan. Could you share with me any major problems that you have encountered in school? Ito, again, answerable by yes or no to, diba? So, this is X. Close-ended yan. How about you? What is bothering you in school? Answerable by yes or no? Hindi. This is an open-ended question. Okay? What is bothering you in school? So, there are a lot of possible answers to this. And, yung pinakasagot ng pasyente, yun yung pinaka-concern niya. Okay? So, the answer is dog. 5, 4, 3, 2, and 1. 27. The nursing diagnosis appropriate for Alex is. Ayan. So, ito, galing to sa Nanda. Mga definition, ilalagay ko na siya dyan. Yan. So, isa-isahin natin yan. So, teka lang ha. Lakihan ko ng onte. Ayan. So, yung insomnia, it is the inability to initiate or maintain sleep, which impairs functioning. So, may nabanggit ba sa situation kanina na may inability siya to initiate or maintain sleep? Ang sinabi lang dito, complaining of sleep disturbance for past 3 weeks. Related that he feels weak and has no vigor in doing schoolwork. So, complain lang ng sleep disturbance ang nakalagay. Okay? Prolonged periods of time without sustained natural periodic suspension of relative consciousness that provides rest. Wala daw prolonged periods ng rest. Okay? Ay, prolonged periods na wala siyang rest. Okay? Kahit na may mga tulog siya. Okay? Time-limited awakenings due to external factors. Time-limited awakening. Okay? Okay, how about D? A pattern of natural periodic suspension of relative consciousness to provide rest and sustain a desired lifestyle, which can be strengthened. So, wala namang in-indicate ang client natin na meron na siyang readiness for enhanced sleep. Okay? So, X na tong dog. So, wala rin siyang binanggit na I'm unable to start sleeping or maintain sleeping, di ba? So, wala siyang sinabing ganyan. So, between B and C's, the sleep deprivation and disturbed sleep pattern, the best answer here is, ano yung sinabi niya again dito? Sleep disturbance ang kino-complain niya. So, best answer is cat. Okay? Ayan, wala rin naman siyang sinabi na na may prolonged periods of time siya without rest. Okay? And then, related to school problem, which is a external factor. So, best answer talaga ay cat. 5, 4, 3, 2, and 1. According to Nanda, ay may tanong dito, Mami, NDX na po na insomnia. Okay, chinek ko yan. Okay, merong definition ng, or merong nursing diagnosis ng insomnia. Okay, sa Nanda. Okay, ito yung definition niya. Okay, 5, 4, 3, 2, and 1. Yung latest na Nanda yun, ha? 28. In order to help Alex go to sleep, what simple and inexpensive nursing intervention can the nurse provide considering the type of room Alex is confined in? Okay, simple and inexpensive daw. So, yung mura. Putting on dark-colored curtains. Simple? Pwede. Inexpensive? Hindi. Kasi kailangan niya pa bumili ng dark-colored curtain, di ba? So, X yan. Air conditioning, of course. Lalo na. Di ba? Lalo na yung mga naka-aircon dyan. Charot. So, eto, di ba? Alam naman natin na this is expensive. X yan. Light should be dimmed at specific time. So, this is simple. Di ba? Kasi, pwede naman natin tawag dito, i-dim yung lights. Simple lang yan. And then, inexpensive siya, yes. Mas makakamura ka pa. How about A? Room should be well ventilated. So, kapag sinabing well-ventilated, di ba, merong magandang airflow. So, this is simple and also inexpensive. Ayan. Di ba? So, ano pipiliin natin? A or B? Si Alex, may problema sa sleep. Ano mas makakatulong? Ventilation or light? Siyempre, dun sa hindi nakaka-stimulate sa kanya. The best answer is boy. 5, 4, 3, 2, and 1. 29. If Alex cannot sleep immediately, yan, which of the following can be provided by the nurse? Okay. Sleeping pill, X yan, kasi this is a dependent nursing action. Bedside story, not appropriate, not age appropriate. Ilang taon na si Alex? 15. Okay? Not age appropriate. So it's between a warm bed bath and a glass of warm milk. Okay, tingnan natin yung warm bed bath. Yan. So, according to research, marami ng research yan, nakakatulong ang warm bed bath. So, research suggests a warm bath or shower 1 to 2 hours before bedtime can help you unwind and fall asleep better. Okay, yan. Evidence-based. Yan, nakakatulong daw siya. How about glass of warm milk? Does it help? Yes, it also helps. So, sabi dito, milk is a source of tryptophan, an amino acid that can promote sleep. Wait lang. So, tryptophan, ayan, may source of tryptophan siya na amino acid na nakaka-help promote sleep. So, ano answer dito? Both of them can be answers. Pero kasi, ayun, if Alex cannot sleep immediately, ayan. So, dito, 1 to 2 hours before, nagtitake effect siya. Ang glass of milk, ilang hours before, nagtitake effect? Actually, wala pang research, okay? Wala akong mahanap na tawag ito, credible source na nagsasabi na ilang hours na nagte-take effect ang milk before makatulog ang kliyente, okay? So, wala pang research about that. Alright? No research yet on how long does it take effect. So, ang best answer dito ay dog. Okay? 29 is dog. 5, 4, 3, 2, and 1. And also take note yung milk, di ba? Ano bang milk yan? Tsaka, may mga ibang clients tayo na hindi rin naman natin alam kung lactose intolerant si client. So, since wala rin nakasulat, ayan, best answer dito ay dog, a warm bed bath. 5, 4, 3, 2, and 1. And also, ayan, ayun nga, lots of factors are involved according to different clients. Amount of milk consumed, yung amount mismo ng milk, type of milk consumed, if lactose intolerant or hindi. Ayan, maraming factors. So best answer is warm bed bath. 5, 4, 3, 2, and 1. 30. In terms of nursing care, the best help that the nurse can do is to, ayan, so with regards to sleep, diba? Avoid giving round-the-clock medications. Paano kung prescribe? I-avoid mo rin ba? No. Siyempre, yung mga medications, kaya nga siya prescribe, diba? In order, ay, for the client yun, for the benefit of the client. So, huwag tayo basta-basta mag-o-omit ng medication. Refrain from clutter at the nurse's station. So, wala namang kinalaman yung nurse's station, diba, kay Alex. Okay, so, X yan. Tsaka, hindi tayo makakapagbigay ng care, ng magandang care kung cluttered. Pero, yun nga, hindi naman related masyado to sa situation ni Alex, okay? Regarding na to sa ating mga nurses. Omit vital sign taking during the sleeping time of Alex. Ito naman, kahit natutulog si Alex, may sleep disturbance siya, importante pa rin yung mag-take ng vital sign. Okay? Yung round-the-clock vital signs, importante yan. Kaya nga, vital. Okay? So, X rin yan. So, tone down, nurse's voice is the best answer. Kasi dito, as nurses, diba, we can't control our own voice kapag nagbibigay ng, or kapag around sa client. So, that is the best answer. 30 dog. 5, 4, 3, 2, and 1. Situation, client Jimmy, 66, foreigner, admitted to the hospital due to high fever for 5 days. His temperature on admission was 37.5 Celsius, with flushed and warm-to-touch skin. Nurse Jana, who is his attending nurse, gave him a cool sponge bath. Okay, ano bang recommended kapag may fever? Diba usually it's tepid sponge bath. Pero yun, kasi nakasulat dito, cool sponge bath. Ayan. Kapag sinabing tepid, ayan, it's lukewarm water. Okay, not too cold, not too warm. Kapag tepid. Pero yun nga, yung situation, cool sponge bath. Okay? Cool sponge bath is an independent intervention of Nurse Jana aimed at, okay, kung mapapansin natin dito, may high fever si client. Tapos cool sponge bath yung ibibigay mo. May kinalaman sa temperature? Yes, okay? So, tingnan natin yung options. Alleviating discomforts of client Jimmy. Yes, it can help with the discomfort of client Jimmy, pero hindi yun yung primary purpose ng cool sponge bath natin, okay? So, X yan. Generalizing full sponge bath care to client Jimmy to, to client Jimmy, get hospital admission policy. So, dito, we're assuming na dahil sa policy daw ay ito yung dahilan kaya tayo nagbibigay ng cool sponge bath. Okay? So, hindi naman. Diverting the temperature of client Jimmy. Okay? Do you think this is the right answer? May temperature. Ito naman, normalizing the vital signs of client Jimmy. Again, ang client natin may high fever. Okay? Dapat mas specific tayo. The best answer is cat. So, yung sponge bath, yan, tepid or lukewarm sponge bath, it reduces fever by dilating superficial blood vessels. Teka. Yan. Dilating superficial blood vessels, thus releasing heat and lowering body temperature. So, yun yung ginagawa ng sponge bath. Alright? So, 5, 4, 3, 2, and 1. 32. The independent, nursing intervention to reduce temperature of client Jimmy include which of the following? Select all that apply. So, independent, tapos, reducing the temperature daw. Okay, so tingnan natin, ha? 1. Monitor temperature regularly. Independent, dependent. Independent. About temperature? Yes. So, this is positive. Offer only cold drinking water frequently. So, ito naman, pwede siyang independent. Pero, cold water naman ang bibigay mo, wala namang indicated na ganyan, okay? We can give both cold or hot, ayan, as long as with adequate fluid intake ang client, okay? So this is negative. Provide tepid sponge bath. This is a independent nursing intervention, okay? So positive yan. And about reducing temperature. Administer paracetamol every 4 hours. This is a dependent nursing intervention, so negative. Encourage wear loose clothing or cover with thick blankets. Ayan. So, opposite silang 5 and 6. Ano ang nakakatulong dito to reduce the temperature? yung 5. Kasi sinasabi na kapag ang patient exposed siya sa air, it enhances body heat loss to reduce the fever. Okay? Wait lang. So, dapat pala, no, kapag may fever tayo, ayan, ay hindi tayo balot na balot, kahit nilalamig na. Kasi, nakakatulong daw yon to reduce fever. Okay? So, encourage wear loose clothing. This is positive. And negative to. Kasi, hindi ma-enhance yung body heat loss to reduce fever dito kapag may thick blankets. Walang exposure to the air. So, the answer is 1, 3, and 5. Apple. 5, 4, 3, 2, and 1. Client Jimmy wishes to know his present temperature in Fahrenheit. Nurse Yana's answer is which of the following? Okay. So, yung computation dito, ano bang formula? It is Fahrenheit equals Celsius times 9/5. Yan, ito muna, plus 32. So, substitution, ang Celsius, ang temperature niya in Celsius is 37.5. Kapag i-multiply mo yan sa 9 divided by 5, the answer is 67.5. Plus 32, 99.5. So, the answer here is dog. Okay? 5, 4, 3, 2, and 1. 34. Client Jimmy complains. Ay, pangit. And complains of severe chilly sensation. What regulatory function of the hypothalamus describes his reaction? So, yung reaction niya ay severe chilly sensation. Okay, bakit nagkaganon daw? Okay, ano daw function ng hypothalamus yun? So, nagkaroon ng, so yung client natin, di ba? Matatandaan natin may fever ang client. Merong mataas na heat yung katawan. So, dahil mataas ang heat ng katawan, mas mainit sa katawan, ayan, and mas malamig sa labas, nagkakaroon ng severe chilly sensation or chilly sensation. And so, ang regulatory function of the hypothalamus dito ay heat production. Ayan, during fever. Okay, 34 is apple. 5, 4, 3, 2, and 1. After client Jimmy's body temperature stabilized to normal, okay na siya, he began to complain of feeling hot and finds difficulty of adjusting to the climate 2 days after. Okay, what is the appropriate answer of Nurse Yana? Okay, so si foreigner Jimmy daw, foreigner client Jimmy, ay nag-complain daw ng feeling hot and find difficulty of adjusting. Okay, tingnan natin yung option. Ano daw yung appropriate answer? Foreigners cannot adjust to hot temperature. Ito. Masyado na itong generalization. Okay, hindi lahat ng foreigners ay hindi maka-adjust sa hot temperature. So, X yan. People from cold regions have less brown adipocytes or have more brown adipocytes. So, dito mapapansin natin, opposite yung boy and yung dog. Okay? So, most probably, kapag opposite, ayan, ay iisa dyan yung sagot. Pero, lagi natin tatandaan, i-check yun ha, hindi yun lagi. Alright? Check yun. Kung meron siyang kinalaman sa question. May kinalaman ba to sa question, yung brown adipocytes? Yan. Yes. Kasi ano ba yung brown adipocytes? Yan. These are multilocular lipid storage. Yan. Teka lang. Waitan ko lang konti. And these are multilocular lipid storage cells that play a crucial role in non-shivering thermogenesis. Meaning ng thermogenesis, ayan, nakaka-produce ng heat kahit hindi mag-shiver yung tao. Okay? So, in cold regions, ano sa tingin nyo ang kailangan? More adipocytes. So, meron silang more adipocytes yung mga foreigners from cold regions, kaya sila nakaka-adapt doon sa area nila. Okay? So, this is positive. This is negative. Ayan. Okay, wait lang. Before we encircle the correct answer, ayan, see, those who live in cold places have lower metabolic rate than those who live in tropical region. This is true or false? This is false. Kasi sinasabi na those who live in cold places have higher metabolic rate. So study shows that they have an overall 10 to 20% higher metabolic rate compared to those who live in hotter geographic areas. Okay, so this is negative. The answer is dog. People from cold regions have more brown adipocytes. Ayan, para maka-adapt sila dun sa cold area nila. Okay? 5, 4, 3, 2, and 1. Ayan. 36. Nurse Susan develops patient safety goals. Ayan. What nursing goal is appropriate for safety environment? Select all that apply. Okay, tingnan natin. 1, reduce the risk for patient harm resulting from falls. Is this included? Yan, sa nursing goal natin? Yes. Kasi meron siya about the patient, about safety siya. Okay? And yan, may kinalaman siya sa environment. Okay? Pwede may kinalaman siya sa environment. So, positive. Create a clean, orderly environment of the patient. Ayan. About sa patient, pwedeng safety. Ayan, safety factor kasi kapag hindi orderly, di ba, mas, kung may nakakalat siya, pwedeng mag-cause ng injury. Okay? So, positive to. Prevent high concentration of drug errors. Ayan. So, ito naman, high concentration of drug errors. Yung drug ba, it is other than the patient, di ba? Pwedeng part of the environment siya. Okay, ng patient. Kasi other than the patient siya. Nasa environment siya. Ngayon, so since yung drug binibigay natin sa patient, it's included in the patient safety kasi we want to prevent high concentration. So this is also positive. Develop clean and simple signage for direction. Ito, may kinalaman sa safety kaagad ba? Hindi. Okay, so this is negative. Not necessarily makakatulong yung signage mo sa patient safety. Alright? So, directions pwede pa, pero sa patient safety, it's not directly affecting that. So, ang answer dito ay 1, 2, and 3. Apple. 5, 4, 3, 2, and 1. 37. Nurse Susan should prevent or reduce infectious agents primarily through the following practices. Select all that apply. Okay? Ayan. So, dapat ang pipiliin natin dito ay makaka-reduce ng infectious agents. Clean the room with antiseptic solutions. Included ba to or hindi? Positive or negative? Positive ang hinahanap natin dito. Positive or negative? No, yes. Tama, very good. Ayan, ang galing. Okay, bakit? Bakit hindi kasama to? Kasi yung antiseptic solution, ayan, they're used for cleaning skin and tissues, okay? Anong gagamitin natin na solution for cleaning the room? It is the disinfectants. Okay, for inanimate objects. Disinfectants yung usually na ginagamit. Ayan. So, again, negative ang 1. Very good. Proper garbage disposal. Nakaka-reduce ba itong infectious agents? Yes, kasi garbage harbors microorganisms. Yan. So, yung 3 naman, mandatory hand washing upon entry to the hospital. And this is also positive, okay? 2, to minimize the entry of harmful etiologic agents in the hospital. Wow, ayun. And so, syempre, di ba, through hand washing na, tatanggal natin yung mga bacteria and other microorganisms. So, kailangan yan. Improve safety administration of medicines. Ito, kasama ba ito or hindi? This is also included. Lalo na kung ang medicine mo ay antibiotic, okay? So, ang answer dito ay 2, 3, and 4. 5, 4, 3, 2, and 1. 38. Nurse Susan must comply with the policies of healthcare facilities regarding isolation precautions. The basic precaution in the hospital is, ayan, so para saan bang isolation precaution? It is to prevent the transmission of the disease. Wait lang. Transmission of infection or disease. Diba? Yung sakit. Wait lang ha. Hindi nag-type. Infection or disease. Okay? So dito, basic precaution daw. Nakakatulong ba ang pag-post ng signs of silence? Ayan. Does it directly prevent the transmission of infection or disease? No. So this is negative. Limit visitors who are within the patient's age. Yes, makakatulong yung pag-limit ng visitors in the transmission ng sakit. Pero dito kasi nililimit niya lang ay within the patient's age. So this is also negative. Private room placement. Does this help? Does this help with the prevention of transmission? Yes. Pero, ayan, since practical tayo, ayaw natin masyadong gumastos, okay? So this is negative. And so the answer is the strict utilization of personal things. Okay, bakit tayo magpa-private room placement kung pwede nang ma-prevent yung transmission with the strict utilization of personal things, diba? So ang best answer dito ay dog. Yan. Kung wala to siguro, pwede yung private room placement. Okay, pero ang tinatanong kasi basic precaution. Okay, 5, 4, 3, 2, and 1. 39. Nurse Susan includes airborne precaution in addition to standard precaution to be observed at all times. This include except, so ano daw hindi kasama dito? Limited patient transport. Is this included? Yes. And bakit? Bakit included yan? Kasi with this limiting of patient transport, we are also limiting the exposure to the air, exposure of the client, exposure of the other areas to the client na may sakit. Okay? So, positive yan. Wearing of mask and gloves, yan yung paggamit ng PPE. Kasama yan sa standard. Hand washing din. Of course, kasama yan sa precautions. And ang hindi lang kasama dito ay positioning and draping of the patients. Okay? So, hindi yan nakaka-prevent ng transmission. Usually, di ba kapag draping, this is for the privacy of the patient pa. Okay? 39 is apple. 5, 4, 3, 2, and 1. 40. To protect spreading of infection from one patient to another, Nurse Susan must not forget to wash her hands. Yan. Kailan? Before and after making rounds and endorsements ba? Itong making rounds and endorsements, di ba usually ano na to? Before and after the duty of the shift. Ayan, dun ka lang ba maghuhugas ng kamay? Diba? Hindi. So, negative yan. Before and after performing procedure and in between patient care. This is correct. Ayan, bakit? Kasi usually, di ba, when performing procedures, we mostly use our hands. So, kailangan before and after mag-wash ng hands and in between patient care. Okay? Ito naman twice, ayan, kahit once before and after lang, okay na yon as long as tama yung procedure na ginagawa. So, this is negative. Apply alcohol. So, sabi nga dito, wash hands, diba? So, X yan. Mas mabuti pa rin na mag-wash ng hands kesa mag-alcohol lang. So, the answer here is boy. 5, 4, 3, 2, and 1. Situation. One of the thrust of management is to encourage more nurses to do research in order to contribute to the improvement of the nursing practice in their work settings. A group of nurses decided to conduct a study entitled Effects of Zumba as a Form of Exercise in Promoting Wellness Among the Health Providers in the Hospital Setting. Okay, so itong effects of Zumba as a form of exercise. Yung form of exercise, diba, it just describes yung Zumba. Yung independent variable dito ang Zumba kasi siya yung may effect, diba? Sa effect saan? Sa pag-promote ng wellness. So this is the dependent variable. Okay? Ang tanong dito, which of the following is the independent variable? It is the Zumba. Okay? Yan, independent variable. Siya yung may effect. Okay? Usually, independent variable yung cause and then yung dependent variable yung, yun nga, yung effect. Okay? So, sino ba ang may effect? Siyempre, yung cause. Okay? Doon sa dependent variable. So, answer is cat. Ayan. Sana clear tayo doon. Hindi na nito. Okay? 5, 4, 3, 2, and 1. Next, which is the dependent variable? It is the wellness. Okay? 5, 4, 3, 2, and 1. 43. The research design of the study is, ayan. So, kapag sinabing descriptive, ayan. So, ito yung definition niya. It is designed to describe the distribution of one or more variables without regard to any causal or other hypotheses. Ayan. So without regard to any causal or other hypotheses. So dito sa research natin, may cause and effect tayo, di ba? May independent and may dependent tayo. So it is not descriptive. Okay? How about qualitative? Ayan, kung i-compare mo siya sa quantitative, it is interpretative based, descriptive, and relating to language. Okay? So, ayan siya. Wait lang. How about experimental? Experimental design, may tatlong elements yan. We should not forget yung tatlong elements yan, okay? Ano yung tatlong elements yan? Teka. Ito yung tatlong elements niya. So, meron siyang, unang-una, yung manipulation. Ibig sabihin lang nun, may ginawa tayo. Yung researcher may ginawa. May action done. Yun lang yun. How about control? Yung second naman is control. Yung control, yung researcher, pwede siyang pumili kung sinong grupo ang bibigyan niya ng intervention or hindi. Okay, in this case, ano yung intervention natin? Yung Zumba. Kung sino yung pagzuzumbahin niya, kung sino yung hindi pagzuzumbahin niya. Okay? Yun yung control na element. Kapag naman randomization, meron din yan, lahat yan, meron yung tatlo na yan sa experimental. Yung randomization naman, sinasabi lang dito na may, yung pag-choose niya ng mga grupo, na bibigyan niya ng intervention and hindi niya bibigyan ng intervention ay randomized. Okay? Yun yung sa experimental design. Okay? Kapag naman quasi-experimental, yan, sinasabi lang dyan na, wait lang. Meron siyang manipulation. Minsan, merong control, pero minsan walang control. Okay? So, it can be positive or negative control. Tapos, wala siyang randomization talaga. Yun yung sa quasi-experimental. Okay? So, dito, since may causal factor, ayan, and then may tinetest tayo, di ba? So, tingnan na lang natin kung quasi ba siya or experimental. Wala namang sinabi na ira-randomize niya, okay? Yung research niya. So, best answer dito is A, quasi-experimental. Okay? Ayan. Okay, 43 is apple. 5, 4, 3, 2, and 1. 44. In the cause and effect relationship, what is the independent variable? Again, yung independent, di ba? Siya yung cause. So, the answer here is dog. 5, 4, 3, 2, and 1. 45. Which of the following is the appropriate operational definition of wellness? Wellness is a state of well-being of the participants in Zumba. On their, so yung Zumba, ano siya? Physical activity siya, di ba? So, dapat yung answer natin ay may physical activity. Okay, social stability, spiritual growth, and mental balance. Walang kinalaman sa physical. The answer is cat. Physical health. Yung best answer. 45 is cat. 5, 4, 3, 2, and 1. Situation. Some teachers in an elementary school reported that a high proportion of children's packed lunches contain hot dog or tocino, sweetened drinks, and potato chips. School nurse Vivian plans to conduct health education classes among parents on how to make healthy lunches and why it is important. Okay? For this activity, this is number 46 pala. Diba? 46 to. Mali yung numbering na yun. Wait lang. Okay. Wag na palitan. 46. For this activity, Nurse Vivian considers using the behavior change approach to encourage parents to adopt healthy behaviors that will lead to improved health. This approach is popular because of the following reasons. Select all that apply. So, ito yung listahan ng mga aims and assumptions of behavior change approach. Okay? So, tingnan natin. Okay. Ayan yung aims and assumptions niya. So, tingnan natin kung included yung mga option natin dito. Encourages, views health as property of individuals. Included? Yes. Sees people as having the capacity to change your lifestyle. Included? Yes. Sabi dito, people can make real improvements to their health by choosing to change lifestyle. So this is positive. Positive yung 1 and 2. Hindi kasama dito ang assumes that if people do not act on their health, they suffer the consequences. Okay? And hindi rin kasama itong does not consider the social and environmental factors in which people live. Okay? So from this, the answer is 1 and 2, dog. Okay? 5, 4, 3, 2, and 1. 47. Nurse Vivian finally plans to conduct parents' classes using educational approach. Okay? This approach is intended to select all that apply. Right? So, sa educational approach, di ba, may pagtuturo dyan. So, of course, we provide information and we develop the necessary skills, di ba? Knowledge and skills. Positive yan. Provide change to a particular direction. Do we provide change kapag nagtuturo? No, we only provide yung knowledge and skills. Pero, depende na yun sa kanila kung gagamitin nila to make a change. Alright? So, negative to. Help people make an impulsive choice. Of course, negative statement, negative. So, 1 and 2. Apple. 5, 4, 3, 2, and 1. 48. To start the health education class and to get the parents' active participation, which of the following is the best question to ask? Okay, question ulit. And to start the health education class, ayan. A, did you cook your child's lunch today? Answerable by yes or no? Yes. Close-ended to. Okay? How about yung iba? Who among you have kids who are underweight? Ito naman, hindi siya answerable by yes or no, di ba? Pero, limited lang din yung sagot. Pwedeng sabihin ng parents, Mimi, ganyan, di ba? Ako po, ganon. So, ayan. So, close-ended rin to. Can you explain the plate method? Ito naman, masyado na tong advanced. Di ba? Magsa-start ka pa lang ng health education, pina-explain mo na yung plate method. Ano ba yung plate method? Di ba usually ito yung may recommended na distribution ng Go, Grow, and Glow sa plato ng bata. Ayan, pina-explain mo na kaagad and magsa-start ka pa lang. So, with this, pwedeng maging disinterested yung mga parents. So, X yan. It's not a best question to ask. Okay? What food do you usually prepare to your kids for lunch? Ito, open-ended siya. Kaya hindi siya kahirapan. Okay? And also, it relates it relates to the patients kung ano yung mga food na pinaprepare nila usually for their kids. Okay? We can have various answers from this question. So, the answer is dog. 5, 4, 3, 2, and 1. 49. The educational approach to health education states that learning involves 3 aspects. Which of the following is not included? So, tatandaan natin dyan, tatlo yan, di ba? Yung CAP. So, it involves yung cognitive, affective, and psychomotor. Ang hindi kasama dito ay behavioral. Okay? 5, 4, 3, 2, and 1. 50. Since your participants are adult parents, which of the following are appropriate strategies? Select all that apply. So, emphasis dito sa adult. Ayan. May sinabi siyang adult parents. Role-playing. Appropriate ba? No. Usually, this is indicated for children. So, negative yan. Group sharing, pwede? Yan, pwede. Demonstration, pwede. Return demonstration, pwede. Pero walang 2, 3, and 4. Diba? Walang 2, 3, and 4. Kisa natin tong cat and dog kasi may 1 siya. So, pipili tayo 3 or 4. Siyempre, hindi makakapag-return demonstrate kung walang demonstration. So, pipiliin natin ay apple, 2 and 3. 5, 4, 3, 2, and 1. Situation. Safety in any health agency is a must. Nurse Amy wants this to maintain in her unit. The nursing process facilitates an understanding of the scope of challenges inherent in nursing care of clients at risk for, except. So, wait lang. Nursing process facilitates an understanding of the scope of challenges inherent in nursing care of clients at risk for. So, ano ba yung merong at risk for? May at risk for infection ba? Yes. Positive. May at risk for suicide? Yes. May at risk for injury? Meron. Walang at risk for restraint. Diba? Restraint is usually, it is an intervention Used for last resort, diba? So, X tong restraint. Walang risk for restraint, okay? Because it is a nursing intervention na usually last resort. 51 is cat. 5, 4, 3, 2, and 1. 52. The clients at risk require reassessment of their status on. Ito na. Ayan. So, ano bang sinasabi ni Cozier dito? And sabi niya, when implementing nursing care, the nurse continues to reassess the client at every contact. Okay, every contact. Gathering data about the client's responses to the nursing activities and about any new problems that may develop. Okay, so kahit magtuturo ka na, mag-health teaching ka na, syempre you have to assess the patient again. Okay, kung appropriate pa ba yung ituturo mo. Kasi baka naman may ibang concern na siya, di ba? Yan. So, eto, tingnan natin yung dog. Injury. Magre-reassess ka lang ba kapag nagkaroon na ng injury yung client, di ba? No. Dapat before injury, ay mag-assess ka na. Gusto nga nating i-prevent yung injury. As necessary basis, kung kinakailangan lang ba, again, kailan nga ulit dapat mag-reassess at every contact. Hindi kung kinakailangan lang. So, negative yan. Daily basis or shift basis? Ano ba dito yung nagpapakita na may every contact, yung mas madalas? Once a day or once every shift? Of course, once every shift. So, shift basis. Okay? Shift basis is the best answer. Then daily basis, once a day. Alright, 52 is apple. 5, 4, 3, 2, and 1. 53. When a patient is placed in a bed rest, the nurse must watch which part of the body most. So, kapag sa bed rest, ayan, ano ba yung part ng katawan natin na usually in contact with the bed? It is the liver ba? No. Hindi rin head, hindi rin legs. It is the skin. Okay? 5, 4, 3, 2, and 1. Magtaka ka kung liver, di ba? 54. The nursing practice standards which Nurse Amy must let her staff follow includes except. Yan, may except. So, negative yan. B. Use infection control practices that prevent or control transmission of the pathogens. This should be included. So, positive yan. Risk elements should not be modified. Yan. Is positive or negative? Ano ba yung mga risk elements? So, excuse me, gaya ng elements ng, ano yung pinag-usapan natin kanina, yung experimental. Excuse me. Experimental design, di ba? Experimental design, ano ba yung may mga elements pa? Yung negligence and malpractice, ayan. Yung mga elements nila, pwede bang i-modify yun? Pwede ba bang tanggalin yung breach of duty, yan, sa elements ng negligence or malpractice? No, di ba? So, it should not be modified. Di ba? So, this is, ano to? Positive, negative. This is positive. Okay? Dapat naman talaga hindi minimodify yung mga risk elements. Okay? Ano ba yung mga risk elements muna? May 4 yan. Dito na lang sa baba. There are 4 risk elements, yung context, action, conditions, and consequences. So, they are fixed and not modified. It determines if there is a risk. Okay? So, positive yan. Boy, implement emergency measures during fires and disasters. Of course, positive yan. Ayan. Okay. How about A? Use a multidisciplinary approval to enhance client safety as indicated. So, kailangan mo bang munang magpaalam sa lahat ng mga disciplines, ayan, sa lahat ng mga professions to enhance client safety? No. Okay? So, negative yan. The answer is apple. 5, 4, 3, 2, and 1. Ay, wait lang. Saan yun? 54? Situation. Mr. BC confined in the ICU in a provincial hospital for some complications of his type 2 diabetes. He is edematous and complained of severe chest pain. His vital signs are BP 160/98, so mataas. Temperature 37.2 normal. PR normal 90. RR mataas 30. So takip niya. The order of the physician is for immediate intubation. For the priority equipment, supplies, ayan, and material to be used for the procedure, the nurse should collaborate with. With the OR ba? Nandun ba lahat ng mga equipment and supplies na kailangan mo? Ayan. No. Okay? Diba sa OR, dun lang nagsisurgery. Pero kumukuha rin sila sa CSU or Central Supply Unit ng mga equipments, materials, and supplies. Okay? Anesthesia department, usually nandyan yung mga anesthesiologists, of course, di ba? Emergency department, dito pumupunta yung mga clients na may mga emergency cases from the community. Okay? So 55 is boy. 5, 4, 3, 2, and 1. 56, morning care had to be done by the nursing student. So, ikaw, nursing student, di ba? Sa nursing student, dapat ba ikaw gumawa niyan? Paano kung wala ka? Sinong gagawa niyan? Di ba? So, X yan. Because not all the time, di ba, nandyan ang nursing students. Tanggal na rin tong all of the options kasi walang nursing student. So, is it the staff nurse or the nursing aide? So, yung staff nurse, wait lang, ano po muna yung morning care? It usually involves the bed bath, di ba? Bed bath, ano pa? Yung changing of the linens, di ba? Sa morning care, ginagawa. Sa morning, ginagawa. Kaya yung staff nurse, usually in the morning, anong ginagawa yan? At 8 a.m., they have to prepare the medicines para i-administer ng 8 a.m. Okay? So, yung morning care, pwede na natin ibigay yan sa nursing aid. Okay? Hindi naman to, tawag doon, invasive, di ba? Hindi naman invasive ang morning care. So, pwede yang i-delegate sa kanila. So, 56 is dog. 5, 4, 3, 2, and 1. Yes, routine procedures. 57. Inasmuch as you have not been trained in initiating intravenous infusion, who among the following cannot also do it? Yung intravenous infusion, this is invasive. Again, sino yung hindi pwedeng mag-invasive? Yung nursing aid. So the answer is cat. Okay? 5, 4, 3, 2, and 1. Yung charge nurse, staff nurse, and physician, dapat marunong yan. Okay? 5, 4, 3, 2, and 1. 58, turning Mr. BC every 2 hours would be difficult if you do it alone. In order to keep the patient safe, the most number of nurses who can team up with you will be. Okay, so anong sabi ni Cozier dito? At least 2 to 3 additional people are needed to perform turning safely. Okay? Ayan. So yung sinasabi kasi dito, the most number of nurses. So the answer should be 3. Okay, dog. 5, 4, 3, 2, and 1. 59. If Mr. BC would be for dialysis and you need to bring him to the dialysis unit, who among the following could be the best to help you wheel him to the area? Okay. So, ang situation dito, di ba, usually, yung kliyente galing siya sa ward. Okay. Nandun yung nurse and syempre, before going, bibisitahin siya ng doktor. Okay. So, silang tatlo pupunta sila sa dialysis unit. Okay. Okay, ngayon, wini-wheel na ni nurse si patient. So, since kasama nila si doktor, ayan, pwedeng si doktor yung tumulong mag-wheel sa patient to the area. Okay? Ayan. So, the answer should be physician. Alright? Yung mga kailangan lang sa dialysis unit. Okay, physician, nurse, and syempre, yung pasyente, yung i-dialysis. So, 59 is cat. 5, 4, 3, 2, and 1. Situation. Applying Theracom skills is vital in the nurse-client relationship. Which of the following is the best sequence daw ng communication techniques to use during assessment interview? Okay. Tingnan natin dito. Ayan. So sa BND, sabi dito, giving information, providing information. Kapag ba nag-a-assess ka, magbibigay ka na ba kaagad ng information? Yes or no? Ba't na nag-chat? Yan, no. Bakit? Bakit hindi? Kasi, syempre, when assessing, hindi mo pa alam kung ano yung buong picture ng status ng kliyente. Hindi mo pa alam kung ano yung mga hindi niya alam. Okay? Ayan. So, X yang boy and dog. Boy and dog. X. Ayan. So, tingnan natin yung A. Giving a broad opening and moving to asking focus questions. And from broad to focused. How about C? Asking focus questions and close-ended questions. Again, anong mas okay? Closed-ended or closed-ended or focus-ended or open-ended? Siyempre, mas maganda muna ang open-ended. Tapos, dun ka nang mag-focus kapag okay na. Okay? Mag-move forward ka dun sa focus question. So, the answer is apple. 5, 4, 3, 2, and 1. Very good. 61. You're caring for Malu. 16. Suffering from acute leukemia. You want to actively listen to her concerns and understand her meanings. You know that active listening is used to kapag ba nag-active listen ka lang, matitreat na kaagad yung medical problems ng kliyente mo? No. Diba? Sana all ganito, nag-actively listen ka lang, matitreat na yung problema niya, diba? So, hindi naman realistic to. So, X yan. Recognize the issue that is most important to the client. Pwede. Help the patient become dependent. And gusto ba natin maging dependent sila sa atin, mga nurses? No. So, X rin yan. Make conclusions regarding the client's perception. Ito naman, diba? This is, sino gumagawa nito? Nurse. Wait lang. Nurse rin naman to. Pero, ano mas okay? Yung makita yung most important sa kliyente or mag-make ng conclusions kapag nag-listen. Syempre, patient focus tayo. So, mas maganda kung malaman muna natin kung ano yung mas importante sa kliyente. Okay? Before tayo make ng conclusion. So, 61 is boy. 5, 4, 3, 2, and 1. Yes, ang gagaling na, ang gagaling. 62. You ask your newly admitted patient, what can we do to help you? Yan. You know that this open-ended question will, ano ba? Result in a specific information. Open-ended nga hindi focus-ended, diba? This is for focus-ended. So, X yan. Allow patient to elaborate on his response. Yes, diba? Kapag open-ended, diba? Marami kang pwedeng answers na makuha. And so, the patient can elaborate. Okay? C, allow patient to briefly answer the question. Briefly answer, this is for close-ended. So, X yan. Put patient at ease. Ito naman, pwede siyang effect ng open-ended. Pero, ayun nga, effect lang siya ng pag-elaborate Okay? Indirect effect siya. So, the best answer is boy. 62 is boy. 5, 4, 3, 2, and 1. Ayan. Pagkapatak ng 3:30, mag-short break tayo. 63. As you listen to a patient, okay, listen. You need to provide feedback that is, okay? A, behavior focus and evaluative. Check yung evaluative. Ayan. Behavior focus ba dapat? No, dapat actually content focused. Okay, not behavior. Hindi mo sisitahin yung behavior niya, pero kung yung content mismo, okay? Not really about the behavior. Kasi baka ma-offend si client. Okay, well-timed and general. Dapat focus tayo, hindi general. So, X yan. So, the answer here is well-timed and content focus. So, if-focus mo yung content more than yung ginawa niyang behavior. Okay? 5, 4, 3, 2, and 1. Which of the following is true in relation to the use of in relation to the use of humor. Humor should focus on the client's humanity ba? Ito naman, okay, ano bang nakakatawa sa humanity? Diba? Parang dark humor to. So, negative. Humor is used to build rapport. Pwede to, diba? Lalo na kung ang patient ay bago lang. So, this assists with bonding and reducing level of stress, diba? Kapag bago pa lang napasok sa ospital. How would see constant use of humor can be healing? So, sinasabi naman na humor can reduce negativity, emotional stress, and physical discomfort, but not really totally heal. Okay? So, hindi siya nakaka-heal talaga ng medical problem ng pasyente. So, negative yan. Laughter increases neurotransmitter. This is actually true. Ayan, it increases, ano bang neurotransmitter? Serotonin, endorphins, ayan. Pero, it also decreases yung cortisol na neurotransmitter. So, negative to. Okay, the best answer is boy. 5, 4, 3, 2, and 1. Okay. Situation, patient Alex, 3 years old, was brought to the clinic by her mother due to earache and low-grade fever. While performing her physical assessment, Nurse Hazel found patient Alex's right ear to be inflamed and warm to touch. The pedia ordered eardrops to be instilled to the affected ear. 65. Nurse Hazel performs further physical assessment on patient Alex before drug administration, which includes the following, except, so ano daw hindi kasama, before drug administration. A, syempre, kailangan natin i-assess ang appearance of the pinna and the meatus of the ear. So, yung outer structures of the ear, kailangan yan i-assess. So, positive yan. Presence of the interference during drug administration. Again, anong sabi? Before drug administration. So, this is negative. Of course, we have to assess the type of ear discharge and the location and extent of inflammation to the ear. So, the answer here is boy. 5, 4, 3, 2, and 1. Ayan. So, 3:30 na. Gusto niyo bang mag-break na or wag muna? Short break. Okay? And then after an hour and 30, yun na yung long break. Break daw. 100 daw yung sa iba. Sige, how about the others? Mamaya na po. Break po. Okay, 2, 2 na. 3, 2. Yung iba. Okay, mas marami ang break. Eh, baka parang equal. After 100 na po. Pwede 5 minutes break. CR break. Okay? Magsi-CR break lang din ako. Alright? 5 minutes. Balik ng 3:35. 5, 4, 3, 2, and 1. Ayan. Balik ng 3:35. Hello, 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 hello. Ayan. So let's continue. Okay. So 66, the most appropriate nursing action before instilling eardrops to Alex is to, ano ba ang appropriate action before instilling eardrops? It is to, tingnan natin, clean the outer surface of the dropper. Actually, we should really ensure na clean yung dropper na gagamitan, di ba? Ayan. Ang unhygienic naman kung hindi clean ang dropper na gagamitin. Pero yung outer surface ng ears dapat ang i-clean natin. Alright? So negative, X yan, negative yan. Fill up the dropper with no more than 1 millimeter. Actually, according to Kazir, ang sabi niya, fill up the dropper partially. Walang sinabi na actual amount. Tsaka, syempre, depende to sa dosage ng doktor. Okay? Ayan, so X yan. Refrigerate the medication for 30 minutes. Ayan, bakit hindi kailangan i-refrigerate ang medication? Or bakit hindi recommended yon? Kasi, ayan, this may make the client feel discomfort or pain. Alright? So, ang best answer dito ay apple. Check na medication to be within room temperature. So, 66 is apple. 5, 4, 3, 2, and 1. 67. In instilling any drugs to the ears, Nurse Hazel performs in sequence which of the following steps? Ayan. So dito, ito na, according to Kazir, ito yung steps when administering the ear medication. Alright? So, pakibasa yan. Later on, paki-screenshot to. Alright? So, ano ba yung una dito? Allow the drug to flow. Tilt the head away from the nurse. Of course, syempre positioning muna. So, this is 1. Ano yung pangalawa? Number 2 is wait lang. Ano yung pangalawang gagawin? Instill. After positioning, we have to instill the eardrops to the affected ear. And then, pangalawa, allow the drug to flow to the ear slowly. Next is to, syempre, put a small cotton loosely into the ear. Bakit? Because this helps retain the medication when the client is up. And then, syempre, yung last, wait 15 minutes before instilling the drops to the other ear. So, ang answer dito ay boy. 5, 4, 3, 2, and 1. 68. After instilling medications to the right ear, what is the most appropriate instruction to the mother? Okay? So, ano bang instruction dapat? Advise the mother not to let Alex drink hot water. Hindi naman indicated yan. Okay? X. Have the patient remain in the position for 1 hour. Dapat ba 1 hour? Ilang minutes dapat? Ilang minutes? 5 minutes lang ang kailangan. So, X yan. Napakatagal na ng 1 hour. No? Paka-cotton clutch tightly. X yan. Dapat loose lang, di ba? Para hindi mag-spill over yung medication. So, the answer here is apple. Remain in the position for 5 minutes. Okay? 68 apple. 5, 4, 3, 2, and 1. 69. In administering otic medication, Nurse Hazel, ano ba dapat gawin? Don the gloves. Ito, gagawin lang to, or indicated lang to kapag ang drainage ng ears ng client ay infectious, okay? Pero kung hindi, pwede naman na mag-perform lang ng hand hygiene, okay? So this is the answer. Explain procedure and postpone? No, okay? Wag pala decision. Check identification band and proceed. So ito, given naman na to dapat, okay? So 69 is boy. 5, 4, 3, 2, and 1. 70. On the other hand, Nomer notices that the chief nurse executive has charismatic leadership style. Which of the following behaviors best describe this style? Okay, so kapag sinasabing charismatic, yan, may power din yan, di ba? Yung power, usually it comes from self. Siyempre, sa tao, kung sino yung may charisma. So, charismatic leaders make the followers feel at ease in their presence. They feel that they are in good hands whenever the leader is around. Okay, yun yung charismatic leadership. So, ano yung sagot dito? Matches his leadership style to the situation at hand. This is situational leadership, diba? Ayan. Uses visioning as the core of leadership. This is transformational. Transformational. Yan. Mali pa spelling. Okay. And then next, acts as he does because he expects that this behavior will yield positive result. Anong type of leadership to? This is democratic. Okay? Kasi, Ayan, naka-emphasize sa democratic style of leadership yung ability ng leader na maka-create ng positive relations in the organization. So kahit anong gawin niya, ayan, it will yield positive results. So the answer here is apple. So this is charismatic. Kapag nag-possess siya ng inspirational quality that makes the followers get attracted of him and regards him with reference. Okay? From the word itself, di ba? Kapag sinabing may charisma siya, di ba? Hindi mo ma-explain masyado, pero na-attract ka sa kanya. So 70 is apple. Sana all, di ba? 5, 4, 3, 2, and 1. Ay, wait lang. Ayan, 71 to ha, hindi 90. Ayan, 71 yan. One leadership theory states that leaders are born and not made, which refers to which of the following theories? Ito naman, sinabi ni Aristotle, okay? And, anong tawag dito sa theory nito? Great man theory. Okay, na, yun nga, sinasabi niya na, pagkapanganak, they are leaders already. Hindi yan ginagawa. Kaya, great man. Okay, 5, 4, 3, 2, and 1. Situation. Terry, 15, high school student, visited the clinic because she suspects that she is pregnant. Her pregnancy is confirmed by the school physician. Terry requested Nurse Zenaida not to tell her parents about her being pregnant. She also expressed desire to terminate pregnancy. Okay? Which of the following ethical concepts apply to patient Terry's case? Kapag sinasabing bioethics, okay, this is the, ayan, wait lang. The study of ethical, social, and legal issues that arise in biomedicine and biomedical research. Okay, ano example niyan? Mga organ donation, cloning, ayan, and euthanasia. Kapag naman sinabing intuitionism, it is a notion that people inherently knows what's right or wrong. Okay? Okay. So, yung A and D, X yan. Kasi dito, sa situation, ayan, dinidetermine natin yung, most probably, dinidetermine natin yung rightness or wrongness ng mga action ni Terry. Okay? So, X yan. So, kapag sinabi natin deontology, ano bang ibig sabihin yan? It is the rightness or wrongness of actions themselves. Okay? Yan. So, base sa ginawa ni Terry, kung masama ba siya or hindi, depende siya mismo dun sa ginawang action. Instead of examining any other considerations. Kapag naman teleology, ano ibig sabihin yan? The rightness or wrongness of an action is the rightness or wrongness of actions by examining its consequences. So, nakadepende pa sa magiging result yung kung tama ba or mali yung action na ginawa ni Terry. Okay? So, nakadepende siya sa consequences. Pero kasi dito, kung mapapansin nyo, si Terry, ayan, wala siyang regard sa consequence. Okay? So, ang answer dito ay boy. Okay? The answer is boy. Kasi wala siyang regard sa consequence. Ang palatandaan ko dito, kung saan yung may regard sa consequence, ay ito, D and T, diba? Alphabetical na mauuna yung dog kesa sa T, diba? So, dito natin tinitingnan yung consequence sa teleology. Okay? Yan. Kasi yung consequence, diba, sa dulo pa yan, sa effect pa yan. Okay? So, 72 is boy. 5, 4, 3, 2, and 1. 73. Nurse Zenaida should be guided by the steps in helping Terry make an ethical decision. Sequence the steps below. Okay. So, in making an ethical decision, of course, we have to first identify kung may problema ba. Okay. So, this is the first one. 3. Yan. And the next one, we have to gather the data already. And then, after gathering the data, tingnan natin kung ano yung mga options or alternatives natin. And dun lang tayo mag-make ng decisions. And then, syempre, sa dulo, dun na tayo mag-act and assess yung result or outcomes of the decisions. Okay? 5. Ayan. So, answer dito ay, matang pangit ng 5. Ang answer dito ay apple. Apple ba? Wait. Yeah, apple. Okay, mauna kasi yung 3. Okay, 73 is apple. 5, 4, 3, 2, and 1. The initial advice of Nurse Zenaida to patient Terry is which of the following? So, syempre, kung mag-a-advise ka as a nurse, di ba? Kailangan morally right. Okay? A, Terry will inform her teacher about her condition and to request the teacher to tell the parents. Ayan. Terry will request the doctor to inform the parents, or Terry will choose a significant other close to the parents to be the one to relay about her pregnancy. Okay, so sa A, B, and C, ayan, similar sila. Diba? Gumagamit sila ng ibang tao para mag-inform sa parents. So, ang best answer dito ay dog. Ayan, advise her that as a minor, her parents should be duly informed about her pregnancy. Okay, so sinabihan mo lang na, Terry, kailangan na na malaman ng parents mo kasi minor ka pa. Okay, di ba? Tama naman yun. So, 74 is dog. 5, 4, 3, 2, and 1. 75, Terry analyzed the advice of Nurse Zenaida and realized the value of life and family. This attitude of realization is termed as, so kapag sinasabing justice, this is equity of resources. Diba? Ethics naman, ayan, moral principles that govern a person's behavior. And kapag justice ulit is equity of resources. And kapag autonomy, the right to refuse or choose. Okay? Kapag values clarification, ayan, ito yung definition niya. It is a psychotherapy technique that helps an individual increase awareness of any values that may have a bearing on lifestyle decisions and actions. Okay? This provides an opportunity for reflection on personal moral dilemmas and allow for values to be analyzed and clarified. Okay, so dito si Terry na realize niya yung value ng life and family. So the answer is dog, values clarification. 5, 4, 3, 2, and 1. Patient Terry's decision regarding her pregnancy is termed as, so dito yung may decision making. That is autonomy, the right to choose or refuse. Justice, again, is fairness, veracity, truthfulness, fidelity, promise keeping. Okay, 76 is apple. 5, 4, 3, 2, and 1. Situation, Emma, 65, just been widowed a year ago. Her 2 children are now all living in the US. She used to love cooking, but since she is now living alone, she eats meal irregularly. Most of the time, she just watches television. Her chief complaint is constipation. Okay, when assessing Emma, Nurse Alma should ask the following except, hindi kasama dito na i-assess dapat? Dietary, kasama ba to dapat? Yes, kasi may constipation si client, so positive to. Lifestyle, of course, di ba? Yung activity, it may also affect the bowel movement, okay? That may lead to constipation, so positive yan. Of course, the bowel pattern, kasi nga may constipation siya. Yung complaint niya is constipation. So, ang hindi kasama dito ay cultural belief. 5, 4, 3, 2, and 1. 78. When auscultating the bowel sound of Emma na may constipation, the nurse should be able to hear. Okay. Kapag ba may constipation, may loud and gurgling sound, tsaka increased bowel sound? No. Okay, kasi di ba kapag constipation, may decreased bowel sound lang. So the answer is cat. Ang absent bowel sound, this indicates what? Paralytic ileus. So sa paralytic ileus, ayan, may halt in peristaltic activity as a result of extreme irritation from obstructive peritonitis or unknown reasons. Kaya di ba may halt in peristaltic activity? So walang maririnig na sound. Okay, that is in paralytic ileus. So the answer is cat. 5, 4, 3, 2, and 1. Yan. 79. The most appropriate nursing diagnosis for Emma's case is, ayan. So ito, diba, risk, diba? Sinabi niya na may constipation daw siya. Chief complaint niya is constipation. So wala nang risk. Okay? So ano na lang dito? Perceived constipation, dysfunctional gastrointestinal motility, or constipation related to inactivity. Ayan. So ito yung mga definition niyan. According to Nanda. Okay. Ayan. So kapag sinabing constipation related to inactivity, infrequent or difficult evacuation of feces. So wala naman siya sinabing regarding sa evacuation of feces niya, no? C, increased or decreased. Ayan, decreased. Diba kanina sabi natin decreased peristalsis or lack of peristaltic activity with gastrointestinal tract. Tama. Self-diagnosis of infrequent or difficult evaluation combined with abuse of methods. Wala namang abuse methods, okay? So the best answer is cat. 5, 4, 3, 2, and 1. 80. Which of the following are the most simple and cost-effective interventions that a nurse can advise Emma to resolve constipation? 1. Encourage increased fiber in the diet. Yes, this is correct because this increases peristaltic activity. Okay? Encourage physical activity and regular exercise. Okay? Again, this is positive kasi nakakatulong siya with increasing the peristalsis. Regular time for elimination. Kasama yan. Positive yan. Okay? Kasi ayaw natin na nagpipigil si client. Laxative. Cost-effective ba to? No. Kasi kailangan pa bumili ng gamot. So the answer is 1, 2, and 3. Apple. 5, 4, 3, 2, and 1. 81. Health education should include which of the following? Responding to the urge to defecate and establishing a daily pattern. Yes, this is correct. And we want to establish the reflexes. Okay. Role of dietary fiber and fluid in maintaining bowel function. Yes, kasama yan. Role of exercise and activity in maintaining bowel function. Also included. And dito kasama, safe and correct use of pharmaceutical agents. Kasi, ayan, we don't want the patient to depend on medicines or drugs, okay? So the answer is 1, 2, and 3. 5, 4, 3, 2, and 1. Lalo na pwede naman siyang gumamit ng dietary fiber and fluid and exercise, okay? 5, 4, 3, 2, and 1. Situation. Obesity is an emerging concern for patients and nurses. The nurses has an important role in assessing and evaluating patients' physiological status in relation to weight control. So 82. Nurse Sherry is assessing patients at the OPD. Which of the following patients at risk for health complications related to weight? Okay, so tingnan natin. A 33-year-old who has a body index of 24 kg per meter squared to. Okay? Bakit meter squared? Kasi, ang computation for BMI is, ito. Wait. Ayan. So, weight in kilograms divided by height squared. Height in meters squared. Okay? Ayan. So, given na yung BMI niya dito, titingnan na lang natin sa chart. Since Filipinos are nasa Asia Pacific region, so ito yung titingnan natin. 24, saan yan? This is overweight. Client is overweight. Okay, overweight. Ayan, isulat natin. How about boy? Boy, so compute natin yan, ha? Ayan, so ang kilogram niya is 68 divided by, ano yung height niya, 180 centimeters. I-convert mo yan sa meters, magiging 1.8. Okay? 1.8 squared. Okay. Kapag i-compute nyo yan, the answer will be 20.99. Okay? Kapag i-square nyo muna yung 1.8 ha, 1.8 times 1.8. Tapos doon nyo i-divide. 68 divided by yung sagot nun. Okay? The answer will be 20.99. Ano to? This is normal. Okay? Normal siya. Next, ito naman, kapag compute nyo, the answer will be 21.48. Okay? And, ano yung 21.48? It is also normal. Ayan. Normal yan. How about ito? 24-year-old female with waist measurement of 30 inches and a hip measurement of 34 inches. Okay? Dito na yung papasok sa waist ratio. Paano ba computean ang waist hip ratio? Waist hip ratio equals waist divided by hips. Okay? So in this case, equals, let's say ang waist niya ay 75. Ayan, 75 ang waist niya divided by 85. The answer will be 0.88. So ano yung 0.88 dito? Female yung client natin, 24-year-old female. This is already at risk siya. Okay, greater than 0.85. So, at risk si client. Usually, this is for cardiovascular diseases. Okay? So, ang tanong dito, Which of the following patients is at risk for health complications related to weight? Ayan, nakasulat na, at risk. That is dog. Okay. 5, 4, 3, 2, and 1. 83, a patient who has been consistently following a diet and exercise program and successfully losing 1 pound weekly for several months is weighed at the clinic. However, he has not lost any weight for the last month. Nurse Cherry should first, unahin, ADPI, di ba? Nursing process, assess muna. Review the diet and exercise guideline. Instruct the patient to weigh weekly and record the weights. Discuss the possibility that the patient has reached a temporary weight loss plateau. These are all interventions already. Okay? Asking the patient whether there have been any recent changes in exercise or direct patterns. This is assessment. So the answer is apple. 5, 4, 3, 2, and 1. When working with an obese patient who is enrolled in behavior modification program, which nursing action is appropriate? Okay, so tingnan natin dito. A, having the patient write down the caloric intake of each meal. Okay? Immediately ba makakatulong to sa behavior modification? No. Okay? Ito naman, suggesting the patient has a reward after achieving a weight loss. Encouraging the patient to eat small amounts throughout the day. Ayan. So, nag-suggest ka lang, nag-encourage ka lang. Ayan. Makakatulong ba yan? Mas makakatulong ba yan sa patient? No. Okay. How about dog? Asking the patient about situations that tend to increase weight. Mas makakatulong to sa kanya. Why? Kasi if na-identify niyo na yung mga situations na nag-increase ng, na nag-tend to increase the weight niya, ng appetite niya, wait lang. Asking the patient about situations that tend to increase appetite. Ayan, kung malaman niya ng client yung mga situations na mag-i-increase yung appetite niya, di ba, nagkakaroon ng self-awareness dun sa mga situations na yun na kailangan i-manage, okay? That may lead to behavior modification. So the answer is dog. Okay? 5, 4, 3, 2, and 1. 85. When developing a weight reduction plan for an obese patient who is starting a weight loss program, which question is most important for Nurse Cherry to ask? Okay, so again, mga question na naman. Okay, what factors do you think led to your obesity? So, ang focus ito ay ang factors na lead daw sa obesity ng client. Okay? So, remember, weight reduction plan to for the obese patient. Have you been on previous diets? So, ito naman, focus nga ay previous diets. Okay? And then, what kind of physical activities do you enjoy? Okay? Yung diet and yung physical activity, isa lang to sa mga factors na nakaka-lead sa obesity. Okay? Diba? So, pwedeng yung factors under niya na tong B and D. Okay? How about B? How long have you been overweight? Ito naman, ang focus niya ay duration ng overweight niya. So, ano mas makakatulong? Yung factors or yung duration? Siyempre, yung factors. Okay? Knowing about the factors can address the problem. Okay? 5, 4, 3, 2, and 1. Ma'am, kapag behavioral modification program, maganda po ba, di ba, kung reinforcers? Can you expound on that? Okay? Kasi, yun nga, ito kasing diets and physical activities, there are also factors na. So, umbrella, answer siya dito. Sa 84, ma'am. Wait lang. Okay, so 85 is apple. 5, 4, 3, 2, and 1. Dito, 84, boy. Enrolled in behavior modification program. Balikan natin to, okay? I-check ko yung reinforcers. Okay, 84 and P1. Okay? Okay. So we can proceed. Kasi i-analyze ko pa yun. 86. An obese patient asked Nurse Sherry about using Orlistat Senecal for weight reduction. Nurse Sherry advises the patient that, okay, kapag Orlistat, this is a lipase inhibitor, ayan, used, dito na lang, okay? Ayan. Use with a doctor-approved exercise behavior change and reduced calorie diet to help lose the weight. Okay, so mas effective ang Orlistat kung meron siyang behavior change. Okay, kaya ng exercise, change in the lifestyle, diet, ayun. Okay, so tingnan natin. Ano yung i-advise ni Nurse Cherry? So weight reduction drugs of any type are used for only those who do not have the willpower to reduce their intake of food. Okay, so so yun nga, this drug is used for those who can do exercise, behavior change, yan, yung diet program. So, opposite siya. So, this is wrong. How about C? This drug can cause serious depletion of fat-soluble vitamins. Is this true? Actually, hindi naman sinasabing serious depletion yung mangyayari, okay? Sinasabi lang na it can reduce the absorption of the fat-soluble vitamins. Hence, ayan, sinasabay yung pag-take ng multivitamins when taking Orlistat. Okay? Ito naman should be used only for several weeks. Malito kasi it can be used for several months. Okay? Ayan. The long-term effect of Orlistat is not known. Actually, it's known. Yan. And the drug may cause serious side effects such as heart valve problems. Sinasabi pa nga na yung Orlistat, ayan, it reduces the risk for myocardial infarction, stroke, and heart failure. Okay? So this is wrong. How about A? A drug may help in weight loss, but weight gain is likely to recur unless changes in diet and exercise are maintained. So, this is the correct answer. Okay? 86 apple. 5, 4, 3, 2, and 1. Situation. Nurse Kat is the head nurse of the male medical ward in a tertiary specialized hospital, handling multiple cases in her unit. It is imperative that she is equipped the basic managerial skills. Ayan, sa kaso ha. Ayan, wait lang. Wait lang. Okay. All right. So basic managerial skills. 87. In this conflict resolution method, a person ignores his or her own feelings about the issue in order to agree with the other side. So ito parang nagpapatalo siya, di ba? So ano ulit yung conflict resolution method na yun? It is accommodating. Okay? Okay. When you say collaborating, this is the win-win conflict resolution method. Okay? Merong paggamit ng assertion and cooperation. Ang priority ay yung common goal. Okay? Win-win tong A. Yung confronting mo lang, ganyan na, conflict resolution method. Okay, this is win-win. Ay, win-win. Win-win. Lose, ano ba yan? Win-win. Win-win. How about withdrawing? This is also called avoiding. Okay? Avoiding, this is the lose-lose naman. Lose-lose. Lose-lose. Okay? So again, yung accommodating, ayan, parang nagpatalo. Opposite of competing. One party sacrifices his or her beliefs and allows the other party to win. So this is lose-win. Lose-win. Okay? 5, 4, 3, 2, and 1. 88. With this method of conflict resolution, each side gives up something as well as gets something. Okay? So, saan yun dito? Meron siyang nawi-win, pero meron din siyang nalulose. Okay? This is in compromising. Okay? Each party gives up something if it wants and also gets something. Ayan. Kapag naman avoiding, again, this is lose-lose. Both parties lose. Yung negotiating, all conflict resolutions are negotiating, okay? Kapag naman competing, ayan, this is win-lose. Kapag competing, wala siyang pakialam dun sa other party kung matalo siya. Alright, so again, 88 dog. 5, 4, 3, 2, and 1. Hindi, kapag lose-lose, avoiding yun. Okay, kapag compromising, each side gives up as something, parang compromising, nag-compromise ka, di ba? May na-win ka, pero at the same time, may na-lose ka rin. Kasi nga nakipag-compromise ka. You meet halfway. Okay, 88 dog. 5, 4, 3, 2, and 1. 89. Nurse Cat feels uncomfortable believing that she is the scapegoat of everything that goes wrong in her department. Which of the following is the best action that she must take? So kapag ganito, ayan, uncomfortable siya, she feels like a scapegoat daw. Ayan. Ang best action ba ay mag-quit na lang? Quit her job and look for another employment. Quitting is never the answer. So, kung gusto mo mag-grow, ayan, huwag ka mag-quit, di ba? Harapin mo yung problema. Pero kung ayaw mo naman, di mag-quit ka, pero best action ang hinahanap natin dito, di ba? So, X yan. Seek the help from the director of nursing. Ayan. So, agad-agad, director of nursing na, di ba? Doon ka magreklamo. So, X yan. Disregard what she feels and continue to work independently. So, ayaw naman natin i-disregard yung feelings ni nurse. So, X rin yan. So, ang best answer dito ay A, identify the source of conflict and understand the points of friction. Okay, 5, 4, 3, 2, and 1. 90. Which of the following is a characteristic of decision making? Okay, so A, it only involves logical rational thought. Ha? Diba minsan, we also take into consideration yung emotions natin when decision making. Okay, so it's not only all the time. Right, so X yan. It is often the result of many incremental steps rather than one large step. This is positive. Okay, kasi hindi naman tayo bigla-biglaan. Isang bagsak, decide na, di ba? May mga iba't ibang factors, may mga step-by-step process tayong ginagawa. See, it must always be done quickly in the healthcare setting. So, dapat mabilisan lagi? No. Okay, so X rin yan. They generally do not assume another person's point of view. So, when deciding, kaya mo ba lahat alamin yung point of view ng lahat ng tao? Hindi. So, we generally assume another person's point of view. Okay, the best answer is boy. 5, 4, 3, 2, and 1. Which of the following is true about effective creative thinkers? They seldom generate new ideas and alternatives. Kapag sinabi mong seldom, di ba, madalang lang. Eh, yung mga creative thinkers, syempre, madalas silang nakaka-generate ng new ideas and alternatives. So, this is negative. Ihanap natin positive. They often say, we've always done it this way. So, let us do it this way again. So, parang paulit-ulit yung ginagawa nila, no? Creative ba yun? No. So, negative din to. They tend to analyze the components of the problem. This is positive. Bakit kailangan gawin to? Para makaisip sila ng tama at creative na paraan. Okay? To solve the problem. Yan. Kaya kailangan pa rin i-analyze. They generally do not assume another person's point of view. Parang unrelated to in being creative. Okay? So, the answer is cat. 5, 4, 3, 2, and 1. Situation, Nurse Beth, working on a hospital's pedia unit. She is assigned as a medication and treatment nurse. In preparing to give medications to a preschool-aged child, which of the following statements is an appropriate interaction by Nurse Beth? Okay, dito, okay, tingnan natin na. Let me explain about the injection that you will be getting. Kapag mag-explain ka na, magtuturo ka na, this is appropriate in what stage of development? Usually in school age, okay? Yan. And then, dito sa C, would you like the medication with water or juice? Kapag nagbigay ka ng choices, this is appropriate for, most appropriate for toddlers. Okay? If you don't take the medications now, you will not get better. Ito, mali to kasi non-therapeutic siya. Nananakot siya. Yan. So, best answer dito ay boy. Kahit na, parang close-ended siya, do you want to take your medication now? Ayan. It is more appropriate for the preschool age. Kasi sa preschool age, anong stage of development and by Erickson? It is the initiative versus guilt. So, para hindi mag-form ng guilt ang client natin, we have to involve them in the care. Okay, pa-decidean natin sila. 5, 4, 3, 2, and 1. 93. To determine proper drug dosages for children, calculations are most precisely made on the basis of the child's So usually ginagamit natin in calculating the dosage, usually weight and body surface area yan. Pero ano ba ang most precise dyan? Kapag kinocommute natin ang BSA, ang ginagamit natin ay weight and height, di ba? So instead of just weight ang kunin natin, you have to take into consideration also yung height in the BSA. So this is the most precise, okay? Yan. 5, 4, 3, 2, and 1. Next, 94. Nurse Bet administered to the IM medication of iron by the Z-track method. This method is used too. Ayan. So, also, according to Kazir, siya. So, by leaving a zigzag path that seals the needle track, this technique prevents drug leakage into the subcutaneous tissue, helping seal the drug in the muscle and minimizes skin irritation. Okay, so ito yung, paano ba ginagawa yung Z-track technique na yan? We have to retract the skin, yan, before injecting. So, retract muna and then inject, push, ayan, and then, after that, okay, we have to allow the skin to return to its normal position. Wait lang, diba? So, after pushing, ayan, pwede na nating ilabas and then, while doing that, pwede na nating i-return yung skin to its normal position. Okay? So, ito yung Z-track ko. Di ba may Z-track kayong nakikita dyan? Wait lang. Z-track, ayan. Kasi dito, natatrap yung gamot. So, it prevents skin irritation or irritating the sensitive tissues. The answer is cat. Okay? 5, 4, 3, 2, and 1. 93. The doctor ordered to give a 1-year-old patient an IM injection. The appropriate and preferred muscle to select for this child is the, yan. So, ito yung 1-year-old, kunyari. Ayan. So, usually, ang ginagamit na muscle dito ay yung vastus lateralis kasi usually walang major blood vessels or nerves sa area na to. And at 1-year-old, or kapag less than 1-year-old, this is the largest muscle mass. Okay? So, ini-inject dito yung gamot sa middle third. Okay? So, ang answer dito ay dog vastus lateralis. Okay. 5, 4, 3, 2, and 1. Nurses are expected to be leaders, making difference in the healthcare settings, hospitals, clinics, communities, and other organizations. Why leadership plays a vital role in the nursing profession. Okay? Tingnan natin. It is not really important for nurses. Tama ba ito or hindi? Mali. Kasi kaya nga natin pinag-aaralan yung leadership dahil mahalaga siya, di ba? And being a nurse. Okay, how about dog? Nurses should always strive for higher position in organization. Ito naman, babasahin nyo, di ba? Syempre, ang goal naman talaga natin in a profession is to grow. Ayan. Pero, it's not the primary purpose kung bakit nandyan yung leadership. Okay? Kung bakit tayo tinitrain yung leadership. So, explain yan. Nurses should know how to direct people towards accomplishment of the goals. Tama naman to, di ba? One function of management is directing. Okay? How about yung boy? Nurses have expert knowledge and are interacting with and influencing the clients. So, ito naman, this is correct as well. So, between B and C, ano yung best answer dito? The best answer is boy. Kasi in cat, hindi lang naman directing yung function ng leaders, di ba? Meron pa yung planning, organizing, staffing, controlling, di ba? Hindi lang naman directing. So, it's more than, yung ginagawa ng leaders, it's more than that. And yun yung ang dahilan doon ay dahil tayo yung nakikipag-interact and nakaka-influence mostly sa clients, diba? Nasa frontliners tayo. And dahil doon, kailangan natin magkaroon ng expert knowledge. So, the answer is boy. 5, 4, 3, 2, and 1. Nomar understands that the theory which states that leadership style is dependent on the situation. Which of the following styles best fits a situation when the followers are self-directed, highly motivated, experts, and matured individuals? Dito, ang mas may control ay ang followers daw. And so, that is laissez-faire or permissive. Okay? Laissez-faire or permissive. Kapag naman participative, this is usually democratic. Democratic siya. Directive, authoritative to. Okay? Bureaucratic. Ano naman yung bureaucratic? This is acting based on strict rules and regulations. Okay? Usually, walang human element yan. May authority and responsibility are clearly defined, which leads to efficiency and simplicity of relationship. Okay, so again, the answer is cat. 5, 4, 3, 2, and 1. Difference ng autocratic and authoritarian. I have to, that, clarify muna ha. Later during the break. 5, 4, 3, 2, and 1. 98. Nomer would like to be a transformational nurse. Which of the following statements best describes this type of leadership? Okay, kapag transformational, yan, tingnan muna natin yung option. Possesses innate charisma. Ano to? Charismatic. Okay, charismatic. Charismatic. Ayan. Pangit, ang pangit ng sulat. Gosh. Charismatic. Okay. How would C maintains full trust and confidence in the subordinates? This is laissez-faire. Laissez-faire. Serves the followers rather than being served. This is servant. Leadership. Uses visioning as the essence of leadership. This is transformational. So the answer is Apple. 5, 4, 3, 2, and 1. 99. Grace RN, head nurse assigned at the ICU of a secondary level hospital. As a manager, Grace is expected to display effective conflict resolution skills. Which of the following is true about conflict? So ano yung totoo tungkol sa conflict? It discourages creativity and innovation. Wrong. Di ba kapag may change, mas dun lumalabas yung creativity and innovation. Okay, automatically negative ba ang conflict? No. Hindi rin siya automatically positive, ha? Ayan. So the answer is, so this is wrong, yung cat. Hindi siya automatically negative. It hides differences in values or actions. This is actually correct. Yan, tingnan natin mamaya kung bakit. It seldom occurs as part of the change process in healthcare settings. Madalang lang ba? No. Madalas tong conflict, okay? As part of the change process. Alright? Okay. Yung automatically negative, automatically positive, mali yun. Kasi it depends on the situation. Alright? Kung positive or negative siya. So again, the answer is boy. Bakit? Kasi ito yung definition ng conflict. Kung mapapansin nyo, nakasulat na siya dito. Ayan. Generally defined as the internal or external discord that results from differences in ideas, values, or feelings between two or more people. Ayan. So, 99 is boy. 5, 4, 3, 2, and 1. 100. Conflict that occurs between groups or teams is called. Kapag interpersonal, this is between two or more people. Ayan. Kapag naman intrapersonal, conflict is within self. Kapag organizational, within organizations, and often reflects departmental differences. Ayan. So, between departments or teams. Dysfunctional, sinasabing dysfunctional yung conflict kapag nadadamage na yung employee relationships, hindering organizational progress. Okay? So, ang answer dito ay between teams at 5, 4, 3, 2, and 1. Okay, class, gusto nyo na mag-break? So, since nag 5 minutes tayo kanina, 10 minutes. So, or gusto nyo 15 pa rin? Balik tayo ng 4:30. 4:30 na lang. 4:30 p.m. Okay? One to 4. Ayan, 1 to 4 BACD. Thank you. 15 minutes po. 15 minutes? O sige, baka yung iba mag-early dinner. So sige, 4:35 final. 4:35 p.m. Yes, welcome. Okay. Hi guys, 4:35 na. Wait. Wait lang, share ko lang yung screen ko. Ayan. Kanina yung nagtanong about difference of authoritarian and autocratic. Ayan. So kapag sinabing autocratic, wait lang, share ko lang din dito. So lahat may benefit. Okay. And kapag sinabing autocratic, style of leadership siya, yan, where power and authority are in the leader or concentrated in the leader. Pero kapag authoritarian yung leadership, dominating style siya, ang focus niya ay dominating style, tapos generally has negative implications. Okay? Kapag may negative implications na, authoritarian. Pero kapag ang pinag-uusapan, power and authority, na concentrated lang sa leader, autocratic yung tawag doon. Okay? Ayun. How about, teka. Yes. How about ito naman? So kanina may nagsabi, yung B daw, suggesting that the patient has reward after achieving a weight loss goal. Tama naman yon, reinforcing factor siya. Pero, actually, lahat siya, factor. Lahat ng mga options na to ay factor regarding the behavior. Yung A, having the patient write down the caloric intake of the meal, of each meal. Di ba regarding skill to of the patient? So, pwede siyang pumasok sa enabling factor. Yung ito rin, yung encouraging the patient to eat small amounts throughout the day. Di ba? Pwede siyang enabling factor. Itong D naman, this is predisposing factor. Gusto niyo ba i-type ko yung meaning nung isa? Take isang yun. Wait lang, ha? Oo, mas strict yung authoritarian kasi may negative na eh. Domineering style siya. Kapag power yung pinag-uusapan at centered lang sa iisa, sa leader, yun yung autocratic. Ayun. So kapag ganun yung atake natin sa question, lahat siya factor talaga na nakaka-affect ng behavior. Okay? Pa-SS daw lang. Ito, yan yung ano. Meaning. Ayun. So kapag yun nga yung atake natin, ay same sila lahat nakaka-affect sa behavior. Yung A is enabling factor, yung B reinforcing factor, yung C enabling factor, yung D predisposing factor. Okay? Pero kung i-analyze natin yan isa-isa lahat, ayan, mas importante pa rin na malaman yung situations. Kaysa kung magsasuggest ka lang ng, ay, effective daw yung magbigay ka ng reward after achieving a weight loss, di ba? Ayun. Doon tayo sa, parang situation. Ayan, parang yung root cause, di ba? Doon tayo pupunta. Kapag, mas pipiliin natin yon, malaman yung root cause, kung bakit kaya may increased appetite. Tapos from there, doon tayo magpaplano. Okay? So I hope clear tayo doon. Ayan. Wait lang. Kasi, ang haba neto. So siguro picturean ko na lang, tapos send ko later yung meaning ng predisposing factor, enabling factor, and reinforcing factor. Okay? Sa page 191 siya sa Maglaya. Okay? So later na lang after class. Okay? So let's proceed with NP2. Ayan. Situation, Nurse Maha continues to expand her roles by actively participating in the activities of the health center in collaboration with the Department of Health. Which of the following is not included in the child health programs of the DOH? Ayan. So ito yung mga listahan. Ito yung listahan ng child health programs ng DOH. Okay, and hindi dyan included ang adolescent screening. Okay, kasama yung EPI, dental health, and micronutrient supplementation. Okay, 5, 4, 3, 2, and 1. Okay, next, breastfeeding is the most essential feeding for infants that has nutritional, immunologic values, and maternal advantages for the mother. Exclusive breastfeeding during the first half year of life is an important factor that can prevent, ano bang prevent niya? Cancer ba? Heart disease? Agad-agad, di ba? Hindi. Mental disorders, wala pa namang mental disorders sa mga baby. Diba? So, ang answer ay infant and childhood morbidity and mortality. Okay, 5, 4, 3, 2, and 1. 3. Rona, G1P1, second postpartum day. She asked Nurse Maha about the definition of exclusive breastfeeding. Nurse Maha responds based on his knowledge that exclusive breastfeeding means, okay, di ba kapag exclusive breastfeeding, dapat breast milk lang. So breast milk only. Okay? Drops or syrups consisting of vitamins, mineral supplements, or medicines should not yet be given until the 6th month of life if not needed. Okay, so the answer is dog. Kasama kasi ang vitamins, mineral supplements, or medicines, okay? Sa only. Ayan. So, 3 is dog. 3 is dog. 5, 4, 3, 2, and 1. Page 191. 4, the following are the benefits of breastfeeding to the infants except, ayan, provides a nutritional complete for the young infant. This is positive. Hanap natin ay negative. Strengthens the infant's immune system and preventing many infections. Positive. Safely dehydrates. Yan, mali. Dapat we want to rehydrate, diba? And provide essential nutrients to the child. So this is negative. Increases IQ points. Positive. So the answer is cat. 5, 4, 3, 2, and 1. 5. During a ward class in the OB ward of community hospital, a mother asked the nurse regarding the benefits of breastfeeding to the mothers. The nurse's best response would be, so ano daw ang benefit ng breastfeeding? It increases the risk of ovarian and breast cancer and osteoporosis. Malito kasi it decreases nga the risk of cancers and osteoporosis. Okay, so negative to. It provides artificial methods of delaying pregnancies. Artificial method ba? Yung pinaprovide ng breastfeeding? No. Ano yung natural method na yon? It is the LAM, yes, lactational amenorrhea method. Okay, very good. B, it reduces the woman's risk of excessive blood loss after birth. Yes, this is correct. Paano nangyayari to? Diba, in breastfeeding, nasa-stimulate yung hypothalamus in producing oxytocin. And yung oxytocin, we know na nakakatulong yun mag-contract ng uterus. Okay, dahil contracted yung uterus, na there's no risk for bleeding. Okay? So the answer here is boy. Kasi hindi naman siya nakaka-increase ng risk or for excessive blood loss after birth. Okay? 5 is boy. 5, 4, 3, 2, and 1. Situation. The Field Health Services and Information System is recording and reporting system in public healthcare in the Philippines. The following are the objectives of FHSIS except, so ang hindi kasama dyan ulit ay kasama itong provide standardized facility level database, minimize recording and reporting burden, ensure data recorded are useful and accurate, disseminated in a timely, easy-to-use fashion. Hindi kasama dito ay complete the picture of acute and chronic disease. Okay, 6 is apple. 5, 4, 3, 2, and 1. Ay, nag-add ng page, teka. Ayan. 7, as a nurse, you should know the process of how this information are processed and consolidated. The fundamental block of the FHSIS system is the, syempre alam na natin to, family treatment record. Yung second fundamental block is the target or client list. Yung report and forms, ito yung mechanism by which the data is transmitted from one facility to another. Yung output record naman, ito na yung consolidated report from the Provincial Health Office. Okay? Paano din na-disseminate ang output record? Pataas or pababa? Yung nakakaalam ba dito kung paano din na-disseminate ang output record? Pataas? Pataas? Actually, it's both. Okay? Pataas papuntang DOH and pababa papuntang RHU, Rural Health Units, Barangay Health Stations, or Health Centers. Okay? So, both siya pataas and pababa. Alright? So, 7 again is apple. 5, 4, 3, 2, and 1. 8. The Monty Field Health Service Activity Report is a form used in which of the components of the FHSIS. So, ano ulit yung pwede nating itali? Ay, pwede nating sagutan ng weekly, monthly, quarterly, annually, and upon occurrence of events. That is the tally report or the reporting forms. Okay? So, 5, 4, 3, 2, and 1. Okay, in using the tally sheet, the recommended frequency in tallying activities and services is the, so ito, again, it can be done weekly, monthly, quarterly, annually, and upon occurrence of events. So kapag yung events mo ay daily, syempre, dapat daily ka rin. Okay? So 5, 4, 3, 2, and 1. 10. To monitor clients registered in long-term regimens such as the multi-drug therapy, which component of the reporting system will be most useful? Okay, ano daw yung mas makakatulong? Ito yung, di ba may listahan tayo ng mga participants in each program. So yun yung sa target or client list. Isa rin sa mga purpose nito ay to facilitate the monitoring and supervision of services. Okay? Yan, monitoring. So the answer is CAT, target or client list. Dito pala, yun nga, nakalista yung mga pasyente under each program. Okay? So that is the target or client list. 5, 4, 3, 2, and 1. Situation. Nurse Oscar takes care of the Ramos extended family who resides in the house owned by Nilda's mother, Marta. Nilda tends a variety store and is married to Ramon, a government employee. They have 4 children, Lester, 20, Gina, 18, Alex, 15, Celine, 12. Lester is a working student of his second year in computer technology course. Gina is a high school graduate. Alex is in third year high school, and Celine is in grade 6. There's 1-year-old baby girl who is the daughter of Gina. Gina, however, could not pinpoint the one who sired her child, inasmuch as she had multiple sex partners. This angered Ramon, her father. So 11, though he recognizes the remorse of his daughter, Ramon still feels confused regarding the situation. He said he tried his best to support his family and had always been considerate and kind. He and his wife would always give them reminders and advise calmly and never in a nagging manner. But still, they failed as parents. The possible nursing diagnosis of Nurse Oscar of his family is, so, ayan. So, ano dito? Yung D, ineffective role performance. Ito naman, this states, it is a state in which a client experiences a disruption in the way he or she perceives his role or performance. So, meron daw disruption, type natin. Merong disruption, so there's positive disruption in the way patient perceives his or her performance. Ayan. So this is applicable to Mario. Okay? Kasi nga, ayun nafe-feel niya pa rin, na-confused siya and failure as a parent. Okay? This is applicable to Mario. Pero sino ulit yung hinahanapan natin ng diagnosis? Yung family. Alright? So this is negative. Parental role conflict. Wala namang sinabing conflict in roles dito. Okay? So this is also negative. Impaired parenting naman, ayan, kung mapapansin nyo dito sa situation, ayan, sabi dito, he tried his best to support the family, always considerate, kind, always giving reminders, advising calmly, never in a nagging manner. So that is not impaired parenting. So this is also negative. Interrupted family process happens. Ayan. This is a state where a supportive family experiences a stressor. So supportive family experiences a stressor that challenges its previous functioning. Okay? So, applicable dyan yung family. Kasi, yung stressor nila, posible yung nanganak si Gina. Okay? Yan. So, answer is apple. 5, 4, 3, 2, and 1. Nurse Oscar's conversation with Gina revealed that the young woman still suffers from a syndrome of failure. Failure to complete one normal growth and development. Failure to complete education, failure to establish a vocation and become independent, and failure to have a life. Ayan. So, the Nurse Oscar's intervention to this problem is linear approach. Yan, linear approach meaning step-by-step process with regards to the individual. Yan, in the context of the family, community, and culture that will combat shame and guilt. Okay? Lay down the foundation of a future by trusting human association and developing mutually trust initially with the nurse and the family and eventually the whole community. Ito naman, future-oriented siya. Okay? So, di ba sa board exam, as much as possible, yung ngayon na. So, ekestong boy. Focus on the factors that will help protect Gina towards a proximal stimuli for healthy growth and development to develop resiliency in confronting current and future problem. So ito, nakafocus naman siya sa factors. Ito kasi nakafocus sa combating the shame and guilt. Right? How about D? Transform interactions about family members, strengthen specific roles and functions to strengthen family system in order to eventually cope. So ito, family focused siya and not about Gina. Okay, so I kasi rin yan. Okay, best answer dito is C. Focus on the factors. Ayan. More than focusing on the shame and guilt. Right, so 12 is cat. 5, 4, 3, 2, and 1. 13. In one home visit, Nurse Oscar was approached by 15-year-old Alex. He was asking about condom news. He said he has a girlfriend with whom he is madly in love with but does not want her to get pregnant. Nurse Oscar's most practical and best advice would be, so si Alex nagtanong siya about the condom news, ano? So dapat ang magiging sagot natin regarding the condom news as well. So postpone sex and suggest other ways to express in love. Ito naman, this is not practical. Lalo na, si Alex may desire siya. Okay, so X yan. Explain to him the difference between sex and love. So again, di ba, hindi ito about condom use. X yan. Teach him step-by-step correct, continuous and consistent condom use. So this is the best answer. How about dog? Discourage him on having a girlfriend and focus more on his studies. So this is a negative statement. So X din yan. So the answer is cap. 5, 4, 3, 2, and 1. 14. Ramon complains to Nurse Oscar some weird behavior of Nilda. This past few months, she has decreased sex drive, night sweats, and mood swings. He also received weird text messages from her such as, "Do you really love me? What role do I play in your life? You still find me attractive?" The best advice of Nurse Oscar to Ramon should be, okay, so dito, yung weird behavior ni Nilda, yan, nagpapakita siya ng symptoms ng menopause. Okay? Yan. May pagka-sensitive na si Nilda. Yan. So, possibly because of the hormonal changes. Yan. So, ano daw yung best advice? Give her some money for makeover to increase her self-esteem and make her look attractive to him. So, ito, yan, dito, cost-effective. How would be, accompany her to a psychiatric facility, agad-agad, di ba? So, posible nga dahil nga hormonal changes lang ito. Hindi ka agad kailangan dalhin sa psychiatric facility. Ignores his wife or tell her she's too old to act like a teenager. So, non-therapeutic to. So, X yan. Best answer is, give reassurance that she is the best person who came to his life. Dog. 5, 4, 3, 2, and 1. 15. Apparently, the nurses' interventions have improved family relations. The members are now communicating with one another and are excited in preparing for a family affair, which is the baptism of Beatrice. Nurse Oscar was asked to be the godfather of the child. His best response is, ayan, sa mga future nurses, kapag nangyari ito in the future, anong gagawin nyo? Ayan, so, syempre, di ba, sa board exam, ideal tayo. So, since, this goes beyond, yung pagiging godfather, this goes beyond the responsibility of a nurse. So, we should refuse, okay? So, X na tong A and C. How about boy? Refuse and make an alibi, meaning nag-reason out that he belongs to another religion. So, hindi mo naman kailangan mag-reason out. You can just politely decline and explain that his relationship with the family must not go beyond professional. Okay, the answer is dog. 5, 4, 3, 2, and 1. Situation. The family of Rojas is fond of dogs. A vendor who entered the gate without notice is bitten by one of the pet dogs named Bert. So, tandaan natin na si Bert ay yung aso. PHN courts attend to the vendor. Which of the part of the body of the vendor, ayan, will be most affected in terms of rabies? Ano bang most effective? Rabies is a central nervous system, ayan, that infects the neuron. So, the most affected is the head. Okay? 5, 4, 3, 2, and 1. To protect the vendor from the dangers of rabies, PHN Courts advises him to clean the wound thoroughly with soap and water, consult a physician, and receive anti-rabies vaccination? Which among the following, hindi pala patanong yan, no? Which among the following vaccines can provide active immunity? Okay, so, natanong dito kung which among these daw provide active immunity. So, I know we discussed this already, yung different types of immunity, no? Pero, pasadahan lang natin saglit. Kapag natural, comes from any disease or any natural or biological process. Artificial immunity naman kapag exogenous or lab-made. Active immunity, since active, ako ang may gawa ng antibodies, okay? Not immediate yung effect niya, pero long-term naman. Okay, example, vaccination, where vaccines, frequent minimal exposure. Kapag passive, ayan, yung antibodies ay ini-introduce sa atin. Okay? Immediate yung effect niya, pero short-term. Examples, immunoglobulins and post-exposure prophylaxis. Okay, so immunoglobulins, di ba, ay passive immunity. So, X na yan. So, that leaves us with Purovero, cell vaccine, and purified duck embryo vaccine. The answer is apple. Okay, I know the original answer here is one only, or dog. Pero, bakit? Bakit one lang yung sinasabi nilang sagot dito? Kasi, ang ginagamit na ngayon, based sa recent Manual of Operations ng rabies, ay, ang ginagamit na ay purified chick embryo vaccine, hindi na purified duck embryo vaccine. Pero, vaccine pa rin naman to, yung purified duck embryo vaccine. Katunayan, ito nga yung unang vaccine against rabies for humans. Okay? Pero ang tanong lang naman kasi dito, which among the following vaccines can provide active immunity? Nakaka-provide naman to ng active immunity. So the answer should be A, 1, and 4. 5, 4, 3, 2, and 1. Okay, I hope we're clear on that. 18. The vendor acquired rabies. What will PHN courts do to protect the ones who took care of him? So again, sino yung naka-acquire ng rabies? Yung vendor. And ang sinong nag-aalaga sa kanya? Syempre yung family niya. Ayan. Yun yung proprotektahan natin. Okay. So dito, and kung titingnan natin yung options, for the family of birth, yes. For the, hindi pala birth. Si birth again ay yung aso. Hindi, kasi family ng vendor ang hinahanap natin. So X yung apple. Hindi rin kasama si Bert kasi hindi siya kasama sa nag-aalaga, 'di ba? Kay vendor. Katunayan, siya pa nga yung nagkagat. Okay? So X yang cat and dog. Ang answer dito ay boy. Pero bakit post-exposure prophylaxis ulit ang bibigay natin? Kasi it gives a long-term effect as compared to pre-exposure prophylaxis. Ayan. Post-exposure treatment vaccine ang binibigay, it provides an active immunity. Long-term yung effect niya. Kapag pre-exposure treatment naman, passive, immunoglobulins ang binibigay, short-term effect. Okay? 5, 4, 3, 2, and 1. 19. PHN courts intervention protect all residents who own pets. Okay, again, sino ang pinoprotektahan ng intervention? Yung mga residents owning pets. Okay, pet owning residents. Especially those should be done by, tingnan natin, A, coordinating with city or municipal agriculturist. Agriculturist ba ang kailangan natin? No. Yan, wala naman kinalaman about agriculture. Coordinating with city or municipal officials to make an ordinance on stray dogs. Again, anong focus natin dito? All residents who own pets, hindi strays. Okay, so X yan. Massive campaign to families not to own pets at home. Okay, malito. Bakit? Kasi merong namang choice, 'di ba? Yung family kung mag-own sila ng pet or hindi. Right? How about dog? Massive campaign for responsible pet ownership. Ayan. So this is the best answer. 5, 4, 3, 2, and 1. Situation. Belinda, PHN in the municipality of Bicol learned from residents that children and some elderly had been suffering from respiratory and skin ailments, allegedly due to a bad smell of curly dark smoke emitting from the factory nearby. She was invited to the community assembly that was initiated by the barangay council. Okay? 20. The barangay captain asked, what can you do to help solve the problem of the community to? The community. What would be the right response of Nurse Belinda? Okay, tingnan natin. A, well, your problem is easy to solve. Wow, Nurse Belinda, ikaw na. Diba? Easy lang pala. So I have some cough syrup, ointments for the skin, and some antibiotics. I will distribute this after the meeting. So this statement, easy to solve. Ayan, parang ini-invalidate niya yung problem ng community. Okay? Parang problemado ang community dito. Kailangan na nilang magtawag ng nurse. Ayan. So, diba? This is X, non-therapeutic yan. Who among you here have children who are suffering from respiratory and skin disease? How about adults who are here? Are you also having the same problem? Ito naman, nagtanong si barangay captain, nagtanong din si nurse, diba? It's not an appropriate response. So, X yan. Same din dito sa dog. Nagtanong din siya. So, best answer is cat. I suppose you gave a lot of thought about the problem and its possible solution. However, treating your children and the elderly is not the first solution. We have to go to the root cause of the problem. Ayan. So, sa unang statement, ayan, i-acknowledge niya na pinag-isipan naman nila mabuti yung problema tsaka yung possible na solution. Pero yun nga yung suggestion ni Nurse Belinda, ayan, hindi daw first solution ang pag-treat ng child and elderly. Kailangan doon nila pumunta sa root cause ng problema, cat. Okay? 5, 4, 3, 2, and 1. Situation. The birth process affects the physiologic systems of the mother and the fetus. The staff nurse Jamie is assigned in the labor and delivery room area. A G7P6 woman is in the hospital only 15 minutes when she begins to deliver precipitously, meaning agad-agad. The fetal head begins to deliver as you walk into the labor room. The best action of the nurse Jamie would be to, syempre, priority is safety. Ayan, mag-a-attach pa ba tayo ng fetal monitor? May oras pa ba? Precipitus nga. And also, we have to take note, multipara yung pasyente. So, mas mabilis yung labor and delivery process. Ayan, baka 1 second nakalabas na yan, di ba? Ayan, so, ito, wala nang time for attaching a fetal monitor as well as assessing the blood pressure. Yan, hindi na natin siya ipapapush kasi madalian na nga. Hindi na kailangan i-push. Okay? So, X na yan. Place a hand gently on the fetal head to guide the delivery. Yan, to ensure safety of the infant. The answer is apple. 5, 4, 3, 2, and 1. Okay. Nurse Jamie in the labor room preparing to care for hypertonic uterine dysfunction. The nurse observed that the client is experiencing uncoordinated contractions, and erratic in their frequency, duration, and intensity. Meaning by erratic, paiba-iba. Yan. The priority nursing intervention in caring for the client is to, anong priority natin? Monitor the oxytocin infusion closely. May monitor ba natin? Actually, dapat i-report natin to kung nag-i-infuse pa siya, di ba? Kasi hindi na kailangan ng client ng oxytocin. Ang oxytocin, it helps with the contraction of the uterus and meron na nga siyang uncoordinated contractions and erratic, di ba? Paiba-iba na ang frequency, duration, and intensity ng contraction niya. So, sasabihin natin sa doktor, hindi natin i-monitor, okay? Re-report yan. Promote ambulation every 30 minutes. Hindi makakatulong ang ambulation sa hypertonic uterine dysfunction, okay? Yan, so X rin yan. Prepare client for amniotomy. Actually, ang pinaprepare natin for the client ay not amniotomy, kundi CS. Kasi, ayan, minomonitor din natin ang fetal heart rate. If nagkaroon ng deceleration, doon indicated na you have to put the client in cesarean section. Okay? So, best answer dito ay, boy, provide pain relief measures. Bakit? Kasi sobrang sakit yan. Merong uncoordinated contractions tapos paiba-iba pa yung frequency, duration, and intensity. Okay? 22 is boy. 5, 4, 3, 2, and 1. Mrs. Barbara, 34. Specific na pain relief measures po pwede dyan, ma'am. I'm not exactly sure sa mismong pain relief measure. Okay, hindi ko actually lahat alam. Ayan. Pero ang answer dito, boy, sure tayo dyan. Okay? Pero if you want, I can get back to you about that later. Okay, 22. Yes. All right. Next, 23, Mrs. Barbara, 34, admitted in the hospital unit for severe preeclampsia. When deciding on where to place her, which of the following areas would be the most appropriate? So, ito, syempre, yung severe preeclampsia, may risk for to, saan? Risk for seizures. Yan, very good. Okay, may risk for seizure yung client. Ano daw ang appropriate on where to place her? By the nursery so she can maintain hope she will have a child. Diba? Sa nursery, may mga batang umiiyak. Diba? So, X yan. Kasi hindi naman natin makontrol yung mga bata kung kailan sila iiyak or hindi. Near the elevator. Busy sa elevator. So, X yan. Nurse station, busy rin. So, X. So, the best answer here in the back hallway where there is a quiet private room. Ayan. So, we need a non-stimulating environment. Kahit nasa back hallway siya, ayan, pwede naman magsama ng significant other. So, 5, 4, 3, 2, and 1. 24, the physician orders intravenous magnesium sulfate for Mrs. Barbara. Which of the following medications would the nurse has readily available at the client's bedside? So, ano yung antidote for magnesium sulfate? If ever nagkaroon ng toxicity, that is calcium gluconate. Okay, very good. Yan. So, tatandaan natin, magnesium sulfate, ayan, yung antidote niya ay calcium gluconate. 5, 4, 3, 2, and 1. Which of the following signs would alert the nurse that Mrs. Barbara's whose latest blood pressure is 160/10 may be about to experience a seizure? Okay, di ba kapag seizure, usually, ang nagkakos yan ay hyperstimulation, di ba? And dito may decreased contraction intensity, may decreased temperature, may hyporeflexia, lahat pababa. So, ang pinaka-answer dito ay, best answer is boy, epigastric pain. And so, sinasabi na ang epigastric pain daw, ito yung most common aura in temporal lobe epilepsy. Okay, 25 is boy. 5, 4, 3, 2, and 1. Ay, bakit hindi po letter C yung number 23? Hindi po ba emergency po ang severe preeclampsia? So sa 23 kasi, ang concept nito ay may risk for seizure yung may preeclampsia. So ayaw mo siyang malapit sa nurse station na usually busy. Okay? Ayan. So kailangan na natin ng non-stimulating environment. Ayan. Yun yung preventive tayo dito. Okay? Preventive. Ayan. Ayaw natin siya magka-seizure. So saan tayo? Okay. So situation. So you're welcome. Ayan. Situation, Nurse Dora, nursing staff applicant, pass both written and oral examinations because she knows the head of office. She promised to submit all her credentials after she has fixed things up. She was appointed as Nurse 1 with a temporary status until she submits all her credentials, including her PRC license. Her evaluation performance was satisfactory. After a year, though, she had to renew her PRC registration and ID card. Okay. What action must the nursing administration do first in this case? In this case where, ayan, hindi nila sure kung nakapasa siya ng board exam. So again, dito sa mga cases na ganito, di ba, mas maganda kung internal muna. Okay, kasi sino bang kumuha kay Nurse Dora? Yung hospital, di ba? Ayan, so kailangan muna nilang ayusin yan internally. So hindi muna pupunta sa PRC, and kasi external yan. Hindi rin muna pupunta sa Civil Service Commission. Actually, hindi dapat din pumunta dyan sa Civil Service Commission kasi we're under the PRC. Okay? Confront Nurse Dora and terminate her. Okay, may due process tayo dito. So, X yan. Diba? Ideal, due process. Report the matter to the head of office who had the discretion to appoint the nurse. Yan, yan yung best answer. Okay, yung superior, of course, ni Nurse Dora, dun tayo pupunta. 5, 4, 3, 2, and 1. It was found out that Nurse Dora did not pass the NLE. Hala, what legal action should be filed against her? So dito, nagsinungaling ba si Nurse Dora? Wala siyang sinabi actually, di ba? Pero hindi siya nagsinungaling. Okay, so X yan. Conduct and becoming of a professional. Hindi naman siya nakapasa ng NLE, so hindi pa siya professional. Okay? Hence, hindi niya magagawa tong conduct unbecoming. Okay? Sa X yan. Malpractice. Malpractice is professional negligence, no? So, dahil hindi siya professional, X rin yan. The answer is misrepresentation, which is giving false representation about self. Okay? Then, nirepresent niya yung sarili niya as a nurse. 5, 4, 3, 2, and 1. 28. In case Dora have medication error during her tour of duty, the head of office can be liable because of the law called... So, head of office daw ang magiging liable, which is a superior of Dora. Si Dora nagkamali siya, may medication error siya. Ayan. This is respondeat superior. Okay? Una ka naman itong unethical conduct and politicking. Yung res ipsa loquitur, meaning nito, the evidence or the thing that speaks for itself. Okay? Usually, this is applicable kapag kunyari may naiwan sa OR, yan, sa tiyan ng pasyente na gauze or needle, ganyan. Yung thing na yon or yung evidence na yon, nagsispeak na siya for itself na may maling ginawa yung surgeon. Okay? Yan, in that case. And so, ang answer dito again is buwe. 5, 4, 3, 2, and 1. 29. All nurses must understand that after graduation, they should pass NLE. To be registered in the roster, they should take the professional oath with, syempre, a board member and any government official, except, so hindi kasama dyan ay positive to, positive syempre yung PR bond, and yung professional governor. So, negative lang dito ay governor of PNA. 5, 4, 3, 2, and 1. 35-year-old woman on her second trimester of pregnancy with insulin-dependent diabetes mellitus comes to you for some advice. What is the priority message for her at this time? Ayan, na nasa second trimester daw siya. Infants of diabetic mothers are big, which can result in more difficult delivery. Saan to mas appropriate? What trimester is this more appropriate? Itong statement ito. Third trimester, okay? Kasi third delivery pa. Breastfeeding, ayan, is highly recommended and insulin use is not contraindicated. Breastfeeding, kailan lang yung mangyari? After third trimester. Okay? Her insulin requirements will likely increase beginning the third trimester of pregnancy. This is actually wrong kasi nag-i-increase siya during what trimester? Second trimester. Okay, so ang answer dito ay CAT. Achievement of optimal glycemic control is of utmost importance in preventing congenital anomalies. So 30 is CAT. 5, 4, 3, 2, and 1. 31. A 30-year-old G6P5 woman at 12 weeks has just begun prenatal care. Her initial lab reveals that she has HIV infection. What would be the priority evidence-based nurse information for this patient? Okay, tingnan natin yung dog. Breastfeeding will potentiate the transmission of HIV from mother to child. Is this true or false? This is actually depende, okay? Kapag ang mother ay naka-ART or antiretroviral therapy, which is the medication for HIV, ayan, ay the risk of transmission through breastfeeding is less than 1% but not 0. Okay? So, okay lang mag-breastfeeding ang mothers na may HIV as long as naka-antiretroviral therapy sila. Okay? So, itong dog, depende pa siya. Okay? Yan. C, medication for HIV is safe and can greatly reduce transmission of HIV to the infant. True or false? This is true. Ayan. So, sinasabi na it can reduce the transmission to less than 5% in the breastfeeding population. Okay? Yung antiretroviral therapy. Ayan. So, this is positive. Pregnancy is known to accelerate the course of HIV disease in the mother. So, evidence-based, sinasabi na mali ito. Because studies show that being pregnant will not make HIV progression any faster in the birthing parent. Okay, so negative yan. How about A? Breastfeeding is still recommended due to the great benefits to the infant. Okay, lalo na kapag naka-ART yung mother. Okay, so ito kasi breastfeeding, ayan, at 12 weeks pa lang to, so medyo malayo-layo pa ang breastfeeding, no? Ang best answer is CAT. 5, 4, 3, 2, and 1. Situation. PHN Alpha works in Barangay 14 and 15 in the municipality of Agoho. One day, a neighbor summons her to attend a 7-year-old boy with a high-grade fever. Upon reaching the house, a local herbolaria, Nanay Isa was already attending to the boy. She said that the boy played near the river and the bad spirits entered his body. The most appropriate remark the nurse make is, so dito, yung C and D, ayan, you can drive away the spirits that entered the boy's body. You have to be sure that all spirits have been driven out of the body. So, not appropriate answer to. Kasi, di ba, we have to be scientifically based or evidence-based. Nanay Isa, your intervention is entirely wrong. So, dito naman, actually, this is the least appropriate remark kasi it doesn't convey respect to Nanay Isa, the herbolaria. How about A? Go on, do what you have to do, then I will take over. This is actually okay. Yan. Sabihin mo lang sa herbolaria na, okay, sige, gawin niyo lang po yung kailangan niyo gawin. And after niyo, ako naman na po. Okay, so 32 is apple. 5, 4, 3, 2, and 1. 33. After a few minutes, Nanay Isa took a big bowl of soup and gave it to the boy. The best remark of the nurse is, anong best remark of the nurse nito? I also drink soup when I get sick. How about you, Nanay Isa? Do you do the same? Ayan. So, this is nurse-centered. X yan. The soup could have been better if you put lemongrass on it. O, diba? Nag-suggest pa si nurse. So, X rin yan. Nurse-centered. Come on, tell me why soup must be given to the child with fever. Ito parang, challenge niya si Nanay Isa. Yan, may come on pa. That's correct. Increasing fluid intake will help lower down temperature. So, the best answer here is dog. Okay? Ayan. Dito naman, kinonect niya yung nursing practice dun sa big bowl of soup. Okay? 5, 4, 3, 2, and 1. Ma'am, last siya po namin number 32, sagot ay B. Thank you. 32? Oh, yes, kasi iba yung tinatanong nun. Least appropriate remark ang tinatanong. Most appropriate ang hinahanap ngayon. Okay? Ayan. So, mag-ingat ha sa board exam. Basahin mabuti yung tanong. Alright? Ayan. Baka akala natin na same lang siya. Okay, next. Finally, Nanay Isa took out from her pocket a dried rose flower and placed it on the boy's forehead. How will Nurse Elsa handle this situation? So, imagine na lang natin, kapag tayo yung nilagyan ng dried rose flower dito, ayan, alam ba natin na may effect yun or wala? Diba? So, yung paglagay dito, we know na it will not give a harmful nor beneficial effect. Okay, so tingnan natin. A, tell her not to use a dried flower again because it does not have any good, ano ba? It does not have any good effect on the sick. Wala rin naman siyang bad effect, di ba? So, X yan. Ask for an extra piece of fried rose flower and promise to use it. Ito, nurse-centered siya. So, X yan. Ask the herbolaria the rationale for this intervention. Pwede naman to. Ayan. Pero kasi we know na wala siyang effect. So, leave the intervention as is. Anyway, the intervention is neutral, not harmful nor beneficial. Okay, so D is the correct answer. 5, 4, 3, 2, and 1. Situation, the local health board established a reproductive health clinic in the main health center. 2 nurses, Hubert and Irene, were assigned to handle services to address problems related to sexuality, reproductive health, and fertility problems. 35. Nurse Hubert classifies cases according to the major categories of reproductive tract infections. Which of the following is not part of such classification? Okay, so reproductive. Ano ba dito ang major categories ng reproductive tract infection? Yes, kasama tong iatrogenic infection, kasama tong sexual transmitted infection, and endogenous infection. Ang di kasama dito ang urinary tract infection. Kasi sa urinary tract siya, hindi siya sa reproductive tract. Okay? 5, 4, 3, 2, and 1. 36. Irene handles the screening for gonorrhea every 2 weeks. Ayan. Among female sex workers in the implementation of PD 856. In differential diagnosis of discharge among infected clients, which of the following coroner's discharge will Irene take note to identify gonorrhea from other causes? So, tingnan natin yung cheat sheet natin dito. Ayan. Okay, so anong color ng gonorrhea? It's thick green or yellow. Okay, so hanapin natin dito yun. Yung thick green or yellow. Okay, meron dito sa A and meron dito sa dog. Wala dito sa boy and cat. Okay. How about yung trichomoniasis? Anong kulay? Yellow, green. So the answer here is dog. Okay, kasi sabi dito mucoid white, mali. Okay, 5, 4, 3, 2, and 1. Nurse Hubert was invited by a women's group to give a lecture on healthy sexuality. In the expectation check, he noted that there are previous misconceptions expressed by the participants. Which of the following statements are correct? So something positive. It is the obligation of the wife to give into sex every time he asks for it. So this is negative kasi nga may autonomy yung wife. Pwede siyang mag-choose to refuse. Okay? Sexuality is fluid and may change. This is also positive. Effeminate. This is positive pala. Effeminate men are gays, meaning ng effeminate, ayan, yung behavior niya ay medyo may pagka-feminine. Okay? So, not automatically naman yan. So, this is negative. Homosexuality, being gay or lesbian, is an abnormality. This is also negative. The answer is F. 5, 4, 3, 2, and 1. Saan? Ano last time po B sagot dun? Saan yan? Ano number yan? C? Kasi inano na dito. Ayan na. Iniba yung, tawag dito, iniba yung pagkakasunod-sunod. Iniba yung pagkakasunod-sunod dito. Huwag niyo kabisuduhin yung, yung choice, okay? I-analyze niyo. Ginawang D yung yellowish white as compared to trichomoniasis greenish yellow. Imbes na C. Huwag kayong magkabisa ng ng choices. Okay? So, 37 is F. 38. One of the clients was positive to gonorrhea. Nurse Irene explained that gonorrhea and chlamydia, if left untreated, can lead to pelvic inflammatory disease. Such conditions may cause infertility due to, so again, di ba yung gonorrhea, it causes the PID. Yung pelvic inflammatory disease, it causes the scarring of the cervix, vagina, ovaries, fallopian tubes, and uterus. Ayan. Because of that inflammation. Ngayon, dahil doon, nagkakaroon ng tubal occlusion leading to infertility. So, the answer is cat. Okay? 5, 4, 3, 2, and 1. Naalala ko yun kasi ilang beses ko ba tinuro yun? Diba? 4 times. Ayan, 4 classes. Nurse Irene further explained that a test used to determine tubal patency using a radiopack material is the, so dito, okay, dito, ayan, yung post-coital infertility test and Sims Honor test, ayan. Same lang to, okay, same lang sila ng ibig sabihin. So, this is to test the sperm interaction with cervical mucus. Okay? And yung Friedman's test naman, this is to aid in the early diagnosis of pregnancy. While yung hysterosalpingography, ayan, again, it is an X-ray to test the outline of the internal shape of the uterus and show whether the fallopian tubes are blocked. So, that determines tubal patency. The answer is dog hysterosalpingography. 5, 4, 3, 2, and 1. Situation. A pregnant woman is monitored continuously for a range of signs and symptoms that indicate potential complication. Nurse Carol attends different discomforts and problems of pregnant women. John, an OPD nurse, admitted Mrs. Felia to the antepartum unit with a diagnosis of severe hyperemesis gravidarum. When the nurse reviews the lab test, she would expect which of these findings? Okay, so ano daw ang ina-expect natin? Di ba kapag merong hyperemesis gravidarum, there is severe vomiting. Persistent, uncontrolled vomiting. And wait lang, type natin. Persistent, uncontrolled vomiting. That may lead to what? Dehydration. Okay? Ayan, wait. So, tingnan natin isa-isa. Low urine specific gravity. Yung urine specific gravity, yan, tinitingnan yan yung concentration ng solute sa urine. So, mababa ba ang concentration ng solute sa urine? Actually, it is high. Kasi, mas konti yung lumalabas na fluid. Okay, na urine. So, we're expecting na more concentrated ng solute yung urine. Okay, so the answer, so this is wrong. Dapat increase to. Okay, increase potassium. Increase potassium ba when there's persistent uncontrolled vomiting? Okay, pwede kasi na during vomiting, ayan, with vomiting, lumalabas din yung potassium. So, X to. Decrease yan. Decrease blood urea nitrogen. Dito naman, wait. Sa urine to, diba? So, in-expect natin na more concentrated yung BUN, yung waste sa urine dahil nga may konti lang yung lumalabas na fluid. Okay? So, dapat increase to. Yung hematocrit naman, this pertains to the concentration in the blood. Okay? So, dito, merong increased hematocrit, yes, kasi bakit? Kasi may lower plasma levels in the blood. So, yung ratio niya with the red blood cells ay, wait. Ayan, mas maraming red blood cells kesa sa plasma levels sa blood. Okay, so more concentrated siya. Increase yung hematocrit. Okay, the answer is apple. 5, 4, 3, 2, and 1. Yes. 41. Nurse John suspects presence of sexually transmitted infection to Mrs. Felia, specifically syphilis to a pregnant client. Which of the following tests will be recommended to the client to confirm diagnosis? Okay, so ano naman yung test dito na related sa syphilis? Okay? So yung Benedict's test, ano ba to? This is to detect the presence of glucose in the urine or yung glycosuria. Glycosuria. Ayan. Yan yung Benedict's test. How about urinalysis? Usually to assess for UTI. And complete blood count, usually for anemia. Pero, not syphilis. Ang best answer dito ay dog VDRL. Ayan. It is known to detect syphilis infection. Ano ibig sabihin ng VDRL? Venereal Disease Research Laboratory Test. Okay? And that detects syphilis. 5, 4, 3, 2, and 1. 42. Mrs. Ibrodo, 26, primary, being prepared for non-stress test. This is an assessment test based on what phenomenon? This is an assessment test based on what phenomenon? Okay, so yung non-stress test, ano bang minemeasure natin dyan? Yung acceleration ng fetal heart rate in response to the movement. Okay? Fetal movement. Okay, not because of the contractions. Yan, hindi dahil sa contractions. Fetal movement cause an increase in maternal rate. So again, it's the fetal heart rate yung minimeasure natin dito. So X rin yan. Best answer is dog. Fetal heart sounds increase in connection with fetal movement. 42. 5, 4, 3, 2, and 1. Yes. 43. After a non-stress test is completed, Nurse Ibrado observes on a monitor of the fetal strip results that the fetal heart rate accelerated 15 beats per minute with each fetal movement. The acceleration lasted for 20 seconds and occurred 3 times during the 20-minute test. The nurse is correct in interpreting the test as a... So, dalawa lang naman yan when interpreting. It's either reactive or non-reactive in a non-stress test. Okay? Wait lang. So, paano natin malalaman yun? Sinasabi natin reactive kapag merong at least 2 accelerations of fetal heart rate by 15 beats or more lasting for 15 seconds after a movement. Okay? After movement. Kapag naman non-reactive, there's no acceleration with movement. And if there's a low short-term fetal heart rate variability, kapag less than 6 beats per minute yung heart rate. Excuse me. Ayan. So, si fetus, ayan, may acceleration siya ng 15 beats per minute with each fetal movement, lasting for 20 seconds and occurring 3 times during the 20-minute test. So, that is reactive. Apple. 5, 4, 3, 2, and 1. 44. Another client is also scheduled for amniocentesis. Nurse Carol explains to the client that one of the risks of amniocentesis is... So again, amniocentesis is the aspiration of amniotic fluid to detect physical abnormalities such as Down syndrome or spina bifida. Okay? So, ano ba yung risk ng amniocentesis? According kay Pillitary. Actually, according kay Atilakos and Overton, as cited in Pillitary, and if procedure leads to irritation of the uterus, it could initiate premature labor and preterm labor. Okay, the answer here is premature labor. 5, 4, 3, 2, and 1. 45. The client in active labor admitted in the labor room. The nurse is assessing the fetal heart monitor strip of a client having a contraction stress test. So kanina pinag-usapan natin ang non-stress test, diba? Ngayon, contraction stress test naman. Which of the following, if noted by the nurse, would indicate a negative test? Negative test. So, tingnan muna natin. How do we interpret ba the findings? Dito sa contraction stress test, it's either positive or negative. Sinasabing positive kapag mayroong deceleration na nakita. Okay? And that is a bad result. Okay? Kapag negative naman ang result, yan, good result. Good result yon. Walang deceleration na nakita sa fetal heart rate. So, we just have to do the non-stress test again. So, ang hinanap dito natin ay negative stress test. And that is a good result. So, walang deceleration. The answer here is apple. An increase in fetal heart rate is acceleration. Usually in non-stress test, diba? Acceleration. Ito kasi may deceleration silang dalawa. So this is positive result. The answer is apple. 5, 4, 3, 2, and 1. 46. The client complains of feeling tired and thirsty. The nurse evaluates that the mother understands the reason for taking only small sips of water and ice chips during labor. Okay? Which of the following statement expressed by the mother would reflect she understands the situation? When? So, tingnan natin. Cesarean section is always a possibility even in normal labor. Always ba? No. So, not all the time yan. X. The intestinal tract should be completely empty before delivery in order to avoid infecting the baby. So, dapat ba completely empty? Hindi naman indicated yan na dapat completely empty. Okay? Basta, naka-NPO lang. Alright? So, usually, indicated yon yung NPO to prevent risk for aspiration. Okay, so X rin to. The digestive process is normally slower during labor. Actually, this is correct and let's discuss it later. A body normally has sufficient storage of energy. Mali to. Kasi, yun nga, sinasabi na dito, feeling tired and thirsty. Right? So, answer dito ay boy. Because, ayan, it is because of the hormone progesterone. So, sinasabi na the hormone progesterone, which causes smooth muscle relaxation, often causes relaxation and slowing of digestion in the stomach and the small and large intestines. Ayan. So, present yan during labor. Alright? Okay. So, 46 is boy. 5, 4, 3, 2, and 1. Kim, 27, multigravida, has been transferred to the delivery room after spontaneous rupture of membrane and crowning, was noted by the nurse in charge. You know that your teaching has been effective when the laboring client partner shouts, she's crowning, as, so ano daw ibig sabihin ng crowning? You first start to see a little of the baby's head, pwede. The baby's head recedes upward between pushing contractions. So, sinasabi dito, kapag daw hindi nag-contract, kapag daw hindi nag-contract, bumabalik daw yung ulo sa loob. So, anong tawag dito sa sign na to? This is called the turtle sign. Turtle sign. Ayan, hindi siya crowning. Right? So, X yan. Perineum is thin and stretching around the occiput. Pwede. The mouth and nose are being suctioned. Ito naman, nakalabas na yung baby neto kasi nasa suction mo na yung mouth and nose. Yan, di ba? Hindi yan crowning. So, X yan. So, between A and C, ano yung best answer? Yan, tingnan natin yung definition ni Pillitary. What is crowning? According to Pillitary, crowning is the point in time when the perineum is thin and stretching around the fetal head, both within and during contractions. Delivery is imminent and when crowning occurs. So, yung occiput, it's part of the fetal head. Okay? So, the answer here is cat. 5, 4, 3, 2, and 1. 48. To deliver her infant, a woman is to push with contractions to deliver, ensuring the standards of nursing practice. Which of the following is the most effective and safest pushing technique, teacher? Okay, so we're looking for pushing technique. All right, so A, lying supine with legs in lithotomy stirrups. This is positioning. Okay, hindi naman siya pushing technique. So, X yan. Also, itong D, lying on side, arms grasp on abdomen. Ayan. So, ito, positioning din siya. Okay, not a pushing technique. So, between B, squatting while holding her breath, or head elevated, grasping knees, breathing out. Ano yung mas okay? Holding her breath or breathing out? Siyempre, yung humihinga pa rin si client. Okay, we don't want her to hold breath. Why? Kasi pwedeng magkaroon ng reduced blood return due to pressure on the vena cava. Okay? So, X young boy, the answer is cat. 5, 4, 3, 2, and 1. Hanggang 50 tayo, guys, and then break time for dinner, okay? 49. The delivery room nurse, based on the standard of nursing practice, episiotomy is usually indicated for which of the following purposes? So, ano daw ang purpose ng episiotomy? Wala naman siyang effect sa bladder. Ayan. To relieve the pressure on the fetal head, pwede. To to aid in contraction of the uterus following delivery. So, nakaka-help siya daw sa contraction? Hindi naman. Okay? Done primarily for the physician's benefit. Para ba sa physician's benefit? No. Diba? Patient focus tayo. Okay, so the answer here is boy. Yes, it relieves the pressure on the fetal head. Okay? Yung episiotomy, ano ba siya? Surgical incision on the perineum. This is to prevent tearing of the perineum. Yan. Ito. Prevent tearing of the perineum. Release pressure on the fetal head with birth and possibly shorten the last portion of the second stage of labor. Okay, so 49 is boy. 5, 4, 3, 2, and 1. Yes, medial lateral. Situation. It is important for an OB nurse to perform a comprehensive physical assessment after labor and delivery that could predispose the mothers to potential complications such as hemorrhage. Okay, 50. The nurse in the delivery room is attending to Mrs. Cruz on labor to make sure that maternal injury will be prevented during the postpartum period. Which of the following instructions should the nurse consider to prevent postpartum hemorrhage? Okay, have bed rest and avoid early ambulation. So, ito naman, wait lang. Ayan, hindi naman nakakatulong to prevent hemorrhage yung bed rest. Okay, so X yan. Apply warm compress to the abdomen. So, di ba yung warm compress, ayan, it vasodilates the blood vessel. So, mas nakaka-lead pa yan sa hemorrhage. So, X yan. Postpone breastfeeding of the baby. We don't want to postpone the breastfeeding. Bakit? Kasi, hindi release yung oxytocin na makakatulong sa pag-contract. Okay, to prevent the hemorrhage. Okay, so X yan. So, best answer is apple, massage the fundus regularly. Kasi, with massaging the fundus, ayan, makakontract na yung uterus to prevent bleeding. Okay? Ayan, so 50 is apple. Okay, dinner time. Para sa iba, siguro, let's make it 30 minutes. Okay, kaya ba? We have 100, kaya naman siguro, 30 minutes. Okay? So, balik tayo dito ng 6:09. Okay naman, 25 na lang. 6:04. 6:04. 6:04 p.m. Ayan. Kasi, yes po, 30 please, 20 minutes po, carry lang. How about iba? 6:10. Sige, 6:10. 6:10. Okay, sige. Balik kayo guys ha. Thank you. Hello, hello, hello. Hello, future RNs and top-notchers. Diyan na ba kayo? 6:10 na. Please type 1 nga. Yes po. Yan. How about yung iba? Yes. Okay. Please type in 1 kung nandito na. So I know if we can start already. Okay. I think we can start na. Marami-rami na naman. Ayan. Okay, so 51, NP2. When a placenta has been delivered, the first thing that a nurse should do in adherence with the standards of nursing practice is to, so pinag-uusapan natin, placenta. Okay, estimate the blood loss to detect any bleeding. So pwede naman, pero ano bang related sa placenta, di ba? Tingnan pa natin yung other options. Administer oxytocic agents as ordered. How about people palpate the uterus to see if it is contracted? Or A, inspect the placenta for completeness of the cotyledons. Ano bang related sa placenta dito? Of course, yung letter A. So pagkalabas niya, of course, we have to inspect that for completeness of the cotyledons. So anong normal number of cotyledons sa placenta? It is 15 to 20. Okay? So yung cotyledons, ito siya. Yan. These are compartments in a placenta. So, pag lumabas yung placenta, bibilangan natin, dapat 15 to 20 siya. Okay? Yes. 5, 4, 3, 2, and 1. 52. The delivery room nurse palpates the client's fundus immediately after the delivery of the placenta and assesses that it is boggy. The nurse massages the patient's uterus until it is firm. Considering the evidence-based nursing practice, which medication would the nurse anticipate might need to be administered if the uterus becomes boggy again? So, kailangan natin ulit ng pangpa-stimulate ng uterine contraction, and that is A, oxytocin. Okay? Yan. Yung ibuprofen, it's an NSAID. Rogam, this is for RH in compatibility, magnesium sulfate for eclampsia. Okay, 2, apple. 5, 4, 3, 2, and 1. 53. Mrs. Evita, 28, gave birth to CS. The nurse examines her and identifies the presence of lochia serosa and feels the fundus 4 finger breadths below the umbilicus. This indicated that the time elapsed is, ayan. So yung lochia, yan, di ba may tatlo yan? RSA. So, rubra, usually observe 1 to 4 days after delivery. So, dark red yan. Serosa for 10 days after. Pink to brown. Alba 10 to 14 days after white. Okay? So, yung serosa, kasi sabi dito serosa. Ayan. So, 4 to 10 days siya. Saan mapasok dyan ang 4 to 10 days? It is 4 to 5 days postpartum. So, let's further confirm that by checking kung ilang days na yung nakaraan after, ilang days na ang nakaraan with 4 finger breadths below the umbilicus. Okay, how do we know that? Wait lang. Kung ilang days na ang nag-elapse. Wait. Ayan. After fetal delivery, yung fundus, it's normally palpated 1 inch below the umbilicus. Okay, and never above. And after placental delivery, fundus is palpated in between the umbilicus and the symphysis pubis. 1 hour after the delivery of the placenta, ayan, fundus is palpated at the level of the umbilicus. And then, the fundus further goes down 1 centimeter per day. Okay? Ayan. So, sabi dito, 4 finger breadths. Usually, 4 finger breadths equals 1 finger breadth equals 1 centimeter. So, this is 4 centimeter na ang nakaraan. 4 centimeter. So, 4 days. Okay? And that confirms 4 to 5 days postpartum. Okay, boy. 5, 4, 3, 2, and 1. 53. In assessing a new mother's response to her son's birth on the first postpartum day, which behavior does the nurse expect to find present? Saglit lang ha. Wait lang. I'm really sorry, guys. Ayan. Okay. May dumating lang. Alright, 54. In assessing a new mother's response to her son's birth on the first postpartum day, which behavior does the nurse expect to find present? Ay, di ba? Meron tayong tinatawag na Rubin's postpartum psychological adaptation. So, tatlo yan. Una, yung taking in. Pangalawa, yung taking hold. And pangatlo, yung letting go. Okay. Wait lang. Ito. Alright. So, tingnan natin isa-isa, no? So, sa taking in, usually it happens 1 to 3 days after. So, mother is passive, has many demands, self-centered pa siya. So, ang ginagawa ng nurse, assist patient and let her verbalize. Taking hold naman, 1 to 10 days. Taking hold of the responsibility of becoming a parent. Strives to learn the task of being a mother. Management, positive reinforcement, appraise if something is done right. Letting go naman, 10 days to 6 weeks. There is return or resuming of sexual activity. Okay, so yung D, interest in learning to care for the baby. Anong stage to? Taking hold. Disinterest in her own body function. Yan, because nakafocus na siya sa baby. This is taking hold as well. Autonomy and independence. This is part of letting go. And talkativeness and dependency. This is taking in. Okay, 54 is apple. So yung hinahanap natin ay first postpartum day. 5, 4, 3, 2, and 1. Situation nurse, lovely, newly promoted senior nurse in the OP ward is attending a seminar on management and leadership in preparation for her work. Okay. Nurse Lovely learns the 5 principles of goal setting in which the senior nurse must provide enough time for OB nurse to improve in performance. Excuse me. Ayan, so ito yung 5 principles of goal setting. We have commitment, clarity, challenge, complexity, and feedback. So ano daw dito nagpapakita? Ng providing enough time para daw ma-improve yung performance. Saan pumapasok yun dito? Challenge, commitment, feedback, or task complexity? The answer here is task complexity. Kasi, the senior nurse should ensure that the work doesn't become too overwhelming and highly complex tasks. Okay, so 55 is dog. 5, 4, 3, 2, and 1. 56. The nurse also learns that continuous training is a personal as well as an organizational goal. Choose a statement that are true regarding continuous training. So number 1, training employees is an excellent investment, tama naman, and a cost to an institution. So it doesn't always mean na magkakaroon ng cost kapag nagpapatrain, ha? So this is negative. Continuous training is more of a personal responsibility than an institutional. Diba dapat equal lang sila ng responsibility, so this is also negative. Cross-training and job rotation provide an ongoing part-time learning experience. This is correct, positive. Select the best people when hiring employees, totoo yan, and invest their attention through continuous training. This is also true, so positive. The answer is apple, 3, and 4. Okay, 5, 4, 3, 2, and 1. 57. Noting the importance of nurse-patient relationship, Nurse Lovely reviewed Hildegard Peplau's theory, which identified 3 phases. Ano yung 3 phases na yon? Orientation, working phase, and terminal phase. Termination. Okay, terminal phase. Yan. The first daw, which is the orientation, of which is when the pregnant woman begins to have a feeling of belonging. Saan phase to? This is in the working phase. Okay? Kasi usually in orientation, wala pa siyang feeling ng belongingness. Okay? Kasi kakamit pa lang yan. Understands the communication of Nurse Lovely regarding the services offered. So dito sa working phase na to, sinaintindihan niya na. Demonstrates self-reliance and care for herself. This is in the termination phase. And feels the need to seek professional assistance. So kailangan niya pa ng assistance. This is in the orientation phase. So the answer is apple. 5, 4, 3, 2, and 1. 56. Nurse Lovely took note that evaluating the OB staff is an ongoing function of management. Except some of the reasons for conducting evaluation include except to, so something negative. Yan. Ensure the quality of care is provided by the staff. Yan. Kasama yan sa evaluating. Anong function of management pala yung may evaluating? What is it called? It is Anong function of management? Function of management yon. Ito yung controlling. Okay? Parang iba po yung question. Dalawa yung 56, dalawa yung 57. Okay? Ayan, dalawa yung 56, dalawa yung 57. So, yung isang 56 ay i-discuss ko later if hindi pa natin na-discuss. Or na-discuss na. Ayan, dalawa yung 56, dalawa yung 57. Okay? Ayan, so ito yung isang 56. Ito yung next 57. Alright? Okay, so let's just proceed with this. Ayan. If hindi pa to na-encounter, please take note of the explanation. Okay? Ayan. So, evaluating. Kasama tong ensuring the quality of care provided by the OV staff. Diba? When evaluating, merong check natin if pasok sa standards. Okay, yung care na binibigay. So, this is positive. Provide an indication of the cost of poor quality services. Provide an indication of the cost of poor quality services. Ito naman, ano bang ibig sabihin ng cost of poor quality? Yan. So, ito yung definition niyan. So, in Six Sigma, it is the cost of providing low-quality products and services to customers. Okay? It is also the financial loss incurred by the company for performing wrong things. Okay? So, do we need to provide an indication for that? Do we need to evaluate that, the financial loss in controlling? Yes. Okay, kailangan niyang i-evaluate. Bakit? Siyempre, we want to prevent this from happening again. Ayan. So, positive yan. How about etong boy? Justify the use of resources. Do we do this in evaluating? Yes. We also do this in evaluating as part of the fiscal accountability. In fiscal accountability, yan, tinitingnan kung meron bang appropriate spending. So, dito, may use of resources. Tinitingnan natin kung appropriate yung magamit ng resources. Okay? So, this is included. Ang hindi kasama dito ay CAT, dissuade, the self-evaluation of OB staff. Ibig sabihin ng dissuade, ayan, we don't want to encourage yung self-evaluation. Of course, di ba, we want to encourage evaluation so that the staff knows, yan, where he or she can improve herself. So the answer here is CAT. 5, 4, 3, 2, and 1. A maternal child staff nurse is attending to the pregnant women with varied OB disorders. A comprehensive assessment was conducted. One of the clients seeks further question regarding placenta previa. Ang tanong, which of the following would be the physiologic basis for placenta previa? Okay, saan ba normally nag-i-implant yung placenta sa uterus? Sang part? Upper or lower? Normally. It is in the upper. Yes, very good. Upper. Ayan. So, upper yung normal, di ba? Kapag sa lower uterine segment siya nag-implant yung uterus, it is called the placenta previa. Okay? So, it is the, there is low placental implantation. So, the answer here is boy. Ito namang A, loose placental implantation. This leads to what? Abruptio placenta. Yung complete separation of the placenta. Abruptio placenta. Okay? This may lead yung loose. Okay? Hindi naman pinag-uusapan ang uterus, so X yan, and hindi naman placenta with multiple lobes, yung placenta previa. So 57 is boy. 5, 4, 3, 2, and 1. Yes. 58. A patient diagnosed with placenta previa should be given specific instruction before discharge from the hospital to ensure standards of nursing practice, which among the following should be considered by the nurse as part of the instruction of the client. So something positive kasi kino-consider natin. Avoid intake of spicy foods. Usually kaninong indicated to? Sa may placenta previa ba? No, actually this is indicated for the client with hemorrhoids. Hemorrhoids. Okay? Yan. How about eat a low-calorie diet? Indicated ba yan sa client na may placenta previa? Hindi naman. So, X yan. May resume with regular exercise if minimal bleeding is noted in placenta previa. No. Kapag may bleeding, yan, kailangan magpa-check up. Avoid sexual intercourse. Should we do this in placenta previa? Yes, kasi pwedeng ma-dislodge yung placenta in the low uterine segment. Alright? Bawal din ang internal exam. Yan. So, 5, 4, 3, 2, and 1. Another pregnant mother wants to be clarified on her lab studies, which reveals blood type A, and she is Rh negative. Problems related to incompatibility may develop in her infant if the infant is, ayan, so sa Rh incompatibility, ayan, yung mother ay negative, and yung baby is positive. Okay, Rh positive ang baby. Ganun lagi, mother negative, positive ay baby. Ang palatandaan ko dito, yung infant, di ba, kakalabas niya pa lang. So, wala pa siyang kasalanan. I mean, di pa siya nagkakaroon ng sin, di ba? So, Rh positive. Pero yung mother, syempre, wala namang perfecto sa mundo. So, negative. Okay, 59 is boy. 5, 4, 3, 2, and 1. An OB nurse is assessing a 39-year-old pregnant woman who is married to an American citizen and Rh negative, is seen by the physician during the first trimester of pregnancy. A test to detect the presence of antibodies was conducted to her. The nurse's teaching is effective if the client understands that she will first receive raw immunoglobulin or ROGAM if the result of, indirect or direct? Okay. Anong pinagkaiba ng indirect tsaka ng direct? Ang indirect kung says, mini-measure niya ang measures antibodies of the mother. And kapag naman direct Coombs test, it measures, what does it measures? Measures the antigen of the present in the infant. Okay? Ayan. Since dito, ayan, a test to detect the presence of antibodies and antibodies conducted to her, the mother. So, this is indirect Coombs test. So, X na tong cat and boy. Okay? So, if the result is positive or negative pa, ang immunoglobulin, ayan, ano ba yung ROGAM or raw immunoglobulin? It is a sterilized solution, yan, made from human blood that contains a very small amount of Rh positive proteins. Okay, again, yung mother ay Rh negative. So, very small amount of Rh positive proteins. These proteins keep your immune system from making permanent antibodies to Rh positive blood. Okay? So, again, it prevents the immune system from making permanent antibodies to Rh positive blood. Ngayon, kapag sinabing positive kasi ang indirect Coombs test, ibig sabihin meron ng presence of antibodies ang pasyente. Ayan. So, kapag naman negative, wala pang antibodies, okay? Hindi na effective ang ROGAM kapag present ng antibodies. Mas effective siya in preventing, okay? Kapag wala pang antibodies. Alright? So, the answer here is boy. Okay? Yan. 5, 4, 3, 2, and 1. During the prenatal visit, the nurse explains further to a client who is Rh negative that ROGAM will be administered kailan. So, i-administer siya 2 times. Okay. On the first pregnancy, kapag unang nalaman, ayan, na yung baby pala niya ay Rh positive, binibigyan siya 48 to 72 hours after delivery. And then yung pangalawang beses na bibigyan siya during the next pregnancy na, on the 20 weeks AOG. Okay, in the next pregnancy. Ayan. So, saan dito yung sagot? Hindi sa infant binibigay. Hindi during the second trimester. This is third trimester yung 28 weeks AOG. And hindi weekly. So the answer here is boy within 72 hours after delivery if the infant is found to be Rh positive. Yes, very good. 5, 4, 3, 2, and 1. Next situation, as pediatric nurse, you are confronted with varied concerns regarding growth and development from parents, teachers, and children. The nurse recognizes the need for health supervision and anticipatory guidance for these groups. Okay, the best way for an infant's father to help his child complete the developmental task of the first year is to, so first year is, anong stage of development yan? Trust versus mistrust. To promote trust, kailangan ng consistency. So, ano ba dito sa option ang merong consistency? Exposing her to many caregivers. May consistency ba dito? Meron ba? Wala. Okay, kasi many caregivers. Talk to her at a special time of the day. During a special time of the day lang, wala rin consistency dyan. Okay, so X yan. Respond to her consistently. Andyan na yung word, tama to. And wala namang kinalaman yung simulation ng toy. So, the answer here is cat. 5, 4, 3, 2, and 1. Okay, 63. Whenever the parents of a 10-month-old leave, ayan, emphasis on the word leave, their hospitalized child for short periods, he begins to cry and scream. The nurse explains that this behavior demonstrates that the child is extremely spoiled. Negative, yan. So, X. Hindi naman siya nakakaramdam ng pain, ano? Yan. Is experiencing separation anxiety? Yes, most probably. Needs to remain with parents all the time. Hindi naman necessarily. So, the answer here is, best answer is boy. Yan. Dahil, iniwan siya ng parents niya. Okay, 5, 4, 3, 2, and 1. 64, Dennis, preschooler, sees you pour his liquid medicine from a tall, thin glass into a short, wide one. He will probably reason that. Okay. So, yung pinag-uusapan dito, yung theory of conservation. And usually, nagde-develop to or naiintindihan na to ng school age pa. Okay? So, dito, a child's ability to identify two identical objects at the same time, as the same, no matter the order, placement, or location. Okay? Since preschooler pa to, wala pa siyang concept ng conservation. Okay? So, itong boy, the amount of medicine did not change, only the appearance. Applicable to sa school age. Okay. The glass changed the shape to accumulate the medicine. Hindi naman to yun kasi ang kino-compare natin yung volume. Okay? So, walang ganyan. Pouring medicine hurts. Hindi yan. Okay? Doon tayo sa volume. So, the answer here is apple. The amount of medicine is less. Ayan. Kasi nga, naging short. From tall, naging short. So, iniisip niya, since short yon, mas konti yung amount of medicine. Okay, so 64, apple. 5, 4, 3, 2, and 1. 65, as a school nurse prepares a lecture on puberty changes for first-year high school girls. She asks the group, what is the first sign of puberty? A student correctly replies, dito pala tandaan, in order na rin to, yung TAM. Okay, una yung telarch, which is breast budding. Adrenarch, pubic hair, oily skin, oily hair, and body odor. And syempre menarche, menstruation. So last yung menstruation. Okay. So again, the first one is the appearance of the breast spots or telarch. 5, 4, 3, 2, and 1. 66. When encouraging the hospitalized, physically challenged, or chronically ill adolescent to develop and maintain a sense of identity, yan, adolescent, you would D. Provide care until the adolescent insist on being independent. Hindi mo na siya kailangan hintayin na mag-insist pa, di ba? Ibigay mo na yung independency sa kanya. Alright? So, X yan. Ask the parents what the adolescent is capable of doing. So, ito, tinatanong mo yung parents. Alright? That doesn't develop identity. Kung gusto mo, you can ask directly the adolescent. Di ba? Nakakasalita naman na sila. B. Provide physical comfort to the individual. It's not related. Okay. A. Provide opportunity for individual decision-making. Okay. This is the best answer. Right? So, you let them explore. Okay? So that they will develop their sense of identity. So, 66 is apple. 5, 4, 3, 2, and 1. Situation, nurse paterno, pedia nurse enjoys taking care of children in the ward even though it is so difficult and takes so much time to attend to their needs. Elvis, 8 months, diagnosed with acute laryngotracheobronchitis and is managed inside a mist tent. As nurse paterno conducts assessment, which of the following observations would lead her to suspect that airway occlusion is occurring? Okay. So kapag may airway occlusion, di ba, usually, may panic na dito kasi hindi na makahinga. Hindi na siya makaka-state ng pagod na siya and gusto niya na matulog. Okay, so X yan. And then, nasal discharge is increasing. Dahil nga may occlusion na hindi na makakalabas yung nasal discharge. So, X rin to. Cough is becoming harsher. Wala na ring cough reflex dahil nga airway is occluded. And the answer here is boy. His respiratory rate is gradually increasing. Dahil nga, hindi na makahinga. Okay, so 67 is boy. 5, 4, 3, 2, and 1. 68. A child is scheduled for meningotomy with the placement of tympanostomy tube. What is the goal of this procedure that Nurse Paterno will discuss with the parents? Okay? So dito, ano bang ginagawa sa meningotomy with tympanostomy? Okay. So, ang ginagawa dyan, nag-create sila ng hole sa eardrum para lumabas yung fluid na natrap dun sa loob ng middle ear. Okay? The fluid may be blood, pus, and or water. In many cases, a small tube is inserted into the hole in the eardrum to help maintain drainage. That is tympanostomy. Okay? Okay, so, ano daw yung goal ng procedure na to? To decrease by ear infection, pwede naman, pero not all the time kasi, di ba? Iba-iba naman, pwedeng blood or water din yung fluid. So, X yan. Irrigate the eustachian tube. Irrigate minsan irrigate meaning maglagay ka ng tubig. Again, naglalabas nga tayo ng tubig dito. So, X yan. Equalize pressure or correct malformation. Wala namang malformation dito. So, X yan. And the answer here is dog. To equalize pressure in the tympanic membrane. Kasi nagda-drain tayo, okay? Ayan. So, 5, 4, 3, 2, and 1. 69. An 8-year-old female child was admitted to the hospital with medical diagnosis of acute rheumatic fever. When obtaining a health history from the child's mother, the nurse should ask the questions to determine if the child was recently ill with. So, ano ulit yung upper respiratory tract infection na associated with acute rheumatic fever and acute glomerulonephritis? GABS. Ayan, very good. So, that is group A, beta-hemolytic streptococcal infection, which is usually manifested by cough or sore throat. So, the answer is dog. 5, 4, 3, 2, and 1. 70. You would teach the mother of a boy with TOF or tetralogy of Fallot that if he suddenly becomes cyanotic and dysmic too, okay, na-discuss na natin to before, no? So, anong positioning yon? It's not semi-folders, not supine, not prone, but in knee chest position or squatting position. Bakit? Kasi this helps or this increases the venous return, okay, to the right atrium and pulmonary vessels, thus improving or decreasing the cyanosis. Alright, so 70 is dog. 5, 4, 3, 2, and 1. 71. Dyspnea, cough, weight gain, weakness, and edema are classic signs and symptoms of which condition? Ayan, yung pericarditis, this is the inflammation of the pericardium. Yung pericardium, it is a sac-like structure surrounding the heart. Okay? So, ano ba yung signs and symptoms nito? Usually, similar dito sa dyspnea, cough, weight gain, weakness, and edema. Pero, hindi siya classic signs, okay, ng pericarditis. Ayan. Dahil nga may inflammation, syempre parang mga infection yung mga classic signs yan. Okay? Ano bang classic signs ba ito ng ano? This is from heart failure. Kung mapapansin natin dito, meron siyang pulmonary symptoms and systemic symptoms. Okay? Yung MI, usual signs niyan or symptoms ay chest pain. Hypertension, syempre dapat may mataas na BP. So the answer is dog. 5, 4, 3, 2, and 1. Next, situation. There are varied pediatric disorders that require comprehensive assessment and nursing intervention. The following scenarios refer to health problems of children. Okay, so 72, a 5-week-old infant is brought to the pedia office with symptoms of irritability, weight loss, and projectile vomiting. On physical examination, the infant appears dehydrated. From these symptoms, you know that the infant probably has. So dito, ano yung intussusception? So ito yung intussusception. Okay, there is telescoping of the intestines. Okay, telescoping or invagination. So, wait lang. So, dito mapapansin nyo, yung intestines, ayan, yung isang part pumasok siya sa another part of the intestines. That is intussusception. And usual symptoms yan ay sharp colicky pain with vomiting and bloody stool. Pero hindi naman siya projectile vomiting. So, X yan. How about tracheoesophageal fistula? Okay, tracheoesophageal fistula, with the word itself, fistula is an abnormal connection between the trachea and the esophagus. Okay, ito siya. Yan. May tracheoesophageal fistula. Okay, ito naman, diba? Usually, ang mga symptoms yan ay drooling, choking. Yan. Kasi nga, diba, kapag kumain, mapupunta dito sa esophagus, dahil may abnormal connection, pwede siyang pumunta sa airway. Kaya nagkakaroon ng choking. Pwede rin difficulty breathing when eating. Ayan, dahil nga doon. Okay, dahil sa connection. So, wala namang projectile vomiting na mangyayari. So, X yan. Hirschsprung disease. What is Hirschsprung disease? This is congenital. So, pagkapanganak, meron na siya. Aganglionic, meaning walang ganglion. Ano ba yung ganglion? It is responsible for peristalsis. So, walang peristalsis. Yan. Megacolon. Megacolon meaning large intestine. So, walang peristalsis sa large intestines. Okay? Ayan. So, usual symptoms, yan, imperforate anus, abdominal distension, gradual vomiting, okay? Not projectile vomiting. Fever, constipation. So, X rin to. Ang answer dito ay pyloric stenosis. Bakit? Kasi let's say, ito palang tawag dito ay esophageal atresia ha, kapag hindi magkakonekta yung esophagus and yung stomach, okay? Ayan. Or another part of the esophagus, esophageal atresia. Okay, let's say sa pyloric stenosis, ayan, connected yan, yung esophagus niya. Alright? So dito, sa sphincter na to, this is the cardiac sphincter. Ayan. And dito sa baba, yung pyloric sphincter. Okay, anong nangyari dito sa stenosis, with the word itself, stenosis, there is narrowing of the pyloric stenosis, pylorus or pyloric sphincter. So, nangyayari dyan, pumupunta yung food dito, ayan, natatrap sila dyan. Hanggang sa, nag-increase na yung gas and pressure dyan. Yan. Hanggang sa mapuno, merong nagkakaroon ng projectile, forceful projectile vomiting. Okay, that is in pyloric stenosis. 5, 4, 3, 2, and 1. Okay. Next. 73. A pedia nurse admitted a post-cleft palate repair child, and immediately the nurse should position the child to what position? Okay. So kapag mga cleft repair, ayan, post-op, kapag cleft lip repair, post-op, ang recommended ay side or back to keep from the patient from rubbing his face. Ayan. Okay, so yun yung sa cleft lip repair. Kapag cleft palate repair naman, ang recommended ay prone with head to the side to facilitate drainage. Okay, para hindi ma-aspirate si baby. So, the answer here is boy, prone. Okay, 5, 4, 3, 2, and 1. 73. Another neonate is suspected of having tracheoesophageal fistula. Okay. Priority nursing care until diagnosis is confirmed includes, okay, dito kasi sa TEF, di ba, merong risk for aspiration. Dahil nga magkakonect ang esophagus, kapag kumain, pwedeng mapunta yung pagkain sa trachea. Okay, magkaroon ng breathing difficulty si baby. Ayaw natin yon. So, ano munang gagawin natin until diagnosis is confirmed? Dapat mag-NPO muna. Feed nothing by mouth. Okay? 5, 4, 3, 2, and 1. 74. Upon interviewing the parents of the child with acute glomerulonephritis, the nurse understands that which information collected is most often associated with this condition. So, similar to rheumatic heart fever, ano ulit yung infection na yon? The GABS. Tama. Very good. Ayan. Okay. So, saan ba dito yon? Nausea and vomiting. No. Yan. So, the answer here is streptococcal throat infection 2 weeks prior to diagnosis. Okay? 5, 4, 3, 2, and 1. 75. A newly admitted 5-year-old child with pedia in the pedio ward suspected of Wilms tumor. Upon initial interview, pa lang, the nurse would be most concerned about which statement by the child's mother. Ano ba yung Wilms tumor? It is also called nephroblastoma. Ayan. So it is the malignant tumor in the kidneys of the child. Okay? Ayan. So tingnan natin isa-isa yung options. The child prefers some salty foods more than the others. This is a concern. Okay? Kasi, di ba, kapag mas lalong nag-intake pa siya ng salty food, where salt goes, water follows, di ba? Nagkakaroon ng retention of water. Pwede magkaroon ng retention of water kasi may problema siya sa kidneys niya. How about A? My child has lost 3 pounds in the last month. Common ba to sa child na may Wilms tumor? It's actually not common kasi usually meron pang fluid retention, di ba? So magi-increase yung weight niya. Walang losing of weight. Okay? How about the urinary output seem to be less over the past 2 days? So past 2 days pa lang, iyan. Ayan. So, ano ang answer dito? All pants have become tight around the waist. Ayan. Concern din ito. Okay. So, ito kasi past 2 days pa lang. Hindi siya most concern. Ito naman, pwede namang magkaroon ng limitation sa diet. Okay? So, best answer dito ay cat. Kasi dito, ayan, ibig sabihin, over time, matagal nang nagsimula yung symptoms niya. Ano? Nagkaroon na siya ng ascites or yung edema around the abdomen. Okay? And also, pwedeng ang maging reason nito, kaya lumaki na ng lumaki yung tiyan niya, baka lumaki na rin yung tumor niya sa kidneys. Okay, so the answer here is cat. 5, 4, 3, 2, and 1. Situation Ella, 21, law graduate, wants to review for the bar but thinks she is pregnant. She said she has regular menses but does not know when ovulation usually occurs. This has something to do with her fertility period during her last sexual intercourse with her husband. As a nurse, what would you tell Ella regarding ovulation? The ovulation usually corresponds to the life of the corpus luteum, which occurs approximately, kailan? Hindi siya 7 days, okay? 14 days before or after? Before the first day of the last menstrual period. Ayan, di pa nag-shoot ang bilog, okay? Yan, 5, 4, 3, 2, and 1. Yes, very good. Ella insisted she might have been ill during the time of sexual intercourse. Nurse explains that the absolute period of fertility is the span of the time that the woman is likely to be pregnant when she engages in unprotected sex when. Yung fertility window natin ay 3 to 4 days before and after ovulation and during ovulation. Okay? So, yung A, vague siya. Kasi, how several is several. Diba? Hanggang 4 days nga lang, before and after. So, X yan. Ito namang C and B, magkabaliktad sila. Before and after. Pwede naman siya before and after. So, we can choose there, diba? So, best answer here is during ovulation, boy. 5, 4, 3, 2, and 1. 78. The nurse proceeded to take the menstrual history of Ella to find out if she is likely to be pregnant. Which of the following determines the date of onset of the last menstrual period? It is the. So, ang hinahanap dito yung start date daw ng LMP. It refers to the duration and character ba? No. Hindi rin implantation bleeding. So, yung bleeding natin after or before? Since start date to, dapat before siya. So, the answer here is dog. 5, 4, 3, 2, and 1. 79. The nurse also asked about Ella's secondary amenorrhea that would most likely indicate her pregnancy. Secondary amenorrhea is the cessation of menses for more than, okay, this is for more than 6 months, all right, after regular menstruation has been established. So the answer here is cat. Okay, 79 is cat according to Piliteri. Okay, how about primary amenorrhea? It is the absence of menses at age, what year? 15 years old, okay? So 79 cat. 5, 4, 3, 2, and 1. 78 is dog. 80, the nurse also asked for presence of secondary dysmenorrhea. A. Which of the following conditions is not included under secondary dysmenorrhea? Okay, kapag sinabing secondary dysmenorrhea, it is period pain that is caused by a health condition. Okay? So kapag walang health condition, it is not secondary dysmenorrhea. Okay, so ang answer dito ay pwede mag-cause yun ng pwede ang cause niya ay IUD, PID, and malposition of cervix. Ang hindi lang ay absence of any underlying anatomic abnormality. Okay? Kasi walang health condition na cause. So, 80 is dog. 5, 4, 3, 2, and 1. Yes. 81. Carla, another patient in the clinic, just found out that she is pregnant. She asked when would be her delivery date. What is the expected date of the confinement of a pregnant woman whose menstruation was from April 10 to April 13? So, ang gagamitin natin dyan ay yung Nagel's rule. This is to determine the estimated date of delivery and estimated date of confinement. Ang prerequisite niyan ay ang first day of LMP. Ano yung first day? April 10. Okay? So dito, yan, hanapin lang natin yung month. Kapag January to March yung month, plus 9 months and 7 days. Kapag naman April to December, minus 3 months plus 7 days plus 1 year. Okay? Ayan, so wait lang. Yan, type natin. April 10, no? April 10. This is, ilang months yan? January, February, March, April. Month 4. Month 4 yan and day 10. Ngayon, hanapin natin yung April dito. Nandito siya. April to December, minus 3 months. So, 4 minus 3, month 1. Day is plus 7, so 17. Okay? Wala naman siyang year kasi. So, month 1, day 17. Ano yung month 1 natin? January 17. So, the answer is apple. Okay? Apple. Ayan. 5, 4, 3, 2, and 1. 82. The nurse noted that the fundic height of Anna is at the level of the umbilicus. In documenting the data using the Bartholomew's rule or method, the most probable age of gestation in week is, ayan, so, ginagamit ang Bartholomew's method. Kung gusto nating hanapin yung weeks in AOG, AOG in weeks pala, with the level of the fundus. Kapag yung fundus ay nasa symphysis pubis, it is estimated nasa 12 weeks AOG na siya. Kapag naman nasa umbilicus, 20 weeks AOG, xiphoid process, 36 weeks. Kapag in between the umbilicus and xiphoid process, we can measure the fundic height in centimeters. Tapos yun na yung number in weeks niya. Okay? Of course, this is in the absence of complication. So, tinatanong dito level of umbilicus, it is in the 20 weeks. So, the answer here is cat. 5, 4, 3, 2, and 1. Situation. A newly married couple, Berta and Bart, wants to practice family planning to prepare a good future to her family. Nurse, being a family planning counselor, is planning a lecture regarding the different methods of family planning. Which of the following family planning methods, which identifies the fertile and infertile days of the menstrual cycle as determined through a combination of observations made on the cervical mucus, basal body temp, recording, and other signs of ovulation. Okay. Yung lactational amenorrhea method, hindi yan lactational amenorrhea method, ha? X yan. Pero ano yung tatlong criteria para masabi natin na lactational amenorrhea method yon? This is the natural method of preventing pregnancy in pregnant women, ano? So, dapat, syempre, wala siyang menstruation amenorrhea. And then, may exclusive breastfeeding siya. Okay? Natural contraceptive pala, or contraception in kakapanganak lang, hindi pregnant, ha? Hindi pregnant kasi kailangan ng exclusive breastfeeding. And then dapat less than 6 months postpartum siya. Okay? Kapag naman basal body temperature, ayan, naka-base lang siya sa basal body temperature recording. So, X lang to. Kasi, ang hinahanap natin yung combination of observations. Kapag naman sinabing standard days method, ayan, ito yung procedure dyan. So, yung mother, hindi mother, yung babae, ayan. So, nagbibilang siya. Okay. Applicable lang to sa may mga menstrual cycles between 26 to 32 days. Ayan. So, kailangan mo bilangin yung days 18 to 19. Doon ka mag-a-avoid ng pregnancy. Okay, yun yung standard days method. So, ang sagot dito ay CAT, symptothermal method. So, dito na yung may combination of observations on the cervical mucus, basal body temp, and other signs of ovulation. Okay, so 83 CAT. 5, 4, 3, 2, and 1. 84. During family planning seminar conducted in the Barangay Health Center, Nurse Bing was asked by Berta, a married woman who wants to try using contraceptives, if it is true that contraceptives will render couples sterile. So, ibig sabihin, hindi na sila pwede manganak kapag daw gumamit ng contraceptive. Totoo ba to or hindi? No. Okay? So, the answer should be no. X yang, apple, and boy. Okay? So, tingnan natin. No, it will not cause sterility if you are also using condoms. So, sa condoms lang ba? Yan. How about dog? No, once you stop using the contraceptive method, you can have children again. So, this is correct. The answer is dog. 5, 4, 3, 2, and 1. 85. Bart, the husband, further asked Nurse Bing if contraceptive methods will result in loss of sexual desire. Nurse Bing's most appropriate response would be, so nakaka-result ba siya in loss of sexual desire? Actually, may increase pa nga ng sexual desire. Kasi, in using a contraceptive, di ba, nawawala na yung fear of being pregnant. So, mas nagiging exciting yung sexual intercourse for them. Okay, so dapat ang sagot dito ay no. Okay? Tama ba? Yes. No, dapat ang sagot. So, X ang yes. Okay? So, no, but it will make you uncomfortable with your sexual relationship. So, not all naman yan, di ba? So, the best answer is no. It will actually enhance your sexual relationship. Okay, 5, 4, 3, 2, and 1. 86. In a CHN class, a student asked Mr. Pablo, the clinical instructor, if family planning methods can cause abortion. As an instructor, Mr. Pablo's response should be, so yung family planning methods, diba, it just prevents pregnancy, pero hindi siya nakakapatay ng bata. Okay? Ayan. So, dapat ang answer dito ay no. So, X na tong cat and dog. No family planning prevents pregnancy, but it does not terminate pregnancy. Tama. Hindi naman siya nakakaput ng pregnant woman at risk for miscarriage. So, the answer is apple. 5, 4, 3, 2, and 1. 87. Max Macklemore, a public health nurse, is assigned in conducting seminars on family planning program in different barangays. She is aware that the roles of PHNs on family planning program are the following except, so ano daw hindi kasama dito? Provide counseling among the clients to help increase family planning acceptors and avoid defaulters. Tama to. Provide packages of health services among reproductive age group in all health facilities. Tama rin to. Inform the clients about the importance of the benefits, advantage, and disadvantages of family planning. This is also correct. Ang mali dito ang boy. Bakit? Kasi sabi dito, ensure availability of family planning supplies and logistics for the PHNs and other barangay health workers only. Only lang ba? Hindi. Para sa lahat yan. Hindi lang sa PHNs and BHWs. Okay? So, 87 is boy. 5, 4, 3, 2, and 1. Situation. Immunization is one of the significant programs of DOH to prevent childhood morbidity. Nurse Dorothy is preparing to administer vaccination to children. She knows that the following are correct except, so negative. Okay, the vaccination schedule should not be restarted from the beginning even if the interval between doses exceeded the recommended interval by months or years. So dito sinasabi na hindi naman dapat kailangan daw mag-restart kung na-miss ng baby yung vaccine. So, hindi siya nakapunta sa next dose. Okay? Nag-exceed daw doon yung interval. Ayan. So, tama naman to. Hindi mo naman kailangan i-restart kasi nakapagbigay na before eh. Okay? So, hindi na kailangan i-restart. Giving doses of vaccine at less than the recommended 4 weeks interval may lessen the antibody response. So, kapag less than the 4-week interval, which is recommended ka nagbigay, malalesen daw yung antibody response. Is this true or false? This is actually true. Okay, positive yan. And also, yung kabaligtaran niya, kapag naman more than the interval ka nagbigay, ayan, lengthening the interval between doses of vaccines leads to higher antibody levels. So this is also true. Ang mali dito ay dog. Bakit? Use of one syringe, one needle for all the children receiving the same vaccination. This poses a risk for infection. Tapos, masakit din ito dahil mapurol na yung needle or syringe. Okay, 5, 4, 3, 2, and 1. Rose, mother of a 7-month-old baby, is asking the nurse in the health center regarding the 7 vaccine-preventable diseases. All of the following diseases are included except, so ito yung listahan ng 7 vaccine-preventable diseases natin. Yan, and hindi kasama dyan ang dengue. Okay, dog. 5, 4, 3, 2, and 1. 90, Kurt, 4, measles. Yan, may measles daw siya. His mother asked the nurse if there is a chance that Kurt will contract the virus again. The nurse's response should be based on her knowledge that, so di ba napag-usapan na natin to? Yung measles, meron siyang immunity, lifelong immunity. Kaya walang mangyayaring reactivation of old infection. May immunity siya. Okay, sa X yan. And hindi lang siya for 6 months. Lifelong siya. So the answer here is boy. 5, 4, 3, 2, and 1. Next, 91. What can you say? When can you say that a child is already fully immunized child? So according to the Philippine Statistics Authority, ito yung meaning ng fully immunized child. Okay? Ayan. Infants who receive 1 dose of BCG, so 1 dose of BCG, and 3 doses each of OPV, DPT, and Hep B, and 1 dose of measles before his or her first birthday. Okay? So the answer here is dog. 5, 4, 3, 2, and 1. Okay, next. 92. Annabelle, new mother, asked the nurse about the purpose of the first BCG vaccination given to her son. The nurse's best response should be, an early start with BCG reduces the chance of severe pertussis. So hindi yun yung ginagawa ng BCG, okay? Kapag pertussis ang gusto nating i-reduce yung chance, ayan, dapat DPT to, yung diphtheria, pertussis, tetanus, okay? The extent of protection against polio is increased the earlier the BCG is given. So kapag polio ang binibigay natin ay hindi BCG kundi OPV, okay, or IPV. BCG given at earliest possible age protects the possibility of TB, meningitis, and other TB infections. This is actually correct. Ayan, so TB siya. An early start of BCG reduces the chances of being infected and becoming a carrier. It prevents liver cirrhosis and liver cancer. So with regards to liver, ayan, ang binibigay ay Hep B. Okay, so the answer is cat. 5, 4, 3, 2, and 1. Situation, Barangay Junisha, situated in a remote area, the public health nurse conducted several health training programs regarding herbal plants that would be useful in the treatment of illness and health problems. The following can be found in a small garden of the barangay. Okay, so dito sa next slide, ayan, please screenshot. So ito yung herbal medicine laws and other herbal medicines. Ayan. So yung Traditional and Alternative Medicine Act is RA 8423. So, meron tayong Santa Lubi, Sambong, Acapulco, Nyog-Nyogan, tsaka ang gubat ang Palaya Lagundi, Ulasimong Bato, Bawang Bayabas, and Yerba Buena or peppermint. Okay, so for more information, you can read more on the herbal medicine sa White PHN book. Okay, summary lang to. Okay, so ang tanong dito ay tsaang gubat. What is tsaang gubat? It is for diarrhea, stomachache, and constipation. So the answer here is apple. Kapag hypertension, this is bawang. Kapag cough and fever, this is lagundi. Okay, 93 is apple. 5, 4, 3, 2, and 1. Okay, nyog-nyogan. How about nyog-nyogan? Ang palitandaan ko dito, nyog-nyogan. Ayan, worms, diba? So it is an anti-helmintic. Okay, 5, 4, 3, 2, and 1. Ulasimang bato or pansit-pansitan is used to. Kapag ito, palatandaan, ulasimang bato, it prevents kidney stones. So, ang kinalaman dito sa kidney ay lower uric acid levels. Okay? 95 is dog. 5, 4, 3, 2, and 1. Okay, 96. This refers to a drug outlet managed by legitimate community organization, non-government organization, and the local government unit with a trained operator and supervising pharmacist, and specifically licensed by the Bureau of Food and Drugs to sell, distribute, offer for sale, and or make available low-price generic home remedies, over-the-counter drugs, antibiotics, and medication for chronic diseases. So, anong tawag dito? This is the butika ng barangay. Okay, the rest ay private institutions. 5, 4, 3, 2, and 1. One strategy to address the problem in poor barangay aside from herbal plants is food production. Which of the following is a priority? Okay, so tingnan natin dito. Engaging in a home-based food processing business. Healthy ba kapag na-process na yung food? Diba? Diba mas gusto natin healthy? So, X yan. Kasi, process na yung food, okay? A, community managed poultry and piggery. Ito naman kasi, kailangan ng malaking funds para dito, okay? So it's not cost effective. X rin yan. How about C, tomatoes and eggplants in containers. Ito naman, mabilis kasi mabulok ang tomatoes and eggplants. So it's not ideal. Okay, best answer is B, planting plenty of malunggay. Kasi hindi naman siya madaling mabulok. Ayan. And pwede siyang itanim ng bawat miyembro ng community kay sa bakuran nila. So, 97 is boy. 5, 4, 3, 2, and 1. Situation, student nurse Natividad's favorite subject is nursing research. Because she is about to take her board exam in a few days, she brushes up her knowledge on nursing research. In conducting researches, obtaining an informed consent is important procedure. Student nurse Natividad knows that consent in researches include which among the following. Select all that apply. So, something positive ang hahanapin natin. Participant status. Ayan, yung criteria for the participants, kailangan niyang included. Nakalagay. Okay, number of people participating, kailangan din. Yan. And then, type of data collected. Of course, dapat malaman ng mga participants, diba, kung ano yung mga kailangan na data from them. Okay, nature of commitment, yan, kailangan din yan. Compensations or reimbursements, ito, medyo questionable siya. Okay, kasi as much as possible kapag research, diba, ayaw natin yung may compensation or reimbursements. Contact information, of course, kailangan to para if ever yung participant gusto niya nang i-withdraw yung participation niya, itatawagan niya lang yung researcher. So, the answer is 1, 2, 3, 4, and 6. So, ayan. Kung i-cancel kasi natin tong 5, ayan, makakancel to, makakancel yan, makakancel yan. Mawawala yung 3 dito. Okay, important yung type of data na isulat sa consent, di ba? Para malaman ng participant. So, best answer is dog. Okay, best answer is dog. 5, 4, 3, 2, and 1. 99. What is the primary purpose of conducting pilot or feasibility studies? So, dito naman, okay, yung pilot kasi usually, di ba, ginagawa siya in a small scale. Okay? Para, pagdating ng large scale study mo, ay ready ka na. Okay? Hindi naman ito yung primary purpose niya. Ayan. Usually for large scale studies na yan. Neither naman to gather more stipends. So the answer here is Apple. To prevent expensive fiascos in the future large scale studies. Okay, so parang testing lang yung pilot. 5, 4, 3, 2, and 1. 100. What makes quasi-experimental design different from experimental design? So kanina na-differentiate natin sila, di ba? Ang quasi, wala siyang randomization. And minsan, meron and walang control. Okay? So, tingnan natin. It lacks randomized sampling method. Okay? Lacks randomized, tama to. Pero sampling method ba? So, tingnan natin yung other option. It lacks an intervention group. Not all the time. Okay? Minsan meron siya, minsan wala. It utilizes randomization. Again, it lacks nga randomization. So, X yan. How about this one? It lacks randomization of assignment to treatment or control. This is correct, okay? Hindi yung sampling method yung nirarandomize, okay? So, the answer is dog. 5, 4, 3, 2, and 1. Okay, so NP3 na tayo. Okay na ba kung 5, very fast, 5-minute break lang, okay? Just to have a break. Okay, CR break. 5, 4, 3, 2, and 1. So, balik tayo ng 7:15. Okay? Hi, everyone! Okay, 7:15. Let's do this. Yan. Last 50 items. Diba? Konting kembot na lang, guys. Okay. So, nandiyan na ba lahat? Paki-type 1 nga so I know. Yes, type 1 please. Ayan. Thank you so much, guys. Ayan. Alam kong late na rin. Pero, grabe ang tsatsaga nyo. Ayan. Good job kayo, guys. Grabe. Okay. Yan. Magbubunga rin lahat ng mga paghihirap nyo, mga sacrifices. Okay, ayan. So let's start with situation. Number 1, the nurse at the operating room should be made aware of the functions and implications of being both a circulating and a scrub nurse. The following questions apply. 1, the nurse was not able to completely account for the sharps that were used during an exploratory laparotomy. The surgeon agreed to close the suture even if the situation was mentioned above. It was found out that one needle, ayan, was still left at the peritoneum of the client. The surgeon was accused of malpractice because of what happened. Which among the following doctrines explains the scenario above? Okay, kapag sinabing subpoena duces tecum, ito, ang ginagawa nito, so, pinapapunta ka lang niya sa korte, and pinapadala ka niya ng relevant documents. Okay, that is subpoena duces tecum. Kapag naman force majeure, ayan, may major force na nangyayari. So, this frees both parties from obligations if an extraordinary event directly prevents one or both parties from performing. Okay? So, ayan. Parang merong uncontrollable major event na nangyari. So, hindi nyo naman kasalanan yun. Ayan. So, yung force majeure. And yung situation na to, hindi siya force majeure, hindi rin siya subpoena duces tecum. Okay? Kasi wala namang major event na nangyari na unexplainable event, extraordinary event. Okay, hindi rin naman siya duces tecum. Okay. Respondeat superior ba siya or res ipsa loquitur? A or C? So ito, di ba, kapag respondeat superior, and from the word itself, mananagot yung superior mo sa maling ginawa ng subordinate. So in this case, sino yung superior? Di ba? Yung surgeon, kasi siya yung captain of the ship. Yung sa OR. Ang subordinate niya dito yung nurse. So ang tanong, may ginawa bang mali ang nurse? May mali bang ginawa ang nurse? So lagay lang natin ang definition dito ng respondeat superior, ha? May mali bang ginawa ang nurse? Yes? Hindi po nag-count? Nag-count siya, ha? Ayun, no? Sabi, the nurse was not able to completely account for the sharps that were used during an exploratory laparotomy. Ibig sabihin ng completely account ay, ayan, may kulang daw. Okay, may kulang daw sa mga sharps. Yun ang ibig sabihin nun. Paano niya malalaman kung walang kulang, di ba? Kung hindi siya nagbilang. Okay? So, ibig sabihin may nawawala daw. Tapos, sinabi niya na yon. The situation was mentioned above to the surgeon, pero the surgeon agreed to close the suture. Kahit na, minention na sa kanya. Diba? So, sino may pagkakamali dito? Nurse or surgeon? Yung surgeon talaga. Kasi sinabihan na siya. Oo. Kaso, ayun nga, nag-agree siya to close. Tapos, ang nangyari pa, nakakita sila ng needle. And, pumapasok na dyan yung res ipsa loquitur. The evidence or the thing speaks for itself. So, from this one needle na nakita sa peritoneum, it speaks for yung pagkakamali ng surgeon, yung malpractice ng surgeon. Okay? So, the answer here is apple. Okay, 5, 4, 3, 2, and 1. Ayan, sana clear tayo doon. Clear ba? Yes, okay, good. Ayan. 5, 4, 3, 2, and 1. Number 2, which among the following is considered as part of the intra-op phase? Okay, so may 3 phases tayo, di ba? Pre-op, intra-op, and post-op. Okay, so tingnan natin dito. Wait lang. 3 phases of the surgery. Ayan, kapag pre-op, usually, This occurs kapag yung patient nasa surgical ward pa, transition room, waiting room, and restricted zone. Kapag naman, intra-op, nasa OR restricted zone siya. Kapag post-op, nasa semi-restricted area, recovery room. Okay, so tingnan natin isa-isa yan. Okay, a patient diagnosed to have constrictive pericarditis, kakadiagnose pa lang niya, nasa ward pa lang. Okay, so this is pre-op. Patient having 2 CTT, excuse me, after a heart transplant, excuse me, ayan, this is in post-op. Induction of anesthesia, nangyayari to while in the OR, so this is in intra-op. Patient has decided to have reconstructive surgery, so kakadecide niya pa lang, nasa ward pa, this is pre-op. Okay, so ang hinahanap natin na intra-op, intra-op is 2, so boy. 5, 4, 3, 2, and 1. Ayan, pakitama na lang please. And then, basta yung superior. Ang tanong dito, ma'am, yung respondent superior for the employer lang po ba yun? Or for the surgeon din po? Basta kung sino yung superior doon, may superior subordinate relationship. Okay, in this case sa OR, meron pa rin ganun. Kasi yung surgeon, siya yung captain of the ship sa OR. Okay, may superior subordinate relationship pa rin. Okay? Ayan. Okay, number 2, boy. 5, 4, 3, 2, and 1. Okay, which part of the anesthetic ladder is the patient noted to have increased autonomic activity? Alright, so ito yung ladder. Yan, medyo mahaba lang, pero we will discuss it. Okay. Ayan. So, sa first level, yung analgesia or disorientation phase, so, yung patient nararamdaman niya na yung effects ng anesthesia, pero hindi pa siya nagiging unconscious. So, this usually ends with loss of consciousness. Tapos, yung excitement or delirium phase na. May disinhibition, delirium, uncontrolled movements, loss of eyelash reflex, hypertension, and tachycardia. Yung airway reflexes dito ay gumagana pa. So, it remains intact. Kapag naman surgical anesthesia, ayan, nangyayari na to kapag naka-general anesthesia yung kliyente. So, nagsistop na yung eye movements and nagkakaroon na ng respiratory depression. Yan, which are hallmarks of this stage. May airway manipulation na. Okay? Which is safe at this level. Kapag naman overdose, ayan, too much anesthesia is given to the client, which results in the worsening of an already severe brain or medullary or respiratory depression. This stage begins with respiratory cessation and ends with potential death. So, increased autonomic activity. This is in uncontrolled movement. So, boy, delirium phase. 5, 4, 3, 2, and 1. 4. Which among the following is not a principle of surgical asepsis? Ayan. So, always face the sterile field. Is this positive or hindi? This is positive. Kasi kapag tinalikuran mo yung sterile field, di ba? Magiging unsterile siya. Okay? Sterile articles unused and unopened are still considered sterile after the procedure. Tama or hindi? Hindi. This is negative. Kasi, ayan. So, yung package, di ba, ng unused and unopened sterile article, na-expose siya sa air currents. Okay? Kaya, kailangan, di ba, mas safe kung isa-sterilize natin siya ulit. Alright? So, ayan, the answer here is boy. How about C? The sterile field is above the waist level. So, tama naman yan. And on top of the sterile field, correct. Eliminate moisture that causes contamination. This is also correct. Kasi, moisture harbors the microorganism. Okay, so 4 is boy. 5, 4, 3, 2, and 1. 5. Which among the following post-op complications is characterized as the collapse of one lung segment or the whole lobe or another alveolar groups? So, kanina, di ba, pahapyaw ay diniscuss natin yung atelectasis, which is the collapse of one lung segment or the whole lobe. Okay? Ayan. Pulmonary embolism, ano to? Nangyayari to kapag may blood clot na nasa-stuck sa arteries in the lung. Okay, pneumoectasis. Ectasis meaning distension and pneumo lung. So there is distension of the lungs. Walang pulmonary shock. Okay? 5 is boy. 5, 4, 3, 2, and 1. 4 is boy. Situation health education is an area of nursing practice when the nurse can be creative and independent in the work setting. The following questions apply. A nurse is developing a teaching plan for Isabel, 18-year-old, with bronchial asthma. She has an order for discharge. Which part of the teaching plan should be given priority? Okay. Quick relief medicines as ordered, priority ba to? Hindi, kasi this is a dependent nursing action. Okay? Wash bed sheets in warm water. Usually this is indicated for what? Parasitism. Okay? Not in bronchial asthma. So, X yan. Avoid going to malls. Ito indicated naman siya sa clients na may or nag-undergo ng chemotherapy. Okay? So, X din to. Answer is, boy, avoid contact with fur-bearing pets. Kasi yung fur, it can act as a trigger. Okay? 5, 4, 3, 2, and 1. Next. 7, Mr. Gilbert, for postural drainage, the nurse should position the client's head at. Ayan. So, ano ba yung postural drainage? This is the use of positioning to drain secretions from the airways using gravity. Okay? So, ilang minutes ba dapat ang postural drainage? 25 minutes ba or less? It is actually indicated for 10 to 15 minutes only. Okay? Matagal na ang 25 minutes. So, X yung boy and dog. Ngayon, no greater than 25 degree downward or 25 degree at lateral angle. Downward angle meaning maharap. Kapag lateral angle, syempre pa side, di ba? Lateral. So, anong mas maganda para madrain ang secretions from the airways using gravity? Syempre yung downward angle. Okay? So, 7 is apple. 5, 4, 3, 2, and 1. 8. Nurse Bianca is teaching Michelle, an asthmatic, on how to use the spirometer. She should instruct the client to have the mouthpiece. Okay. Dito, spirometer is also known as incentive spirometry. Ang palatandaan ko dyan, incentive, ayan, incentive spirometry, ang kailangan ay inhalation. Okay, kapag inhalation, ayan, hindi kailangan ng exhalation. Breathing, ayan, kapag breathing, we have both inhalation and exhalation. Kailangan lang natin ay inhalation. So the answer here is cat. Okay, 5, 4, 3, 2, and 1. Nurse Bianca is teaching a client on how to use metered dose inhaler to prevent asthmatic attack. Okay? While in the hospital, she should instruct the client to do the following except, so kung hindi daw kasama dito, negative. Use the inhaler as ordered, syempre, positive yan, di ba? Kung ano yung in-order ng doktor, yan yung susundin natin. Use the inhaler before she takes meals? Yes. Bakit? Kasi if i-take yan after meals, di ba, puno yung tiyan, mas mahihirapan siyang huminga. Okay? Kasi malapit yung tiyan sa diaphragm. Okay? So this is positive. Do oral care after use of inhaler. This is also positive. Kasi usually in the use of inhaler, may gamot yung kasama. Okay? So, kailangan gumawa ng oral care para mawala yun. Okay? And so ang answer dito ay apple. Keep the head of bed at 15 degree angle. Okay, bakit? Bakit to except or mali? Kasi mas effective kung magsisit siya upright. Okay? Mas makakahinga siya kung magsisit siya upright as compared mo naman kung naka 50 degree angle. So 9 is apple. 5, 4, 3, 2, and 1. 10. You're conducting health teaching sessions to clients with cardiovascular disorders. Client Pedro asked you this question. Tell me, nurse, what should I do with my hypertension? The best response of a nurse is, ayan. So kapag hypertension, ayan, to effectively manage hypertension, mas maganda kung combination ng medicine, ng prescription of medicine, di ba? Ng diet, ng exercise, ayan, lifestyle change talaga. Okay? So, saan yan dito? Include garlic in your meals. We know garlic is a herbal medicine to manage hypertension. Tapos, with regulation of alcohol consumption. Ito naman, kulang siya. Kulang siya nung medication, diet, and lifestyle changes. Okay? Ito naman, kulang din siya ng medication. Alright? Kulang yan. Yung B, strictly follow your prescribed daily exercise and smoking cessation. So, ito kulang din siya. Best answer is cat. Comply with your diet, lifestyle modification, and prescribed medicines. Okay? So, 10 is cat. 5, 4, 3, 2, and 1. Situation, Mr. Conrado, being prepared for major surgery. Legal preparation for surgery consists of checking all the required forms for the operation. Equally important is to make sure that the patient is physically, psychologically, and emotionally ready for the procedure. Wait lang. Okay. So 11, informed consent is a process that gives the patient opportunity involved in his or her care. As patient advocate, the nurse ensures the following 3 conditions that are present to make consent valid, except, so hindi kasama dito. Adequate disclosure of the diagnosis by the physician. This should be included. So, dapat alam ng kliyente ang diagnosis niya. Okay? Para makapag-decide siya na maayos, di ba? Comprehension of information by the patient before the operation. So, kailangan ng understanding. Yes, positive. Patient voluntarily gives consent. This is positive. So, kailangan voluntary yung pag-give ng consent. Hindi natin siya kinu-coerce para magbigay siya ng consent. So, the answer here is dog. Form signed by any close relative or watcher. Kasi kailangan ang mag-sign ay ang pasyente. Okay, 5, 4, 3, 2, and 1. 12. The patient asks you, what do you think of my surgeon? You answered, he's not really the best one, and he seems not to care for the patient. As a result, the patient switches to another surgeon. Hala. The latter may have grounds to sue you for? So dito, di ba? Ang issue dito ay defamation. It's either slander or libel. Okay, ano ba ang pinagkaiba nilang dalawa? Wait lang. Kapag libel, involved ang public. So, usually there's publication of defaming information. It can be also oral as long as the public knows about it. Example, cyber libel. Slander naman kapag private yung conversation between people. Ayan. Loud conversation, yan, nangyayari yan minsan. May iba tuloy nakakarinig ng defamation. Witness is required. Slander by deed, merong ganyan. It is through action naman. Example, kapag nanampal in public. Okay, so wag basta-basta mananampal in public. Baka makasuhan ng slander. The one that carries reputation is your face. Okay, so ano to? Itong conversation na to, this is private. So it's slander. Apple. 5, 4, 3, 2, and 1. 13. One of your patient's visitors whisper to you, I hope you will not try to revive my dear friend if her heart stops, as she has already suffered a lot. The correct response is, yung decision ba up to the physician? Diba up to the patient? So, X yan. We are all trained in cardiopulmonary resuscitation. Okay. There is a DNR order in her child. So, in her chart. So, dapat mo bang sabihan yung patient visitor niyan nung nasa chart niya? No. Hindi dapat kasi hindi naman siya part ng healthcare team. So, yung nasa chart, wag mong sasabihin sa kanya, okay? Baka magkaroon pa ng breach in confidentiality. I understand your concern, but I can't discuss this matter with you. This is an appropriate response. The answer is dog. 5, 4, 3, 2, and 1. 14. Ayan. According to the Joint Commission, the most frequently cited factor in sentinel unanticipated events that lead to a patient's serious physical or psychological injury is, ayan, so meron tayong listahan. And in order na to, okay? Ayan. So, yung pinakauna yung human factors. Isa-isahin muna natin ito. Confusion with health team. Ito ay related sa communication. So, 3 siya. As well as itong boy. Yung incompetence, this is a human factor. Okay? Policy changes are not followed by adequate and consistent staff education. Pwede siyang pumasok sa leadership kasi hindi na-follow. Ayan. Pwede rin health information technology related. Pero of course, mas mataas pa rin ang health factor, CAT. Okay, 5, 4, 3, 2, and 1. situation, conducting research is one of the major roles of the nurses, both in the hospital and community settings. To be able to develop such competencies, the nurse has to undergo an actual conduct of the research process. So which of the following statements best describe a researchable problem? So tingnan natin. A, responses of parents toward having the children with congenital heart diseases. So, ang focus natin ang parents. Mas maganda sa research kung focus ay patient. Okay? So, X to. Same with C, incidence of medication errors and reporting practice of healthcare professional in teaching hospitals. Ayan. So, ang focus dito ay healthcare professional. Mas maganda kung ang focus ay patient. So, X yan. So, how about B, the relationship between relaxation technique and relief of pain of post-CABG patients in the surgical coronary care unit? Kasi ito naman, dog, to what extent do pre-op teaching affect the length of hospitalization of patients going to surgery? Ano ang mas complete dito? B or dog? B or D? Mas complete ay boy. Yes, very good. The answer is boy. Okay, 5, 4, 3, 2, and 1. 16. Nurse Jessie has to undergo literature search for her study. She can avail of this from the following except, so ano daw ang hindi kasama dito? Okay. Ano hindi kasama dito? Summary of research articles that are relevant to the study. Kasama to kasi research articles. Ayan. A written document published by the investigator herself. Kasama din to kasi na-publish na siya. Available na siya. Okay? And then any retrieval from the website that will help her search for the subject on investigation or a description of the scientific study from an information provided by a faculty member teaching research. Itong website and faculty member teaching research, we can establish the the credibility of these two. So, titingnan na lang natin kung ano yung mas makakatulong. Ang mas makakatulong ay nakasulat na, that will help her search for the subject on investigation. Cat. Ay, hindi cat yung sagot. Okay, kasi hinahanapan na natin except. So, ang sagot dito ay dog. Okay? 5, 4, 3, 2, and 1. 17. Weight is taken as the baseline measurement of obese female adolescents as study subjects for a weight reduction program. This is repeated to note any changes. This pretest is done to, so kapag pretest, diba, minimeasure natin yung baseline. Ayan, nandyan na rin yung sagot. So, we obtain preliminary data before a treatment is conducted by the researcher. So, X yung A and C. Yan, hindi naman siya nakaka-evaluate or determine the effectiveness. Alright? Hindi rin siya nakaka-assess if appropriate yung research design. So, 17 is dog. 5, 4, 3, 2, and 1. 18. A nurse researcher is using AccuCheck, a monitoring kit to test presence of diabetes mellitus among her study subjects. How do you classify this type of measurement? So kahit hindi natin alam yung AccuCheck, andyan na siya. Monitoring kit to test presence of diabetes mellitus. So we're thinking this is a glucometer. Ayan, microbial, hindi naman yan nakaka-test ng or nakaka-measure ng microbes, tsaka ng cells. Okay, so X yan. Hindi rin nakaka-test ng chemicals. Nakaka-test siya ng physiologic function. Ano yung physiologic? Meaning having to do with the functions of the body. Okay, so 18 is cat. 5, 4, 3, 2, and 1. Yes, very good. 19. Nurse Jessie wanted to conduct a study using the quasi-experimental design. This design will need A. So again, quasi-experimental, may manipulation? Meron, wala? Again, kapag quasi-experimental, merong manipulation? Meron or minsan walang control? And walang randomization. Yun yung quasi-experimental. Okay? Meron siyang manipulation. Okay, yan yung quasi-experimental. Now, tingnan natin yung options. Retrospective evaluation. Hindi. Yung retrospective, ayan, hindi naman necessary na kailangan yung evaluation mo ay from the past. Okay? Or from the past yung i-evaluate mo. Field setting for the study, hindi nang kailangan. Comparable group, ibig sabihin, merong control. Ayan. So, ibig sabihin, meron kang control. Meron kang inassign ng intervention, meron hindi ka inassign ng intervention. Okay? How about itong D? Manipulation of the dependent variable. May manipulation ba ng dependent variable? Yes or no? No. Kasi yung minamanipulate natin ay independent variable. Yes, very good. So, X to. The answer here is cat. Comparable group. Okay, 5, 4, 3, 2, and 1. So, question 16 po, kahit may any na discrepancy, kasama pa rin po ba? Question 16? Yes, as long as it will help her. Okay? Kasi nga, both to, hindi natin ma-verify yung credibility. Alright? Ito kasi ang sinabi niya lang dito, a description of the scientific study. Okay, hindi naman natin malalaman to kung, ano ba to, relevant ba to, makakatulong ba to sa literature study niya, diba? So, ang answer pa rin ay dog. Okay. So, answer dito sa 19 is cat. Situation, Casey, a 48-year-old bank manager is receiving an antihypertensive drug intravenously for control of severe hypertension. Ayan. So, again, receiving antihypertensive drug intravenously for hypertension, severe hypertension. The client's blood pressure is unstable and is 160/94 before the infusion. 15 minutes after the infusion is started, the blood pressure rises. Ayan, to 180/100 mmHg. Ano nangyari? Nagbigay na siya ng antihypertensive drug. Diba? Bakit tumaas pa rin yung blood pressure? Ang tanong dito, the response to the drug is described as a hindi naman siya allergic response. Wala namang sinabing symptoms ng allergy. Okay, synergistic response usually, ito siya, ang meaning niya is combined effect is greater than the sum of their separate effects. Usually, nakikita tong response na to kapag may kasama ng ibang gamot. Okay? Ito naman, mag-isa lang siya, ayan, na gamot na binigay, antihypertensive drug. Kapag paradoxical response naman, ibig sabihin, opposite the intended effect yung nangyari. So the answer is cat. Hypersusceptibility response naman, yan, increased predisposition of certain individuals to react to a chemical. So increase lang yung susceptibility niya. Okay? Yun yung sa dog. Ang answer ay cat. 5, 4, 3, 2, and 1. Okay. Casey is further being treated for hypertension, reports having persistent hacking cough. The nurse explains that this may be a side effect associated with. So lahat to ay antihypertensive drug. Okay? Ano ang sagot dito? The answer is apple. ACE inhibitors. So, recent studies indicate that cough may develop in around 10% of patients treated with ACE inhibitors. So, 21 is apple. 5, 4, 3, 2, and 1. Yes, ang galing naman. Yan, keep up the good work, guys. Yan. 22. What should the nurse assess to determine if Casey is experiencing the therapeutic effect of valsartan, an angiotensin II receptor blocking agent? Okay, so since this is a antihypertensive drug, syempre ang therapeutic effect niya nasa BP. Okay, dog. 5, 4, 3, 2, and 1. Yes, very good. 23. To assess the effectiveness of vasodilator administered to a client, what should the nurse assess? Syempre, vasodilator, it dilates the blood vessel. So, sa blood pressure, okay? Then sa pinag-uusapan pa rin natin dito ay hypertension. 5, 4, 3, 2, and 1. Yes. 24. Nifedipine, 90 mg prescribed to another client with hypertension. The nurse should instruct the client to notify the physician if the client experiences. Okay, hindi side effect ang blurred vision and excessive urination, okay? Pwede pa ang dizziness on rising and hypotension, orthostatic hypertension, and difficulty breathing. Ano ang mas importante na i-notify yung physician dito? Yung difficulty in breathing. Okay? So the answer is dog. 5, 4, 3, 2, and 1. Situation: problems in oxygenation involves patients with disturbances in lower and upper airways. Nurse Benji, a pulmonary nurse, is attending clients with respiratory diseases. So 25, Nurse Benji observes an anxious client hyperventilating after learning that his wife met an accident and intervenes to prevent. Anong i-prevent? So kapag may hyperventilation, Ayan, anong mangyayari? There is excess carbon dioxide loss. Okay? So, kapag may carbon dioxide loss, nag-lead yun sa carbonic acid deficit in the body. So, since mababa yung acid in the body, kaya nagkakaroon ng alkalosis. Since this is a respiratory problem, respiratory alkalosis. Okay, so the answer here is, hindi siya mag-lead kaagad sa cardiac arrest. Ayan. Hindi rin mag-lead kaagad sa reduction in serum pH. Walang excess oxygen saturation. So, answer is boy. 5, 4, 3, 2, and 1. 26. Nurse Benji admitted another client with arterial blood gas report indicates that the client's pH is 7.25. So, ito yung normal values, guys. Kabisa nito. Okay? Yan, 7.25 is low. So, acidic siya. PCO2 is 35. So, it's normal, pero nasa lower range. Okay? Lower range. Yan. HCO 320 is low. So, following room. Yan, a new room. Respiratory, opposite. Metabolic, equal. Ba't ganyan? Yan. Metabolic, equal. So, tinitingnan natin dito. Yan. Kapag respiratory, CO2. Kapag metabolic, HCO3. Okay? Tinitingnan natin yung arrow. Kapag respiratory, ibig sabihin opposite yung arrow ng pH and PCO2. Kapag metabolic, equal. So, equal dapat yung direction ng pH and ng HCO3. In this case, this is metabolic kasi equal yung direction nila. And metabolic ano to? Kapag mababa yung pH, it is acidic. Okay? Kapag mataas, alkalosis. Okay? So, this is metabolic acidosis. Apple. 5, 4, 3, 2, and 1. 27. A client's ABG report indicates the pH is 7.52. So, mataas ang pH niya. PCO2 is 32. Yan, 32 mababa. Kapag nag-exam, guys, ang ginagawa ko pa pala dito, parang ganito rin. Sinisulat ko yung normal values para, ayan. Pero kasi, mabagal pala yun, no? So, kailangan talaga kabisado mo. Okay? Up, down lang yung nakasulat sa papel. Ayan. So, ulit. Nasa na tayo? PCO2, 32. So, mababa. HCO3 is normal. Okay? Following room, respiratory is opposite. Okay, that is respiratory alkalosis. Respiratory alkalosis, di ba usually, yun yung cause nun ay hyperventilation. Di ba? So, ibig sabihin ng hyperventilation, may excess ventilation. Kaya hyper. Dito sa airway obstruction, mayroong hyperventilation? Wala. Hypoventilation to. So, this is respiratory acidosis. Ito namang nutrition, gastric suction, yan, metabolic, metabolic yan. Hindi yan sa respiratory, di ba? Nutrition and gastric suction, di ba? Metabolic functions yan. Okay? Airway is respiratory. Ventilation is respiratory. Okay? So, ito naman, respiratory alkalosis to. Kasi, merong hyperventilation. So, the answer here is dog. Okay? 5, 4, 3, 2, and 1. Nurse Benji understands that in the absence of pathology, a client's respiratory center is stimulated by, dalawa lang yan, it's either oxygen or carbon dioxide. Ano yung nagsistimulate ng respiratory center natin? Yung carbon dioxide. So, sinasabi na the respiratory center in the medulla primarily responds to increased carbon dioxide in the concentration in the blood. Okay, so kapag may increased carbon dioxide in the blood, it simulates breathing. Okay, so the answer is dog. 5, 4, 3, 2, and 1. Yes, very good. 29. The client stated that the physician said that the tidal volume is slightly diminished and asked the nurse what this means. What explanation should the nurse give the client? Tidal volume is the amount of air. Yan. So, ito yung definition ng tidal volume. It is the amount of air exhaled after a normal inspiration. Okay, so exhaled. Mali na to, C and D. Exhaled, what? After a normal inspiration. So, the answer here is boy. 5, 4, 3, 2, and 1. Situation Ken, 16, foreigner admitted in the medical ward due to abdominal pain, nausea, and vomiting by nurse Tessie. In initiating care for patient Ken, which of the following would be an appropriate question to be asked by nurse Tessie in her assessment? Okay, so tingnan natin dito. Since this is the doctor's order, you have to drink ice water instead of hot water. Hindi naman to din question, tsaka nakadepende siya sa doctor's order. Okay, so X yan. You have any books I could read about the people of your culture? So ito, pwede naman to, pero kasi, di ba, we don't want to bother the patient that much. Di ba, manghiram tayo ng books, nakakahiya naman. Di ba? Pwede tayo mag-research. Yan. How about C? Do you need to set aside your cultural practices and comply with the hospital rules and regulations? So ito naman, parang hindi appropriate yung question na to. Di ba? Parang pinag-a-adjust mo pa yung pasyente. So, mas maganda kung nurse na yung mag-adjust. So, is there anything I'm doing that is not acceptable to your culture? This is the correct answer. 5, 4, 3, 2, and 1. 31, Nurse Tessie respects cultural practices integration in her nursing care plan. Which of the following nursing action is most representative of the culturally competent nurse? Ayan. So, dito, help patient Ken to learn and understand the language. Yan. So, kapag tinuruan mo siya ng Filipino or ng Tagalog or ng any other language, ayan, ay magiging cultural competent nurse ka na. Diba? Most represented tayo. So, X yan. Explain and validate the health knowledge and beliefs of patient Ken with that of the hospital. So, dito naman, with the health beliefs, hindi naman, kailangan na i-validate natin yon. We just have to respect the beliefs of the client. Okay? Help patient can identify ways to relate more to the culture where they now resides. Pwede naman to, pero mas maganda kasi kung, yun, mag-adjust yung nurse. Okay? Kesa sa pasyente. So the answer is dog. Ask patient Ken to help nurse Tessie in knowing more about the culture of his origin. Dito, napapakita ni nurse Tessie na she cares for the patient as well as may initiative siya para ma-improve yung care na ibibigay niya. Okay, so 31 is dog. 5, 4, 3, 2, and 1. 32. The family of patient Ken requests utilization of warm compress with banana leaves to patient Ken. Which of the following is the most appropriate response of nurse Tessie? Alternative therapies, costless ba? No, not all the time. Diba? Are used when traditional therapies are not effective. Hindi rin. Okay, not all the time. Okay, ito naman, use of when hindi naman, okay? Kahit na hindi effective yung traditional therapy, pwede namang gumamit ka agad ng alternative therapy. Utilize natural products will traditional therapies do not. Hindi. Meron ding natural products ang traditional therapy. Can be effective as traditional therapies for some conditions. So, it depends pa. And that is correct. So, 32 is dog. 5, 4, 3, 2, and 1. The patient Ken's family requests time for spiritual healing process in the hospital. This is allowed by Nurse Tessie and the hospital because D formalizes the religious dogma. So, hindi naman yan yung primary purpose, para mag-formalize, is non-denominated community service. Non-denominated meaning not part of a church. Okay? So, X rin yan. Hindi naman yan yung purpose natin. Demonstrate people being responsible for their life patterns or give fulfillment and meaning to the patient and the family. Best answer is apple. Okay? So, we allow this kasi this will give fulfillment and meaning to them. Alright? So, 33, apple. 5, 4, 3, 2, and 1. 34. Positive practice environment. Ayan, influences the healing process. Which of the following ways can help Nurse Tessie create a healing environment? Excuse me. So yung positive practice environment, yan. These are settings that support the provision of quality patient care by ensuring health, safety, and personal well-being of the staff. Okay, so related siya sa staff. So, ensure that relatives and friends visit the patient. So, walang kinalaman to sa staff. Ito rin, wala. About the client to. About television to. And so the answer is ensure that the staff nurses does not experience burnout. Okay? Ayan. So 34 is dog. 5, 4, 3, 2, and 1. Situation, Julie, 28, diagnosed with DM. She was advised by her family to be admitted to undergo preservation for insulin therapy. Her blood sugar ranges from 200 to 210. At 6 a.m., Nurse Cynthia administered her insulin injection. After 2 hours, the patient complained of cold, clammy, perspiration, chilly sensation, and abdominal discomfort. Which of the following is the priority nursing action that the nurse should perform? Okay, so dito, the client is experiencing hypoglycemia. Okay, so anong gagawin natin? Take blood pressure? Hindi. Hindi rin warm blanket, urine testing. So, syempre, mas maganda kung i-address natin yung concern nyo, which is hypoglycemia. So, give sources of glucose. Okay, apple. 5, 4, 3, 2, and 1. 36. Patient Julia has been classified to have type 2 DM. Which of the following is not a typical manifestation of individuals with this condition? So, frequency of urination or polyuria, kasama yan. Polyphagia, kasama rin. Polydipsia, kasama rin. Not weight loss. Due to the polyphagia, weight gain pa nga ang mangyayari. So, the answer here is dog. 5, 4, 3, 2, and 1. 3 minutes na lang. Sorry guys, mag-extend tayo onte. Situation, Mr. Dencho, 58, admitted to the pay ward because of respiratory problem. The nurse initiated oxygen treatment by mask, but the client refuses despite the encouragement by the wife. The client is aware of the benefits of the treatment. Ano daw yung priority? So as the opinion of the wife, hindi niya yung priority kasi hindi siya yung patient, ba? Conduct consensus building. Kailangan mo pa magpaboto. Ayan. Hindi naman, di ba? So, X yan. Let attendant physician decide. Ang physician ba ang magde-decide or ang patient? Siyempre, ang pasyente. So, X rin ito. So, the answer here is, dog, respect the decision of the client. 5, 4, 3, 2, and 1. 38. You're taking care of Mr. Domingo, who is on the last cycle of radiation therapy for his lung cancer. You should instruct Mr. Domingo to brush teeth and gums vigorously ba? Nako, hindi. This would lead to bleeding. Okay? Wait 1 hour after treatment before eating. Hindi naman indicated to. Use mouthwash containing alcohol every 2 hours. Hindi rin. Ito, malito kasi this could irritate the oral mucosa. Okay? Now, should we avoid drinking hot fluids? Yes, kasi yung hot fluids, it can also irritate the oral mucosa. So the answer here is dog. 5, 4, 3, 2, and 1. Situation, Ina is a nurse on duty in the medical ward and many of her patients are suffering from problems of oxygenation. The following are relevant to be documented when taking the health history of the client with anemia except, so ano daw hindi kasama? Does alcohol affect RBC production? Yes, it actually decreases the RBC production. So this is positive. Fatigue and weakness is a symptom of anemia. Dietary intake should also be considered kasi may anemia tayo na diet related, which is the vitamin B12 anemia. Episodes of bleeding. Ayan, is this related with anemia? Yes or no? No? This is not related? How about yung iba? Actually, guys, this is related. Yes, kasi, di ba, bleeding? So, pwedeng bumaba yung number of RBCs. Di ba? So, this is also positive. So, the question na to is bonus. Okay? 39 bonus. 5, 4, 3, 2, and 1. A client with congenital heart disease is suffering from thickening of the skin under the fingers due to chronic hemoglobin desaturation. Which of the following specific term should Ina use to accurately describe most the client's condition in the chart? So kapag sinabing peripheral cyanosis, there is bluish discoloration in the periphery. So hindi yan yung sagot, okay? Thickening of the skin, hindi yan yung sagot. Pallor of the fingertips. Ayan, pallor meaning decrease in the color of the skin sa fingertips. Hindi yan yung sagot. Peripheral neuropathy. Neuropathy meaning loss of sensation sa peripheries. This is not the answer. So, by method of elimination, the answer is a dog. Okay, 5, 4, 3, 2, and 1. When the nurse is assessing a client with congestive heart failure with pitting edema, the nurse's documentation will include which of the following? Siyempre, kapag pitting, di ba, ibig sabihin, kapag pinrest mo yung edema, merong indentation. That is pitting. So, we have to measure the degree of the pitting edema, time of indentation recovery, so kailan daw bumalik yung skin, so this is correct. Depth of edema, of course, so the answer is dog, 41 dog. 5, 4, 3, 2, and 1. 42. Mr. Gabi is with left-sided heart failure. In his documentation of her assessment findings will include the following except, so kapag left-sided heart failure, pulmonary symptoms yan. This is pulmonary symptoms, pulmonary, and pulmonary. Ang hindi nakasama dyan ay edema, which is a systemic symptom commonly found in right-sided heart failure. Okay, 5, 4, 3, 2, and 1. 43. A client is on diuretic therapy. Expected entry in patient's chart should include the following information except, anong hindi kasama dito dapat? Serum electrolytes monitored. Siyempre, kasama to. Kasi, baka, merong electrolytes na pala na bumababa because of the diuretic therapy. Intake output, recorded yan. Kasi nga there is increase in urination. Lasix administered at 8 o'clock in the evening. Ito, dapat ba ito kasama sa management natin or sa documentation? Hindi. Kasi, bakit? Kasi sa evening, di ba, kapag nag-diuretic therapy, ay, sa gabi, maihi yung kliyente. So, we want to prevent that, di ba? Napatayo-tayo siya sa gabi. So, this is negative. Weight is taken before the drug is given. This is positive, okay? For 2 reasons. Pwedeng for, baka kailangan i-recalculate yung dose, or, baka naman, may significant difference na sa weight niya, no? Dahil sa excess urination. So, the answer is cat. Okay, 5, 4, 3, 2, and 1. Situation, Nurse Dante admitted new patient to the med ward. Ayan. Complaints of diarrhea for more than 2 weeks prior to consultation. The diagnosis was made, it is Crohn's disease. A plan of care was made for Liam. Which of these assessments does Nurse Dante expect to see in the patient's records or something positive? Weight gain? May diarrhea si client. May weight gain? No. So this is negative. Arthralgia is joint pain and is usually included in the symptoms of Crohn's disease. 10 to 20 liquid bloody stools per day. This is actually for ulcerative colitis. Kapag Crohn's disease, less than 10. Okay? Less than 10 stools per day. Tenesmus, this is frequent urge to go to the bathroom. So, this is positive. Anorexia, yes, dahil nga merong diarrhea. Crampy intermittent pain, yes. So, the answer should be 2, 4, 5, 6. That is dog. Okay, 5, 4, 3, 2, and 1. 45. Nurse Dante should include which of the following interventions for Lian? Okay, so si Lian, meron siyang Crohn's disease. Increase physical activity to promote intestinal activity. May diarrhea si client, ipopromote mo pa yung intestinal activity? No. Okay? Hindi mo rin i-increase yung intake of raw fruits and vegetables kasi mataas yung sa fiber as well as yung C. Okay? Yan. Dahil nga, may diarrhea na si client. So, di yung sagot provides its bath for skin excoriation from bowel movement. So, this is for the healing of the skin excoriation. Dahil nga, less than 10 times siya na diarrhea per day. 5, 4, 3, 2, and 1. What is a priority for Lian if the latter develops fistula from CD? So, kapag may diarrhea, excess diarrhea, ano yung priority natin? Siyempre, yung actual muna before yung psychosocial, di ba? The answer here is apple, fluid and electrolyte imbalance. 5, 4, 3, 2, and 1. Very good. Which of the following signs and symptoms may suggest presence of megacolon from anti-diarrheal drug use? So, megacolon, di ba? Malaking colon, megacolon. Di ba? Merong distension or inflammation of the colon. Ano yung usual na symptoms yan? It is fever. Okay? Boil 5, 4, 3, 2, and 1. Yes. 48. If Lian were a geriatric lion, which of this is the first indication of dehydration from fluid volume depletion? Okay, usually, yan, ang symptoms yan ay altered level of consciousness. Ano yan dito? It is boy altered mentation. Okay? 5, 4, 3, 2, and 1. Situation Maria 42. Teacher with cardiac ailment nervously informs the doctor that her goiter is getting bigger and distracts her while swallowing food. Okay, may goiter daw siya. The physician who examined her instructed the nurse to admit Maria to prepare for surgery after medical clearance. While interviewing patient Maria, she claims that she is anxious for the upcoming surgery. You expect the following signs and symptoms when one is under stress, except, okay, kapag ba stress ay agad-agad na nagkakaroon ng blood loss? No. So, this is the answer. Possible pa tong increase RR, decrease mobility, and magkaroon ng pain. Okay, due to stress. So, 49 is apple. 5, 4, 3, 2, and 1. Yan. 50, based on your knowledge, patient Maria who has history of cardiac illness should not be given an enema before surgery. Which of the following reasons inhibits the order of enema for patient Maria? Enema? Ayan, sabi ma'am, break ma'am please. Okay, so let's go back after 5 minutes. Okay, short break muna tayo guys. Charot! Ayan, so ang sagot dito ay, di ba kapag enema, does it paralyze? No, di ba? It actually increases peristaltic activity. So, X tong apple. Ito naman, C, it doesn't cause constipation kasi nga it increases peristaltic activity. Enema results in increased water absorption in the bowels. This is true. Pero, ano yung may connect siya? History of cardiac illness. Yung boy. It produces vagal stimulation that is dangerous to the cardiac patient. Ayan. So, yung enema daw, it may sometimes cause reflex vagus nerve stimulation which may cause lowering of the heart rate. Ayan. Kaya, rectal stimulation is contraindicated for some people because it may cause an excessive vagal response resulting in cardiac arrhythmia. Okay? Ayan. Kapag masyado daw na stimulate ang rectum. Alright? So, 50 is boy. 5, 4, 3, 2, and 1. Ayan, guys. Thank you so much. Thank you din. Ayan. So, kamusta pala ang mga scores nyo? Balitaan nyo naman ako. If ever may mga questions din pala, oh my gosh, nakalimutan ko i-discuss yung, ano daw yung usually na binibigay. Ay, usually na binibigay. So, hypertonic, ayan. Kita nyo ba? Hello ka ha. Ayan, kita nyo naman yung, ano diba, yung sticky notes yan. Hypertonic uterine dysfunction is difficult to treat but repositioning short-acting tocolytics. Ayan. Ay, ang taray, may nagsulat pa. Vandalism, charot. Okay, ayan, short-acting tocolytics. Meaning ng tocolytics ay to decrease yung contraction, okay? And discontinuation of oxytocin, if it is being used, analgesics may help. Alright, so, yun yung sagot sa tanong kung bakit ka mahalaga. Charot, ayan. So, analgesics may help in hypertonic uterine dysfunction, okay? Ayan. Alright. If ever may question pa, gutom lang yan, ma'am. Oo nga feeling ko nga hypoglycemic na. Thank you so much din. Yung Anki. Ayan, helpful daw. And your follow-ups pati po yung Anki nyo, super helpful. Oy, thank you naman ha. Helpful, 'di ba? Ang tagal na nung Anki na yun, pero helpful pa rin. 'Di ba? Nakakatuwa naman. May silbi pa siya. Appreciate po, ma'am. Thank you so much din. Thank you so much, guys. Ayan. So, ano ba? May klase pa ba kayo after nito? I mean, for the following week? Meron pa ba? Wala na. Ayun, nasa tayo, guys! May exams pa. May exams pa. So, answer na lang yung exams. Alright? And then, sabak ulit after Holy Week. Okay? So, thank you so much, guys. And have a, meaningful Holy Week. Ayan. So, thank you and goodbye. Bye-bye. Thank you so much.